Okay, number 4. Are there any extra items not appearing on the post agenda today? And I know we do have one. We have an item. Carol, do you want to present this, or you want me to present it?
I think Supervisor Brown will probably want to present it.
Okay, yeah, but I just wanted to make sure that we had an item 4.1. Okay.
Yes, I encouraged everybody to refresh their browser, and it's also uploaded where the public can see it in the usual, when the public accesses the agenda in the usual place.
Okay. Supervisor Brown.
Thank you. So last week we approved a letter to the Board of Barbering and Cosmetology, and we heard back from them fairly quickly. I thought I was kind of surprised at that, indicating that they really didn't have the option of lifting that restriction, even though it's their restriction. And they indicated that it would take an executive order. So I'm asking that we forward our letter along with their response on to Governor Newsom for that.
Okay.
And obviously that came after the posting
First
of the.
You have to qualify as the extra, yeah.
Yeah,
correct. Yeah, that's right. Yeah, and it did come up after that and needs to be addressed right away. So I'm asking that we take it up as an extra.
And the time and the urgency is just to get it to them as quickly as possible. Or?
Yeah, these folks got to get to work. You know, they're
right.
out of work for 7 weeks now. So
was that
asking?
Just wanted to clarify.
It was, yeah.
What was said.
Yeah, thank you, Mo.
Yeah. So if that was a motion, I second.
Okay, there's been a motion and a second to accept this as an extra item. Carolyn, can you do the roll call vote, please?
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
All right, excellent.
Did we get public input on that?
We will when we take it up, I suppose.
Yeah. When we take it up, we'll do the public input. And, being that don't see, I know that we have so what we'll do is we'll come back to that item.
That's fine.
Is get down to our 901 item, which is item 6.2, which is our presentation by Dr. Pace on our COVID-19. 1 second here.
And Mr. Chair,
I'm sorry, it's item 6.1. I apologize. What was that, Carol?
I was going to say that we're really fortunate. We have lots of public participation in the room today. We have 65 participants.
Okay.
So we're likely to have a lot of verbal comment, and I have a lot of email comment to share with you as well. And in light of how it is working when we have a large number of people wanting to speak, when Jake unmutes the room, there's always a lot of background noise. And so yes. I wondered if it would be better to switch to the system where participants raise their hand so that you can address them that way, because then I think Jake can unmute each one. And Jake, if you would offer up your thoughts on that, it might be better to manage a larger group. Jake?
Yes, I was actually writing out a response right now for everybody. Raising your hands will be a preferable route to make a comments on this round. You could find the hand raising option if you open the participants window. If you guys have any questions, feel free to chat to me on Zoom and I'll help you out to find that hand raise option.
Okay, there's the explanation. So we will do that.
And Mr. Chair, from Dr. Pace, he is on the phone today, not on the Zoom link. So he is here with us, but just so you know, it's by telephone. By
telephone, okay, excellent. All right, so we'll go ahead and move to our 6.1 item, our 9:01 a.m. item, our timed items here, consideration of update on COVID-19. Is Dr. Pace live right now? I
believe he is. Dr. Pace, are you muted? Jake, we need to probably figure out which one he is so we can.
Yeah, we have some phones here.
I think I'm unmuted now. Am
There
I
you
on
go.
there?
There he is. Good morning, Dr.
Okay.
Pace.
Good morning, everybody. I'm sorry. Somehow I have the phone link instead of the Zoom link. So good morning, everybody. Thank you for the chance to talk again about the COVID situation. I'll try to move along sort of quickly today because I know a lot of people want to talk. And I think, so basically in the general region, we're sort of at the same place. We continue to have new cases. There was a recent death in Sonoma County. We on the state level, it seems to be about stable in the Bay Area. Down in LA, they're still getting new cases, new deaths on a pretty regular basis. One of the things is that I think is really important for everybody to keep in mind is as we start moving into this next phase, the predictions is that we're going to see a rise in cases. It seems like from the news reports that the president's office is even reporting increasing up to like 3,000 deaths a day during the summer. Now this is modeling, so we all know that doesn't necessarily hold true, but it's I think it's really important backdrop that even though we feel somewhat protected in Lake County, that this virus is out there, it's going to be out there, there's going to be sickness and death, and it's going to pop up in different places kind of somewhat unpredictably. And the main tool we have to control it is the distancing and the shelter in place sorts of things. So that's just kind of a backdrop to everything. We are also very well aware of the economic impact and the social impact, and I know that's on a lot of people's mind. So we did get an 8th case confirmed yesterday. This is a person in the jail. This was picked up by some surveillance testing that the sheriff had done, and now they're doing all the appropriate actions of testing other people in the area. And so far there were 100 tests done. This was from a couple weeks ago, and 90 of the results are back yet, and this is the only positive. This was some staff and some inmates. And we're going to go ahead and get some testing on all the people that have had some contact with this person and see what exactly is going on there. So outbreaks in the jail can be particularly worrisome. This one may be something that's already sort of passed, or it may be something that's brewing. We don't know right yet. So that's part of what's happening with the testing going on right now. The other 7 cases, so 6 of them have recovered, and the 7th one is doing fine at home, complying with home isolation. So I want to talk a little bit about the preparations, because this is really important in terms of recognizing what the governor is going to allow. Basically, the different counties need to be have good preparations in place so that when the cases do start surging, that we can recognize what's going on and respond appropriately. So the first part is testing, and testing is the biggest challenge for us in the county right now. We've done approximately 600 tests. As of today, we're starting our first drive-through testing site in the county. We're going to do 2 of them this week, one today and one on Thursday. We can do up to 50 people a day on that. It's going to be a place where you can drive up. Well, basically, if somebody wants to get testing, they get on the website, there's a screening form, they get an appointment, and then when they come for the appointment, they'll drive up, stay in their car. Somebody's going to, one of the nurses or the EMTs are going to put a swab in their nose, and then it'll go off to the lab, and the results will come back in a day or 2. So you're not going to have a doctor's order for that. That's going to be basically based on the screening form and working through that. So this is a big deal. A lot of staff time has gone into this. There's a lot of effort that goes into putting in one of these things that we don't really have the staffing in the county to do this. We've been trying to get some help from the state level and on a couple different pathways, and but it seems to be slow coming through, and it seems like it's not clear exactly if any state help is going to come through or not. We're on another call this afternoon, and we're somewhat optimistic about that. But, basically what's happened is they've put up a bunch of these test sites around the state, and there's been some problems with them, and they're probably, it seems a little bit dubious that they're going to be extending them more, but we're still working on it. But until that point in time, we're going to keep doing it with this homegrown version that we got going now. The community medical providers are also there. We've given them some more sampling supplies, so they're starting to expand their ability to do testing as well. So the next piece of this that's going to be on the governor's checklist is about contact tracing and isolation for people that are positive. So we do have some staff that are trained in this. We've got some protocols in place, and this has been working fine with the level of people that we've had so far. If the cases start expanding a lot, it's going to be a little more challenging. There is a state workforce that is starting to get trained up, and that's going to be available to help with this. And so if we get a bunch of cases, we'll probably be using our local staff, and then when they get overwhelmed, then we'll connect in with the state and do that. A couple of the other things are the nursing facilities are one of the places that we're particularly concerned about being vulnerable. That if you watch the news, you'll see that there's a lot of problems in the nursing facilities around the state and around the country. The 3 nursing homes in the community have done really well. They've been masking the staff. They've been not allowing visitors, and we've been doing some screening testing of the staff. All those have been negative so far. We haven't tested everybody, but a handful of staff in each facility, and we'll just plan to keep doing that. There's also, most of them are testing anybody that comes in from outside the hospital. When they come in, they'll kind of isolate them for a day or two, get a test on them, make sure everything's okay. And then if that's negative, then they can kind of go into the regular routine. The hospitals have continued to be very good partners, doing a great job. They are now starting to move after the governor relaxed and allowed elective surgeries. I think they're moving forward with allowing some of that now, so people can start contacting their providers and seeing if they need some more kind of regular maintenance health care. They can start having that conversation and see whether they're prepared to be doing that yet. So I think the main thing everybody wants to talk about is what's about the opening and moving forward with how to start moving back towards normal. The governor came out yesterday, and we've been trying to stay in line with what the governor's allowing. The state law is the one that sort of sets the bar, and then we are allowed to be tighter than them, but not allowed to be looser. And yesterday he came through, and there's been a big sort of controversy and a lot of pressure from the smaller rural counties that have not felt that it was fair to have us be treated in the same way as the large urban areas where there's a lot of cases. And, so there's been a lot of discussion, a lot of pressure, and he seems to have finally heard that and is willing to shift. Basically, from their point of view, they're really wanting not to pull back too fast and allow a big surge of cases and a lot of loss of lives to occur from that. So they're trying to balance all these different concerns together. What he announced yesterday was that we can move from phase 1, which is what we're in now, which is kind of getting the workforce together, getting the testing capacities in place, making sure things are stable, that we're not continuing to see a bunch of new cases. So that's phase 1. And he says that as of Friday, as long as everything stays good, we can move into phase 2 as a state. Phase 2 is where they start relaxing some of the restrictions on businesses. So the first part of that they're going to allow, supposedly starting Friday, if everything stays stable, is that retail businesses can start doing business with people coming by for curbside pickup. So it's a small opening, but it is an opening to allow, bookstores, clothing stores, sporting goods stores, these kinds of places to open. People call up or do something online, and then they can come and do curbside pickup. All the rules and regulations haven't been shared yet. They should all be coming out in the next couple of days, but Friday is the day he's targeting to open that. Then so from that point, he's shifting and allowing more regional variation. So this is the first letters from the board, the conversations we've been having, the frustration amongst the public. So he's basically then saying that in places that are stable, that there's not many cases, and that they have the workforce and the infrastructure in place to respond if there is a surge of cases, that they can basically get an attestation or an accreditation, which will allow them to move faster through the rest of phase 2. We can't go into phase 3, which is a much more expansive phase, but we can go more quickly than the state as a whole through phase 2. So what that means is that if we in Lake County can demonstrate that we have all these things in place, that we'll be able to open things quite a bit more quickly, which would be like restaurants, maybe starting with outdoor dining and then maybe moving into more social distance indoor dining. The social distancing part is going to be just woven into this whole part of it, that everything is still going to need to have social distancing, and probably a requirement to wear masks inside the stores once we start going more indoors with each other. So, I think of this as a 2 or 3 step thing. The first step is on Friday, we should be able to move forward to doing this, opening some of these retail stores and doing curbside pickup. And then after that, as we understand better what they're allowing, what's going to be allowed in phase 2, once we get the plans in place, then we can open up more if we are doing well and if we are not seeing a lot of extra cases and we are able to manage what's going on. So, this is kind of the green light I think we've been waiting for. We hadn't really had any of this up to this point, and now we can really start putting things into place. So what I'm sort of suggesting is we do 3 things. One is by Friday that we align with the governor's orders and just sort of eliminate the different specific things that we had in Lake County, and just kind of hook on to the governor's orders, so it'll make it a lot easier and a lot less concerns about discrepancy. The second thing is, and so that would mean basically opening for the retail stores to be able to do curbside pickup. We're going to have to see exactly what, as they roll this out, what that means. So I'm sure a lot of people will have questions. Does my store qualify? If you go onto the governor's page, there's going to be a lot of stuff that they're talking about. It's probably going to shift a little bit, but the information is still coming out. So I don't have a whole lot of specifics on that right now, but if you go onto the webpage and look at phase 2 and phase 3, you can get a sense of what the difference is. And so the first part would be to align with the governor's order and open the retail sites for curbside pickup. The second thing is to talk about the lake. The lake has been a big issue for people, and we've been trying to open it slowly and kind of methodically and carefully, so that we're not seeing a whole bunch of cases. 2 weeks ago, 2 weeks ago and Thursday, a couple days, we opened it a little bit to allow some fishing and allow the non-motorized boats out there, and it seems like things have gone pretty well. We have not seen a surge of cases yet, and it seemed like people were, for the most part, able to keep the social distancing. We've been meeting with a group of people around the lake, a group of people that sort of help manage the lake, and we've been talking about what we had talked about last week was going to try to open on the 17th, so kind of 2 more weeks. But, it sounds like it's probably worthwhile to think about moving that up a little bit and seeing if we can get all the workers in place, get all the all the quagga mussel sticker kind of situation in place and move forward with that. There was a lot of discussion about whether we should keep the public boat ramps closed, and so that would allow the local folks to come in versus opening them all up. And I think the general feeling was that they've been, for the people that manage this stuff, it would just make more sense just to open the lake up. And so we're in the process of trying to work on that. I think the main question is going to be timing. Like I said, the last time we met as a group with the kind of the people that work with the lake, we were thinking the 17th, so another 2 weeks. But I know there's a lot of pressure on that, and so I'm hoping we get to meet again today or tomorrow with that group and try to figure out how to do that. There's going to be issues with it. There's, the bait and tackle shops, the boat repair shops, hotels. Part of the goal is to try to keep the folks that will be coming from outside of the area, try to keep that travel down to a minimum. The governor is still not allowing non-essential travel out for long distances, and but there's not really a way to monitor that well. I think that at this point, the governor is not going to be allowing hotels or sit-down dining to happen or those kind of things, and so those will still be the same. So kind of the support services that wrap around that are going to have to open more slowly. So we're just going to have to work out some of these logistics. But I think part of the way to limit the number of folks coming from out of the area is through managing the hotel and vacation rental sort of part of this. So again, this is, we're just trying to work through this as best we can in short periods of time with not a whole lot of warning, and to make it so it's not confusing to everybody. And we are having a lot of discussions behind the scenes with the different people that are involved in this so that we can try to roll it out in a reasonable fashion. So the first part is aligning with the governor's order and opening retail with curbside pickup. The second piece of this is the lake, which we're going to keep talking about this. I think it's not a matter of whether it's going to open, but when and what's the best timing, how to coordinate this the best. And I know a lot of people have a lot of opinions about that. The third piece of this is the accelerated opening through phase 2. And we need a lot more information. The governor just sort of sketched out what he was doing. We have some idea about the benchmarks that we're going to need to meet. And we meet all of those. The testing one is the one that's a little bit sketchy. We now, with this new drive-through test site that we're getting up, if we get that going, that's going to give us the amount of testing we need. What he's saying that we have to have in place is every day we have to have the capacity to do one test for every 1,000 residents. So that means 67,000 residents in Lake County, so that means 67 tests a day. We have to have the capacity to do it. Doesn't mean we have to be doing it, but we have to be able to do it so that if we start seeing, outbreaks and things, that we can kind of actually test and manage it. The medical community now has a lot more ability to do it, and with this pop-up testing site, that should get us, we should be able to do 50 a day with that. And so with another 20 to 30 being done in other places, we should be able to meet that goal. What they really also want is that within 2 months, we should be able to double that, to do 2 tests for every 1,000 people. So that's going to require probably some help from the state. And as we have a couple months to do that, we're working with those folks. And I think this is going to continue to improve in terms of the supply chain coming in and in terms of the sampling capabilities. So I think we're on track with that. It's today's the first day of this thing. It's probably going to be a little bit of a flail, which these things always are. But by next week, I think we should be seeing that we have some consistency and that we're going to be able to do it at a couple different sites around the lake and have access for people that need it. So I guess what I'm recommending is for these 3 things. The first one is the retail with curbside pickup. The second thing is to figure out the timing for opening the lake and getting the logistics in place with the folks that are managing that. And then the third piece is this accelerated expansion through phase 2 that's being allowed to the counties that are ready for it. Our number of cases has been fine. We've been managing that fine. It's mainly once we get the testing in place, and then once we get the plans with the businesses, and we sort of work through which businesses and how to do this in a safe way, and how to help people maintain social distancing while they're out there getting involved in commercial activity. That's going to be the point of this. We have a working group that's been helping with this. That's mainly, that I've mentioned a couple times the last few weeks, and we're going to be working on this over the next period of time and taking input from the business community. We have now on the webpage, there is a template that different businesses can use that I think is getting pretty widely spread now to help plan and help communicate with us about what their plans are about keeping their workers and the public safe and protected during this time. And so, what I would say is that's probably going to take us a week or two to get the testing in place, kind of get our plans and proposals kind of all lined up and be able to communicate this coherently. And that'll also give us time to see how the cases do over the next couple of weeks with this level of change that we're doing now. I think that's probably a good start, and I'm assuming people will probably have a lot of questions and comments. So I think I'll probably just stop there. But this is definitely progress, and I think we are appreciative of all the cooperation people have done and understand that there's a lot of strong feelings and a lot of difficulties out in the community right now with the businesses being closed and everybody being stuck in their house. And we have to move. I want to move as fast as we can, but also with an eye to keeping people safe and, balancing this out and balancing the needs of the different parts of the community. The more vulnerable parts of the community have a little more anxiety around opening this up and people coming in from out of the area. And other folks, are like, hey, it's probably okay. It's not going to hurt me that much. And so we're just trying to balance this all out, because all we really have, the main tool we have, is slowing the transmission by keeping people apart. So I think I'll just stop there and see where we go. But thank you very much.
Thank you, Dr. Pace. Supervisor Brown?
Well, I want to ask about, and I know the sheriff's probably going to want to weigh in on this one too, because I know it's a little convoluted the way the testing was done at the jail. But I don't know, is public health involved in that now, or? And the question I have is just how extensive this could be in the contact tracing, who's doing all that, because I know it took over 2 weeks, or at least 2 weeks, to get the results back when it should have been just a matter of days. And in the meantime, it was I think it was the 19th the testing was done, and the 13th is when the state issued the zero bail, and there were nearly half the jail was released before that for policies that the sheriff had. And the person, I got a call from the patient's family yesterday, so I know that that person's been in there for several months, so that it was obviously brought in to the jail, and so a lot of people have been released since then, around that time, and a lot of people have gone to court, and there's been a lot of opportunity for contact before we finally got the results back. And I know it said that the patient was asymptomatic, but I'm not sure if they're asymptomatic now that they're recovered, or if they were asymptomatic at the time that the test was done. I'm not really sure about that. So.
Yeah, I'm happy to talk about it, but why don't we let the sheriff talk first, and then I'll give you the public health perspective on it.
Okay.
Sure. Obviously, Supervisor Brown knows who the person is, but out of respect to their privacy, I want to try to avoid any details that might allow people to figure it out. What I can tell you, unless they're, if they come out and waive it, that's fine. But what I can tell you is that the testing was different than anything else that had been done. We purchased 100 tests at the time. The tests were very difficult to come by. So we decided that would be a very good idea, and turns out it was a good idea to implement testing of 75 inmates, 25 staff, and service providers out there. So this is probably a test that wouldn't have been detected, especially due to the fact that she was asymptomatic at the time that the test was administered. So yeah, and as far as the results taking a long time to get back, the lab that we used, we didn't use the public health lab here because these weren't public health tests. They were purchased directly from the sheriff's department. And the lab that we used is located out of state, and we were not a high priority. Two things happened. We were not a high priority because it wasn't a person that was asymptomatic or indicated exposure. It was just a surveillance test that was done. So it took less priority than those people or those tests that they were performing that were actually symptomatic people or suspected exposures. The other thing that happened is this lab processed tests from all over the country, and there are multiple lake counties throughout the country, and I think there was a little bit of confusion on their part on which lake county belonged to, or which test belonged to which lake county. So that's the reason for the delay. What I can say is that I don't know if testing would have actually ever got done. I'm glad we were able to ferret it out. I hope we got it out in a quick enough time that we can keep it contained. Your questions about whether or not the person's asymptomatic, when, where, I don't know. I don't have those answers. Part of the contact tracing, the investigation will probably be able to answer some of those questions. I just don't have answers to those questions right now. But what I can tell you is that the contract tracing is happening. Public Health is working with this. WellPath, the service provider that provides medical services at the jail, is working on this. WellPath is a nationwide company. They have jails all over the United States. They've dealt with outbreaks in other facilities. Our regional manager, we are the first facility in her region to have a positive case, but she still has the resources from the rest of her company. And they've had facilities in other parts of the country where they've actually dealt with deaths of staff members. So they're very familiar with the processes involved in this. They had a protocol in place. We had already taken steps in preparation for this occurring, and we were able to respond very quickly, get everybody isolated, start that contact tracing process. We're going to be offering up testing for all of the staff members out there, and I believe for all of the inmates. Again, that'll be dependent on the amount of tests that are available, but we're working with the Public Health Department as well as WellPath to try to get up enough testing materials and get them down to the laboratory and returned in a very timely manner. So I don't know if that answers all of Supervisor Brown's questions, but that'll be a quick update on what's happening at the jail.
Yeah, and let me weigh in a little bit too, because it's, the jail is a very vulnerable population. We've seen some really bad things happen in other parts around the country. So when the sheriff is absolutely right, this was a great thing to do. The surveillance testing was a really good thing. And this just shows the problems with the testing all around is these things get a lot slower than we want. And then you get this result 2 weeks later and have to try to sort through it. But so I absolutely agree. This was a really good program. I'm really glad they did it. And now we have to kind of sort through what the meaning is. Supervisor Brown, you're asking all the right questions, like what, who was this person in contact with, et cetera. Luckily, the jail, or not luckily, but the good thing is the jail has been very proactive in taking care of business there, and they're way out in front of this. They've been trying to decompress the population and keep some space between people, limiting visitors, putting procedures in place from quite a while ago that was really going to help protect people. And we have not seen a big surge of illness out of there that was concerning. The folks in the clinic there are paying attention to this, and so we're just going to go back now, and we're kind of working through the people that they've had contact with. And at this point, 2 weeks later, with somebody that's essentially asymptomatic, it's they would be off isolation by now anyhow. So the question now is really going back from a detective story point of view and try to figure out who they were in contact with and trying to test other folks to see whether it's kind of percolating under the surface in the jail or out in the community from some of the people that we're in contact with. So again, this is why we've put these shelter-in-place orders in place in the community, and also they did a lot of the things in the jail to try to protect people, and it's been working. So now, now we just kind of walk through our processes and see where we can uncover it now. So.
And so early on yesterday, well, matter of fact, we just found out about it yesterday. So already one benefit that we have to assist with the contact tracing is our records management system or jail management system there. We're able to provide a lot of information that's just not available to people that might be out in some other business. We know, when people were moved, when checks were done, those types of things. So we're working hand in glove. We have somebody assigned from the jail to work with the public health department and WellPath for that contact tracing. So I'm pretty confident we're going to be able to have a very good picture of who was exposed if we don't already.
So that was going to be my other question. So you're working with public health for the contact tracing, and the reason it seems to me that would be the wait, and maybe be any additional testing done on that from your staff, Sheriff?
It was, so I don't know if it was on my end or your end. It was a little bit garbled transmission. Can you restate that?
Yeah. Will you, all of it, I'll just state all of it in case you didn't hear all of it. The contact tracing, I'm glad that it's going through public health or working with them, because that way it's a consistent method that they're using. And then the other thing is, will you be doing more testing out there?
Yes. Yeah, we still have 9 tests that are outstanding from the initial surveillance testing that we're doing, and we're going to, as I said earlier, we're going to test all the staff, or at least offer it up to all the staff and all of the inmates that are out there.
What is it something that public health will be involved with? And the reason I'm asking that is, like, after a couple of days, the tests don't take that long once the lab has them,
right.
And so after a couple of days, maybe somebody could follow up and say, hey, where are those tests, instead of, waiting 2 weeks for the person to recover and infect, 20 other people.
Yes.
Thank you.
Yeah, public health is involved in this. We're gonna be helping get the testing done in a quicker fashion. So, because it makes a big difference. If there's no other positives out there, then we got lucky. If there's a bunch of positives, it changes everything, and then we have to kind of go and work with it as a early outbreak. So yeah, we're very interested in this, and we're working closely with the sheriff and his staff about getting testing.
Thank you, Dr. Pace. Supervisor Scott?
Yes, Dr. Pace, have we looked into antibody tests, or how that's going to be coming into our community, not just to see how it might be widespread in our jails, but in our communities? Do we see that in our future?
Great. Yeah, sorry, I meant to mention the antibody test, so thank you for asking that. So the antibody tests, yeah, so the tests are just coming out now. I know Supervisor Brown has been in conversation with me about this, that Quest now has direct access to antibody testing, so somebody can go online and sign up for it and get an appointment and go get a blood draw and get a test. Don't even need a doctor's order. At this point, I don't think it's covered by insurance, but I'm sure it will be in the near future. It's $120. But the local Quest appears to be closed, I guess, because of coronavirus, and so you have to go all the way down to Healdsburg to get it drawn. I'm reaching out to see what we can do to help with that. You can go get a draw at the normal place you get lab draws, and but you're going to need a doctor's prescription for that to get it. So to get this special one, you have to go down to Healdsburg or other locations right now that's not available in the county. There are some small machines that are coming available. They're not as reliable, and they're fairly expensive. I'm not sure any of those are going to be in the county. I know Tribal Health has been working on getting one, but so the short answer is you can get it now if you talk to your provider and get a prescription for it and go get a blood draw, or you can get it done yourself without a provider's prescription by signing up online at Quest and going down to Healdsburg and getting it done by appointment. And I think in the next couple of weeks, we've got some people looking into this to see if we can, how we can get it done in the community a lot easier for people, because I know there's a lot of interest. there is some caution in that we still don't really know how to use this in terms of managing the outbreak and in terms of the kind of things we're talking about in terms of allowing businesses to open and things like that. We don't really have enough information on it yet to make those kind of decisions, but I know a lot of people want to go out and just see, like, do I have antibodies because that cough I had back in February that just wouldn't go away, was that coronavirus or not? And so the short answer is you can get it done in the county by getting a blood draw with your doctor's order, or you can go down to Healdsburg and do it by without a doctor's order, and you have to pay cash for that one. I think if you get your doctor's order, it should be, or it's going to be covered in the near future if it's not now. So
now, when people go and get these tests, does the information funnel down to public health so they're aware of the results of these tests?
We have gotten a couple of these tests. Again, this is not so. It's so early that I'm not sure we're getting all of them. I'm sure we're not going to be getting them all from the machines that people have. But it's we are getting it. It's not, we're not using it the same way as we are the viral test, the PCR test that's out there now. So it'll take a little thinking to figure out exactly how to use that.
Thank you.
Thank you, Supervisor Scott. Supervisor Brown?
So in answer to Tina's question, I've done a little research on this, been in contact with Quest myself, and right now they're not sharing it with the county that you live in, the results of it. There's dozens of people from Lake County that have already done it. They started Monday with it, and all you got to do is go online. You can get it. It's $129. Insurance doesn't pay for it. A provider, depends on the provider, but the provider that I spoke with said that they wouldn't do it unless there were some symptoms that you could readily identify. They're just not doing it just randomly. But that just depends on the provider, I guess. But as far as Quest goes, you can go to any Quest location. If you go on their website, it gives you a choice of which one you want to go to, and you can schedule your day and time. And it's pretty fast, and it's 5 days turnaround for the results.
Thank you, Supervisor Brown. Supervisor Crandall?
Yes, Dr. Pace, I just had an interesting question about veterans. And I don't speak about all veterans per se. I speak about the ones that, like, dating back to probably the OIF. We've been pumped with, like, anthrax vaccinations, all of these different things. And there's a lot of thought out there. I've been trying to look this up myself. There's a lot of thought out there that we feel like, we've been pumped with so many vaccines and whatnot that we're somewhat, probably have some things that may keep us immune to this or whatever. And I don't say immune, but just not as susceptible. And maybe if there's a way we could look into that. I don't know if you could talk to any, like our local VA or any other hospital or anything like that. Because just thinking about antibodies, if that's the case and we can find out more things like that, maybe veterans in that time frame have something that can help aid to this. The reason I say that is there's a lot of veterans that have called me and talked to me about it, said things like, I don't think I'm going to catch it because I've been pumped with all these different vaccinations. I've been in a country where we've had to eat food with flies on it and whatnot and never got sick. So, just things like that. So I I don't know if that's really a question or just wanted to kind of put that out there.
Well, a couple quick comments from that. I think it's an interesting question. I'm happy to look into it. I have not heard anything about that, but that would be worth looking into. I think it would be interesting to see what the statistics are in the vets hospitals and stuff around the country. Like that would be easy enough to look into to see whether there's less incidence of it in vets with a similar age range. Usually the way these things work is the antibodies are pretty specific to a specific virus. And so it's, that's from a scientific point of view, I'm not sure it makes sense, but sometimes things work even though science says they're not going to. So I think it's probably easy enough to look into that. So I'll reach out and see. And if I find anything, I'll let you know.
Well, and I say that too because a lot of veterans are saying, like, I'm not worried about it because, of all these vaccinations. So, it's just something to get cleared up, because what I'd hate is to have a false sense of security, and then, you know, they start catching it. You know what I mean? So that's also another reason for me bringing this up.
Thank you.
Thank you, Supervisor Crandall. Supervisor Sabatier, or do you want to hear from the public first, Bruno?
I want to hear from the public.
Okay, excellent. Yeah.
Thank you.
I'm of the same mind at this point. So I know we have a lot of people in the room today. Obviously, Dr. Pace, thank you for bringing us up to date. Thank you very much about the information about our situation in the jail. And we'll continue on that. But from this point, what we'd like to do is go ahead and I know we got written comments and we have public comments through Zoom here. Please raise your hand as you're doing that. We're going to keep the go ahead and move forward with 2 minutes for public comment. So if you could please keep it to 2 minutes. We've got a lot of folks that probably are wanting to talk on these issues that we talked about. He kind of laid out 1, 2, and 3. And ultimately, we'll try and get through as many as possible and then bring it back to the board for some roundup discussion at the end. So we'll go ahead and open this up for public comment. Carol, do you have written comment?
Yes, Mr. Chair, I have quite a bit. Do you want to start with the hands raised in the room first?
Yeah, let's all right. Just wanted to, you know, understand what you had.
Yeah.
So, yeah, let's start with the hands right.
At your request, I'll keep the 2-minute timer, and when the timer is about to go off, I will unmute so you can hear it going off. Okay?
Okay. Yes. And so I see we already have 4 hands up here, the blue hands up. So Jake, I can't tell who came up first, obviously. So let's just work through them, the ones that have their hands raised.
Okay, I'm just going to start working through the list here. The first name that I see is Brian Dabrowski.
Okay, go ahead, Brian.
Brian, I'm gonna there you go. Looks like you're unmuted. Can we hear you?
Yep. Can you guys hear me?
Yeah, we hear you.
Okay, here we go. So with the new case in the jail, why is there not a high number of cases in the jail and the community already? I'm starting to feel like at this point, sheltering in place is not a constructive path for the county. I hear that, or I hear what the health officer is saying, but with the small number of people found infected, it seems like quarantine of the sick could be just as acceptable. If the state continues to drag their feet, at what point does the county take the situation into their own hands? I understand the county relies on funding, but the people are reliant on their ability to work. Lastly, why is it that all of a sudden our ducks are not in a row to enforce the quagga mussel program, and how is enforcement of that measure any harder than it is every year? And that's all I got, guys.
Thank you, Brian. I don't know if you would like to, Dr. Pace, answer anything about the jail question.
Yeah, that'd be fine.
I my sense was he was sort of making a statement and not really asking a question.
Okay.
I mean, I'm happy to respond, but it's.
No, it seems like there is going to be some more information coming on. That's exactly what you and Sheriff Martin are working together at this point to figure out what the extent of the exposure is at this point, and there'll be more information as that's worked through. Okay, let's go with Jake. Keep moving down the line here.
All right, so the next hand that I see raised here, we have Sally Peterson.
Hi, good morning. My question is from Dr. Pace as the health professional. I've been reading quite a bit through the news outlets and the New York Times and those kind of outlets about the big problem that we're having is the reliability of tests, where the FDA has actually put a mandate on these testing companies to actually prove their reliability within the next 10 days. And so I'm wondering what your comments are, Dr. Pace, on the different types of testing that's being used in Lake County, and how that can be a true barometer with the status of Lake County in the reliability of our testing.
Are you saying antibodies or testing? Testing for the virus itself?
Yes, testing for the virus itself. That apparently there's a lot of reports coming out that it's just a lot of the different tests are not reliable. And the FDA, there was an article I read this morning that the FDA issued a mandate to all the testing companies that they had 10 days to prove the reliability. And so it just makes me wonder that, you know, the little bit of testing that we've finally been able to do here in Lake County, you know, is it really a true barometer to our, you know, our status? Because, you know, there's one thing to know that we have 8 cases, but if the testing that we've done has not been reliable, then do we really know where we are?
Well, so, right, these are the questions we ask all the time. How good is our gauge of what's going on? I'm pretty sure I'm going to look what you're saying up in the New York Times this morning, but most of what I've seen about the questioning of the validity of the testing is really about the antibody testing, not the PCR virus testing. So there's a huge problem with the antibody testing. It's brand new. There's a lot of companies are jumping on this because they see a huge entrepreneurial opportunity, and they're not bearing out. They're not very valid at this point. So I think that's the main question. But there are some questions about the PCR testing. Mainly the questions with those are around these little quick turnaround machines that are going out to the clinics and the hospitals. So the Abbott machine. There's a couple. Gene Expert is another one. These are ones that you can go and get a test done, and the results come back in 45 minutes. The ones that they're calling the high throughput labs, which are like the Sonoma County Public Health Lab, Quest Labs, the UCSF lab, these are the ones that we're using predominantly, and those have really good diagnostic accuracy. I mean, as good as it can be right now. So, and I think the other part of your question is that you know, the testing is one piece of this. There's also the fact that we're not seeing a huge push in the clinics or in the hospital. So we're not seeing, like, if you look at what's happened in New York City, if you look at what's happened in LA, they're getting this flood of sick people showing up. We're just not seeing that. And the other thing is the stool testing that we've been doing is, you know, another kind of way of looking at this. None of them are accurate all by themselves, but they all are kind of lining up that we're not seeing a huge amount of infection in the community. And when we do find it, we go check the other people that are in contact with them, and they don't seem to be having it and spreading it around the community. So I think your question is absolutely right on, and that's what we kind of have, that critical thought process all the time. But I think the accuracy of the tests that are being used are reasonable. The problem is that we haven't been able to test enough people. That to me is the biggest problem, and that hopefully as of today, that problem is getting a lot better. So thanks.
Thank you. And just a point of clarification, while you were talking, I went back to the article I read, and it is antibodies. So I apologize for that. But thank you for answering my question. I do have, you know, grave concerns about how we are reacting to reopening, and I want us to be strategic in doing that, because we are lucky that we haven't had many cases so far. Thank you.
Okay, Jake, the next hand raise, I see we got 2 more down here.
Yes, the next hand raised is Mark and Lucia. I have you guys unmuted. Can you give me a sound check?
Yeah, hi, can you hear me?
Yes, we can hear you.
Oh, good. So I just want to segue with the comment that the last speaker, which is luck has got a good part in what our scenario is here. I want to thank the doctor for being so diligent and perseverant and keeping us safe here in the community. But so far, you know, there's a healthy dose of luck here, because we certainly have to acknowledge that this is far from over at this point. And in that regard, I'm wondering, is there a plan to make mandatory masking if we do start opening things up when people are indoors in public? Are we going to require that they put masks on? There's still many places, grocery stores and things like that, where nobody is being required to wear masks. Also, is there a detailed process for if we do have an outbreak, a plan that can be pulled off the shelf and put into action to deal with it, that's detailed and specific to Lake County? Or that would be another question. So that if we do have what will likely be, according to other experts, a second wave or a third wave at some point, that we have something formulated to deal with it adequately and promptly. As far as where we're at in the scheme of things, I'd point to the one of the headlines in today's newspaper in the New York Times, which is the headline is "Coronavirus in the U.S. an unrelenting crush of cases and deaths." And while cities in New York have seen drop in cases, other cities are still on the upswing. And if you factor the big cities in, it looks like things are trending down. But according to this article, really things are still trending up. And flare-ups and super spreader events are still expected to happen. And one of the pithy quotes from, one of the pithy quotes is, "Any notion that the coronavirus threat is fading away appears to be magical thinking at odds with what the latest numbers show." So it's not over yet, and we have to be aware of that. And if people come from other places to enjoy the lake, our luck may not hold out. So
yeah, thank you for your comments. Obviously, thank you very much for the information, Mark. Thank you. And you're spot on about where we're at. So thank you. I don't know if you had a comment about the mask question, Dr. Pace.
Sure. I mean, I would like to mention a couple things. I think the point is exactly right, and that what we're looking at is an ongoing struggle with this that will get better and worse, most likely. I think we've done a really good job of clamping down, and now what I'm hoping we can do is loosen up enough so that we still stay safe, and have a little bit of more freedom to do things without going over the line to get a surge. But the surge concern is, this is what keeps me awake at night for sure. We do have plans. There's, really what I kind of talk about every day. The plan is going to be in the short term to test, isolate, contact trace. If that gets overwhelmed, then we start doing surge planning, which is we work within the local facilities, and if that doesn't work, we take people to the regional facilities at this point. So this is a lot of what's been being done over the last 4 months, is really working on these kind of plans. The hospitals, the nursing homes, everybody's been doing the best they can given limited resources and everything. I think the masks. Masks are recommended now. It would be far better if people wore them in the stores. My thinking is probably what I'd like to do is once we get to where we're opening up the stores a little more and people can be out and about more in the stores, that we make it mandatory if you're in the stores for both workers and customers, and that customers wouldn't be allowed in if they didn't have a mask on. So to kind of put it in that sort of arena, that it's just part, if you're going to go in the store, you need to take care of everybody else that's in there, the workers, and the workers need to take care of the customers by wearing a mask. So that's kind of where I'm thinking about going, but this is part of the ongoing discussions about how to operationalize it. But the masks are definitely important. So thanks.
Thank you. Okay, Jake, let's go to the next comment.
All right, the next hand raised I had was from Jonathan Cronin.
Morning, Jonathan. Go ahead. Are you still on mute, John? There you go.
Hey, good morning. I just have a real quick question or comment. I see a lot of traffic at different meth houses up here. I live right next door to one, and 24/7, there's just people coming and going. There's people sleeping out in the yard. They have homeless camps there all the time. I've seen people defecating in the yard. So I get the shelter in place, but what's being done about these meth houses and all the traffic that's coming and going at them?
Okay, thank you. Sheriff Martin, did you hear that comment? I would, the recommendation would be, I don't know if, Brian, if you'd like to comment.
I don't know if this is on the board agenda item or not. It doesn't seem to be related to the board agenda.
No, it isn't related to this item for sure. Just made a comment.
Well, it's because of the COVID-19, we're trying to do the shelter in place, and then we have a whole group of people that is not sheltering in place. So I'm just wondering why this other group of people is allowed to roam freely 24/7 when the rest of us are hunkering down.
And I would suggest that this is COVID-19 related in the state, in the sense that police departments, the sheriff department are still actively in our communities. And I think that if you have an issue, no matter which jurisdiction it is, I would say call it in to our law enforcement, and hopefully they'll be able to do something to rectify that problem.
All right. Thank you, Jonathan.
Yeah. He has actually reported that numerous times. It's just gotten more heightened, I think, now since this pandemic. And so now it makes sense why he's bringing it again, because of the pandemic. Because he brought it up before, there's really not too much we can do, but now that it's there, it's just becoming more rampant. And I think the concern in that area is that some of that defecation and whatever else could be a health hazard to getting someone else sick from coronavirus or anything else.
Well, maybe you can follow up with them, Supervisor Crandall, and see if we can help get through that situation. So thank you, Jonathan. Thank you, Supervisor Crandall, for clarifying. Okay, Jake.
All right. The next comment we have will be from Melissa Fulton. I'm going to.
There you go, Melissa.
Thank you. Good morning. I have a couple of things for Dr. Pace, obviously. The first is that I've been hearing that for whatever reason, the governor is not allowing pharmacies to perform tests. And if anyone in our community is capable of doing something like that, it would seem that our pharmacies would be. So I'd like us to perhaps consider that as a topic in our letter that you're going to be discussing a little bit later about cosmetology. It would seem that we've got a resource out here that we're not putting to use at this time that could help us. Also, in reference to that letter that's coming up, it would seem that rather than just asking for our salon operators, cosmetologists to go to clients' homes, it would be much better, and I'm basing this on Rachel Tyrell's protocol that she sent to us in reference to our business survey. She had a very extensive protocol that she outlined for opening her shop, and if it were followed by other salons, I certainly would feel very, very safe going into the salons. It's quite extensive, and it goes well beyond the already required protocol by the California State of Cosmetology, which is quite extensive, notwithstanding COVID. Another thing about opening retailers for curbside, unfortunately, I don't believe, and I have no stats to back it up, but I don't believe that many of our retailers have an online presence, a web presence. So if I want to go to a dress shop anywhere in Lake County and they don't have a website, how am I going to be a customer without going into their store? So I think we need to have some consideration insofar as when we open retail, let's open retail. A lot of the responses we received via our business survey asking businesses what would their protocol be if they were allowed to open that would protect them, their employees, and their customers. And again, very specific protocol that shows that they are using common sense. They're certainly concerned about their health and those of anyone who would come into their stores. And most retail stores of the smaller retail nature do not have a plethora of visitors at one time like our grocery stores do, or even the drugstores when we go to those. So I think that's something we need to have further discussion on. As far as our hospitals, our local hospitals being prepared should we have a surge, my understanding they already are. Thank you very much.
Thank you, Melissa. Thank you very much. Supervisor Brown.
So thank you, Melissa, for that. And I want to say, with regard to Rachel Tyrell and the technical support for websites and these other discussions, these are the discussions that we're having. This house, the Blue Collar Committee, and Rachel's a member of that. And these are the kind of thoughtful approaches that that those folks have come up with. It's not emotional, just open up and no, these people are really, they're very concerned about the safety of themselves, their employees, their families, and their customers. And so these are the kinds of things that are coming up. The plans that are being developed by that group are plans that I'm hoping to work with Dr. Pace on in implementing as quickly as possible. So thank you for that report, Melissa.
Yes, and that is the information that's being funneled to the reopening committee. I appreciate your guys' hard work on that, and all the industry folks that are giving input on that Blue Collar Committee and every industry throughout the county. So I see we have another one, Jake.
Yes, we have a couple more here.
Okay.
I have a hand raised from Eileen Anderson.
Hi, my name is Eileen Anderson. I just want to thank Melissa Fulton. She pretty much said what I was wanting to say, hair salons, they have strict protocols for, disinfecting and sanitizing. Also restaurants, my folks owned restaurants back in the day, and you used a mixture of bleach water, you sanitized everything in between each customer. People are sitting and not walking around, basically, and so I just really believe that it's time to start opening up these local businesses that are losing, most of them are just small families, and the restaurant business especially, I know you're just hanging on by a shoestring. So I appreciate the efforts that it's Melissa Fulton was speaking of. Also, as to the face masks, Dr. Pace just mentioned that, they might make it a requirement to go into these small businesses. It seems pretty insane to require folks to wear a face mask almost 2 months into this pandemic. And there's different studies, you can read one side or the other. They're worse for you than not, it's worse for you, your respiratory system, to be wearing that constantly. I don't know if that's true because nurses wear them all the time, but it just seems quite crazy to require it now. Also, to Melissa talking about the curbside pickup, yes, some businesses don't have a website. You need to actually go in, and I appreciate all the work that it sounds like you're doing. As far as this pandemic is concerned, now there's recent studies, Dr. John Ioannidis from Stanford and Dr. Scott Atlas, also another Stanford doctor, they are coming and speaking out. The modeling in the beginning was way overblown. These doctors are now doing studies with actual numbers, and this pandemic, although the media might say it's one thing, it is not. And then of course there's the controversial doctors Erickson and Masihi from Kern County.
2 minutes, Mr. Chair.
All right. If you could wrap it up, Eileen, and just kind of get your finished thoughts here. Or would you go ahead?
Okay. And then that was my thought, just consider those studies. Also, the quagga mussel sticker inspection, that question was never answered. Why is that not in place when all the years before it has been? And thank you for your time. I appreciate it.
Thank you, Eileen. I know we don't have, so the question about the quagga mussels stickers, I don't know if we have.
Scott on here earlier.
Yes, good morning.
Morning, Scott.
So the issue of the quagga stickers is we typically put our ramp monitors out there on Memorial Day weekend. That's when our boating season typically starts. The issue is we have gentlemen who are our extra help folks who are all in this the category of folks that are particularly sensitive to this. So we have to make sure that we have personal protective equipment for all of them. We have all of our participants that sell the stickers and do the inspections. Those businesses are currently closed, so we need for them to all be prepared. And so there's a lot of coordination. There's a lot of things that need to happen, and we're working on it. And I've directed staff to be ready for when the decision's made to open the lake. We do not want to be the weak link in that effort, and we're doing everything that we can to make sure that we're not. So we're going to continue to do that work, and we're going to be prepared. And when your board directs the lake to be open, we plan to be ready to sell the stickers, both resident and non-resident. Be prepared to do inspections and ramp monitoring. And I need to make sure that you're aware of the scope of this. Last year, 2019, we sold 1,427 non-resident stickers in the month of May. In the month of June, we sold 1,240 non-resident stickers. This is not a small number of folks that are going to be coming here from outside of the area. And so all of those potential boaters that could be coming to Lake County have the potential of bringing that virus, and we need to be prepared. And I'm not putting my staff out there unprepared. And so we're getting ready for it. And like I said, when the call's made, we plan to be prepared to do that. So if you have any additional questions, I'll be happy to try to answer them. But we are working diligently behind the scenes to have all of our ramp monitors not only prepared, but all of the businesses prepared, and the stickers and everything ready to go.
Thank you, Director Scott. Thank you.
So, Mo, can I ask Scott? So Scott, you're wanting to know from us when it would be time, and I know we haven't actually had the discussion, but it seems like recently that's happened by default, and so maybe we should be prepared right now, because I think there's going to be a lot of activity on the lake with the announcement of no enforcement. So I think that's going to be an issue. Maybe we should have that discussion on how we're going to staff that and make sure that your needs are met, and people are allowed to get out on the lake like they should be able to without any risk to the community or to the lake, with not just the coronavirus but the quagga mussel as well.
Thank you, Supervisor Brown.
Real quick on something.
Yes, Sheriff.
I've been waiting because I wanted to wait to hear how long it took for me to be misquoted. There hasn't been an announcement of no enforcement. So I haven't said I'm not going to enforcement. I've told people what my enforcement posture has been. And I knew this would come up. I know it was a topic of discussion at yesterday's board meeting. I wasn't there for the public input because I didn't realize there was going to be public input on a closed session item. I don't know what that item was about. I didn't know, I still don't, but that's what closed session's for. So there's been a lot of chatter about on social media as well in in-person discussions about what happened, and I know I was just misquoted. People misinterpreted what I said. It just happened right there, and I want to make sure that the record's straight. You know, those of us that are in these positions, you on the board, if you haven't been misquoted yet, you will. And I would say that you already have been. People are misquoting your posture of not enforcing evictions and interpreting that as, well, we don't have to pay rent. That's not what the board said, but you're only responsible, as I am, for what you say. You're not responsible for what people understand or interpret. So a lot of this goes back to things that happened last week. And it started out, and I don't know if it started out here, I'm sure it started out well before this, but when things first started publicly coming out was when Supervisor Brown made his comments last week about the actual enforcement of this. He was actually the first person that that I can find to talk about what the enforcement efforts meant, and he talked about businesses that were staying closed, and that if they opened up, nothing's going to happen to them. They'd be in violation. He said, big deal. Who's going to arrest them? Nobody's going to cite them. They're not going to prosecute them. The courts aren't going to hear their cases. He pointed out that law enforcement is exercising their discretion and their judgment, and question whether or not we'd really go out and arrest a business owner because they're open up to sell stuff. He talked about businesses having enough of it. He talked about whether or not the lake was going to be open, and while he was making those comments, I didn't find them particularly helpful, but I also didn't disagree with him. He's absolutely right. What he said was completely accurate, and not an opinion. I mean, he's saying those are facts in large cases. He doesn't represent every single person, but what he said was spot on. So, and if you notice, I didn't chime in and contradict him at all last week. He's right. So, if people want to disagree with me, that's fine. You can disagree with me, but and if you want to quote me, please be accurate when you quote me. I have never told anyone to violate this, and I haven't told people that we don't enforce this. I've told them what our enforcement posture will be, has been, and will continue to be. There's people that are on this very meeting that I've spoken with about this that have asked me, hey, is it okay if I do this? And I've consistently told people it's still the law. The public health officer's order is still in effect. But I've also told people what my enforcement posture has been from the beginning and what it will continue to be. And it's important to realize that this is not just about the lake. There's not a special enforcement effort that's related to lake activity and that's different from the enforcement activity that's related to the closure of the businesses in this. People are going to make their own choices, and we've had a lot of discussion. So following that Tuesday board meeting, we have 3 times a week EOC calls. There was some chatter on that about one of the local police departments changing their posture and not issuing citations as much as they had been. We talked at the lake meeting where I brought up the fact that, hey, we're going to, at some point we're not going to be enforcing this. It didn't seem to garner a lot of interest at that meeting. And then come Friday, when the protest happened, of course, we also got the news that the sewer treatment facility sites got their testing back again. It was a little bit delayed. Sometimes these testings are delayed, but we found that, previously the 4 sewer systems that had tested positive for the shedding of this virus had reduced down to 1 septic or sewer system. And then the most recent test showed that it wasn't there. And at that point in time, we had 1 active case and 6 resolved cases. So the protest came by here. Somebody asked me a direct question. Maybe they listened to Rob's comments the previous Tuesday and felt the same way I did, that, and the question was posed to me, are you going to enforce this? If I go out on the lake, are you going to give me a ticket? So in thinking about that, I have to think about, am I giving everybody a ticket for every little thing? No, we're not doing that. What we're doing is people that are engaged in other criminal activity. We are also taking enforcement action for the shelter-in-place order. As I said to that person, as I said in my written statement, that is exactly what we're doing. I'm not going to make criminals out of good, otherwise law-abiding people. There's people that are out every day engaged, not obeying the shelter-in-place. Yes, I know I'm going to go.
Hey, Brian, if we could, I appreciate, if we could really, what we're trying to do is the COVID-19 update. I appreciate everything that's been said. I know Supervisor Brown had questions.
Okay,
we want to try and
just real quick,
staying on track here.
Just real quick, I realize emotions are high and there's a lot of sensitivity going on here, but I did not quote Sheriff Martin. He thinks I quoted him. I was quoting me. There has been no enforcement. There never has been. and there's not going to be. Writing a ticket is not enforcement. It goes on just like I said. With the prosecution, I've asked the district attorney's office to weigh in. I've heard nothing back from her in over a week. So that's what I was talking. I was quoting me, Brian. So don't worry about it.
A lot of people have been misquoting me.
Okay.
So thank you.
Well, I wasn't one of them.
Okay, well, we'll get this back on track here, obviously. Thank you, Sheriff Martin and Supervisor Brown. I know that we have some more hands up in the room here. Jake, go ahead.
So I wanted to call on Martha Mincer next.
Okay, and we're keeping our comments here, public input on our COVID-19 update, and go ahead.
Well, first of all, I want to thank Dr. Pace. I know you've been doing a tough job and really appreciate what you are doing. I wonder, particularly with the supervisors, if you're factoring into your thinking around the economy a little bit of a longer term, a couple months out when we've got a lot more testing and we have some therapies. It seems to me that a lot of articles are talking about the fact that tourism is going to be more localized. People not flying, they're going to be driving. And there's going to be a lot of people looking for places to relocate because we all know we can do a lot of work from home. It seems a community like ours is perfect for a lot of those things, but only if we are healthy. I think our ability to showcase our being a healthy location is going to make a huge difference in terms of a lot of people's choices. So there's the short term, let's get the dress shop open so they can sell X amount of dresses, as opposed to helping them, for instance, have a website and then do curb. But there's also the somewhat longer term, even if we're only talking 6 to 8 months out, where we could become quite a economically viable and vibrant community when it comes to both tourism and relocation, if we make sure we don't have a surge. If we keep what we have now, and again, Dr. Pace, want to get a sense of when you or the community will become concerned again. Does it take one death? Does it take 10 more people testing positive? Where are we going to become concerned? And again, should we be factoring into our thinking that if we become a lot more prudent around this in the short term, that we would be buying ourselves something dramatic for our blue collar workers, for everyone in this community, if we stay that healthy community, which we are now, given some of the surrounding places. My comment.
Thank you very much. Okay, Jake, or go ahead, Dr. Pace.
Yeah, I mean, I think that's a excellent perspective. How to, I think life is going to be different. I don't think we're going to go back to the way we were before.
No, we're not.
So how do we move forward into a good way into the new era? And I think what you're talking about is really, really wise.
Yeah.
Thank you both. Supervisor Brown.
So that was another topic of the Blue Collar Committee on how we adjust and retool our private enterprise model as we get to this. People are familiar now with shopping online and doing all that. And so, we're actually looking at a possibility of some grant funding that Andy and Jeff Lucas have in order to do some technical support for people to get into that whole thing. Rachel Tyrell spoke yesterday about the Square opportunity where they can they're doing free websites for people, and we can do that locally for everything from restaurants to barbershops, everything, where you can buy these, do this stuff online to pay for gift certificates or products to be delivered. So there is a lot of that because people have been accustomed, and if folks locally want to stay in business, now they have to compete with folks that are accustomed to shopping online and probably want to continue to do that because they are legitimately concerned about their safety and getting out there. And also, as far as the masking goes, maybe it's an opportunity for businesses to actually advertise that if you come shop here, you're required to wear a mask. All of our staff will, instead of making it mandatory. Maybe that's a marketing tool that private businesses can offer. And if folks don't want to do it and folks want to go into that business where there's no mask required, that's their business also. So I think that's something that we need to consider. You can encourage it, but I think making it mandatory just puts an added burden on government that for more things that can't be enforced and won't be enforced. So, there's opportunities out there. So in answer to her question, that is a topic of discussion that we're having in the group involving private enterprise.
Thank you, Supervisor Brown. Okay, we're going to go ahead and Supervisor Sabatier. I know we still have a bunch of public comment here.
Yeah, I just wanted to add to that real quick while that conversation was still alive. Last week, we did ask an admin to look at a not too far in the distant future to bring back economic development. We had started that conversation back in January and February. It's very evident that that conversation needs to keep going. We can't keep our head down looking at just COVID-19. We got to look up and see where are we going in the next 6 months to the next year. And we have some opportunities that we are a low density population. We don't have too many cases. People are going to want to find some decent housing where they can work remotely or use this as a bedroom community for access to their other places. And as far as what Supervisor Brown was talking about with the mask, if you don't think, and I said this before already, if you don't think that in the future of Yelp, reviews will not include how safe it is in that place of business, we don't understand Yelp then. Because it will be all over. They don't wear masks. They didn't clean their hands. Like it's going to be that much more of a specific review, and businesses are going to want to comply with those because they're not going to want those kinds of negative reviews.
And just additionally, I think our county is going to be viewed very differently if we don't have a surge, if we are healthy, if we have put in place, some economic, perhaps in the short term problematic cautionaries. Because I think, as Scott was saying, how many people we expect in over the next couple of months who are coming from places where they do have a lot of virus. So I think being careful now in the short term is going to make a huge difference for this county that was struggling, as Bruno said initially anyway. We could become a real Brigadoon, something that people really want to come to because we are healthy and rural, and we did what they will see as the right and safe thing for those people who are concerned.
All right, thank you very much for your comments.
Welcome.
Hey, Jake, I see we have some more hands raised. Should we go to the next one?
Yes, sorry. The next speaker is Ron Green.
Ron, you're still on mute right now, Ron.
Am I on here?
Yeah, you're on.
Yeah. Good morning. Lake County's been my home for 40 years now, and I urge you not to open the lake just yet to out-of-county residents and boats. We've done well so far with only 8 cases, but having an influx of boaters from all over the state at this point seems dangerous. People can bring COVID-19 to the county. They can frequent our stores, and next thing you know, we have many cases or 2 small hospitals unable to handle sick people and people dying. We have a huge senior citizen population here, and they are the people most endangered. Certainly don't open the lake at least until the nearby counties have opened their lakes. Respect the opinions of the Lake County Water Resources Department, but most of all, respect the opinions of Dr. Gary Pace. I've heard Dr. Pace speak several times, and I've reviewed his resume, which is incredibly impressive. We are very fortunate to have Dr. Pace. He's a brilliant man, very knowledgeable, highly educated, and very experienced. This is a man that got a 4-year college degree from a fine college in only 3 years with a double major in biology and psychology. This is a man that got 2 advanced degrees simultaneously, an MD degree and a master's degree in public health, in the time normally spent on just getting an MD degree. This is a man that recently got a certificate in public health from Yale University. This is a man that spent well over 20 years treating patients with glowing online reviews. He deeply cares about people. We're lucky to have him here in Lake County. Please listen to Dr. Pace and honor his opinions. Let's go slow and gradual in opening up Lake County. Let's not make the kind of well-documented deadly mistakes that San Francisco did with the 1918 Spanish flu. Thank you very much for letting me speak.
Thank you, Ron. Okay. All right, Jake.
All right, so the next name I have on my list is Virginia. Virginia, can you give me a sound check?
Yes. Can you hear me?
Yes, we can hear you.
Okay, thank you. Thank you very much for this opportunity to speak. And I also want to thank Dr. Pace for the great job that he's doing in keeping the public informed. And also thank you to Sheriff Martin for his ability to keep the public informed as well. My question is, I'm concerned about the future of large group events in Lake County that are scheduled towards the end of the year. I know that the Kelseyville Pear Festival has been canceled, and I don't know about the future of the Lake County Fair, but I am involved with two organizations that are running events in October. I'm with the Lake County Literacy Coalition, and we put on the Vineyard Run for Literacy. This will be our 31st year if we do it. And this is held at Steel Winery in conjunction with the Harvest Festival. And so our group is trying to decide whether or not to go ahead in planning this event. I don't know if the Harvest Festival is going to be happening at Steel Winery. So I just want to know about the future of large group events towards the end of the year and if they are allowed to happen.
Well, yeah, thanks for asking that. I would say, it's really hard to know what's going to be happening in October. I think the likelihood of large gatherings happening before the end of the year is pretty low. Now, how big is okay is hard to say at this point. If things really settle down, if you think about October, I'm pretty sure this COVID situation will be continuing in some fashion. We're going to be in some sort of limiting of large groups by then. It's going to be fire season, and it's going to be the potential. Some of the experts from the Center for Disease Control and other places are thinking that once the flu season starts and we start getting the combination of the flu and the COVID, it's going to really put a lot of pressure on the hospitals, and we may need to clamp down. So I think it's October is 5 months away. So, I don't have a crystal ball, but it seems very likely that any kind of large events are going to need to be canceled. But, it may be where we seem optimistic in July, and then in September it doesn't look so good, and then in October we cancel it. So it sort of depends on how your planning process goes. A lot of the large events I'm aware of have canceled through the year. I've seen some places canceling college for the fall, in-person college. So, and I think that's most likely the scenario that's going to happen. Large group gatherings in the fall are just not going to be happening. Or is there a way to do some of these activities in different ways, with virtual, with small groups, with over a more extended period, with smaller gatherings interspersed with it? I think we just have to rethink this whole way that we're living life and enjoying each other's company and celebrating and all that. The county fair, I've recommended that they close the county, that they not have the county fair in the usual fashion this year. And I don't, it's really hard to foresee that by the first week in September, we'll be able to allow any kind of gatherings of that kind of size. It may be groups of 25 we could do by then, but hundreds, I don't think there's any way that would be safe.
Thank you, Dr. Pace. Okay, Jake, I see we have two more hands up here in the room.
Yes, so we have 2 hands raised right now. They are repeat comments or commenters. So I don't know how you want to go about that.
And Mr. Chair, I have quite a bit of email public comment for people that haven't spoken.
Okay.
I have new hands popping up here.
Okay, let's go to the new hands, and then we'll go to we've got to get to the written public comment also. So
Okay, so the first new hand here I see is Frank. Frank, you're unmuted. Can you give me a sound check?
Yes, I'm here.
Okay, great. We hear you. Thank you.
Hi, Frank Deloso here. I just wanted to I appreciate what Melissa Fulton said and the other commenter. Over the weekend, and this was mentioned yesterday, over the weekend, Mendo Mill was, I tried to go there, but there wasn't even a parking spot. There was so many people there, so I decided to go ahead and pass on just the basis that there was no parking, and decided to go at a later time. I don't think it's going to hurt anything, especially on our small retailers, especially in our town. We're going to spread people out a whole lot more that way. And honestly, I don't think they're going to be that busy. So I'll just leave it on that point there. And I think that our community is smart enough to be able to open up in a safe manner that way. The other thing too is, I just don't think it's, when even looking at the county fair, we're talking months away. And to put that on the table right now, I think is just absolutely ludicrous. And so I just wanted to say that, and wanted to just big shout out and support of our local sheriff. And I believe he's doing a fantastic job. Thank you.
thank you, Frank. Okay, Jake, let's go to the next one.
Okay, the next comment we have, I saw, looks like the hand is down now.
Okay.
I know it's been up and down a couple of times. Michael Green. Yeah, there it is.
There we go. Can you hear me now?
Yes, we can hear you.
Yes.
Yeah. So, so the lack of surveillance testing is very concerning still. It's nice that we have surveillance testing in the jail, but we don't have it in the nursing homes. We don't have it in some of our most at-risk populations. So this goes down to the question of what we can enforce. If we're going to plow ahead and basically try to revert to the state standards, whatever they're going to be, without having any real knowledge what the status of infection is in our county, I'm going to things we possibly could enforce. Now, there hasn't been a choice up to this point to enforce a face mask covering requirement. But I'm wondering if we could at least talk about that, because if you're going to open up to a wider range of activities, a wider range of businesses, just what we've already seen here in Lake County over the last couple of weeks says it doesn't matter if Safeway becomes a surgical center if people track in there without any masks on. So if it's not going to be an enforcement thing and more of an education thing, isn't that something the county can do, not just in the courthouse, but countywide? That if we know people are going to come to visit this county, if we know businesses are going to open in this county, isn't requiring face masks just a bottom line minimum standard that we can communicate to people and hopefully they'll comply.
Yeah. Thank you, Michael. I didn't know if you had heard the comments earlier. Dr. Pace did make a comment about masks as we're opening up. That could be a requirement in education. So,
and I can just say, I think that's an excellent point. I think several of his points are very good, and that's part of the discussions is how we want to require it, how enforcement kind of questions. I think the point of requiring masking in any kind of close area, especially as we allow more people are coming in from out of the area, is probably a very wise thing. And a lot of it's just trying to figure out some of the logistics. The other point about the surveillance testing is, we actually have been doing some surveillance. It's not at the level I would like, but the jail surveillance is really good. We're doing some in the nursing facilities. So picking the most vulnerable places, we are doing some in those spots. And as the testing gets more available, we'll be able to do more. And I think also the the testing of the sewage is sort of serving a little bit as surveillance testing as well. And but right now what we're doing is sort of targeting the highest risk places. But you're absolutely right. The more we can do that, the better we're going to get a sense of what's going on. And so, you know, we're hoping we're making some progress on that right now.
Thank you, Dr. Pace. I do know, Jake, I would like to put a request here, and I don't know how you'll do it, but I do know we have folks on the phone. So how would, I guess my question to you would be, how would we know if they want to make public comment or not?
So we do have some expressed interest from people who have joined through phone. So my idea here was we have 3 participants. I can unmute them and call on them and give them the opportunity to speak. Okay, so I'm gonna unmute these 3.
Give it a try. Yeah.
And if any of you 3 would like to speak, please state your first and last name. If any of the phone participants would like to speak, please state your first and last name.
I'd like to speak. Can you hear me?
Yes.
Okay. I'm Olga Martin Steele, and first of all, I want to appreciate the information, the advice, the handling of today's meeting. Wonderful discussion and just, I think, a great discourse. Also want to appreciate Dr. Pace's considered approach to go slow with the interest of public health in mind. My interest has to do with our most vulnerable populations, keeping them safe, while I also support the opening of businesses and activities that go the extra mile to respect the very real and actually deadly consequences of contracting COVID-19, especially for seniors with underlying conditions, medical conditions, and I dare say most of us that are seniors have them. I do have a question for Dr. Pace, and it has to do with the drive-through testing. Dr. Pace, you talked about how to make an appointment by going online. Is there a phone number that people can call to make an appointment? Because I know actually quite a few of our poorer seniors don't have access to computers.
Right. Thank you for that. Yeah, the number is the number that we use for the MOOC email and number. So I don't have it right at hand. Let me look it up. But it's if you go on the website, it's on there, or you can. So basically, we have an ongoing email line and phone line that's open 8 to 5 days a week, sometimes on Saturday as well when there's a lot of activity. And people can call that number or email the MOAC, MHOAC, at lakecountyca.gov and send in information and do it that way. But let me pull up this phone number for you here in just a second. So if you want to go to the next question, and I can give it after that, it'll take me a second.
Okay, Dr. Pace, go ahead and get that number. So on the phone, if there's anyone else who's on the phone that would like to make comment, Jake, it's still open, correct?
I know I did mute the phones while that last speaker was sharing.
Okay.
I've unmuted the other phones that I found in the room. If you would like to speak, please state your first and last name.
Supervisor Simon, can I go ahead and get the phone number now? I found
Yes, go ahead.
So,
go ahead.
So the email is MOAC, MHOAC, at lakecountyca.gov. And the phone number is 707-263-8174. And so we have people there, English and Spanish. They can call 8 to 5 Monday through Friday, sometimes half a day on Saturday. And if you want to set up an appointment, you can do it that way. Or if you have questions about your business or anything about the COVID situation, that we have people on there. They've been working really hard to answer everybody's questions. So thanks.
Thank you, Dr. Pace. Okay, were the phones unmuted, Jake?
Yes, they are still unmuted. We had one more join just now, so we'll reiterate here. I've unmuted the phones. If you have joined via phone and would like to make a public comment, please share your first and last name.
Hello?
Hello?
Yes.
Yes, my name is Blake Davidson, and I live in Nice, California. Been here for about 4 years. Sorry for the dog barking. I had a stray that was walking down the street. And I was approached by Danny Primus about the Home Cooks Alliance program that she's trying to get started up here.
Yeah, but
and I just would like to.
Yeah, that's a topic I think that is later on the agenda. If you'd like to hang on, and when we get to that item, you can go ahead and make comment on that at that time.
Okay, not a problem.
Okay, thank you. Okay, I see we have one more hand raised, and then we'll go to the written comment. I see we have Melissa Fulton again, and then we can go to the written comment, Carol, after this one. You're still on mute, Melissa.
Oh, there we go. Thank you. Pardon me. Thank you for allowing me to speak again. There were a couple of other topics I made comment or notes on during Dr. Pace's presentation. I believe most of us, if not all of us, consider our doctors' access to our doctors' offices and the hospitals as essential. We know that a lot of our doctors and hospitals are suffering financially because non-essential operations have been suspended, when in fact many of those who need those what are considered non-essential operations due to their underlying health conditions are actually very essential. But also many people, and Olga just spoke to the senior population about so many of them needing to see their doctors on a regular basis. We need to get those doctors' offices open. We need to start allowing non-essential operations to take place. We may have patients in Lake County who have conditions that their physicians cannot monitor at this time. Now, it's my understanding that both of our hospitals have prepared themselves should we have an increase or a surge, if you will, of COVID infections, and that they are well prepared, even though they are small hospitals. So I would really like us to pursue allowing our Lake County residents access to their physicians. This is definitely an essential business, if you will, that is so important to everyone who's a senior. So
2 minutes, Mr. Chair.
Thank you very much. I appreciate that.
All right, Melissa, thank you very much.
Supervisor Simon, just to quickly respond to that, I think Melissa's absolutely right there, and people should just contact their provider if they need something and figure out what the best way to get that is. We're not actively limiting limiting access to medical care. So contact your provider if you need something and try to figure out the best way to do that. So I totally agree.
Thank you, Dr. Pace. Okay, Carol, yes, Supervisor Bratier.
And real quick, I think the issue is not necessarily the access to the healthcare provider, it's the type of access that is available right now. I know that I've had, including for other family members, a lot of video conferencing with our doctors, but maybe seniors do not have that level of access to be able to continue their healthcare. And so I know that's something that we're working on as far as broadband access, and maybe it's something we need to look at for the future is looking at having some hot spots available maybe at senior centers so that seniors can have access to those hot spots so that they can get online and have video conferencing with their healthcare providers. So that it's definitely not an issue of access, it's the issue of type of access that is only available right now.
Thank you, Supervisor Sabatier. Okay, Carol, let's go to the written comment that you have.
Okay, Mr. Chair. And so I want to tell you that a lot of the comments for this agenda item and the next agenda item, which is about local control in the crisis, are interrelated. And so I probably need to share them all right now, and then you can take them into consideration for this item and the next one as well, because there's just so much interrelatedness to them, as you'll see when I go through them.
Okay.
The first one comes from Elizabeth Larson of Lake Co News. She said she's getting reports from people who are traveling out of county to get antibody tests at Quest because the local Quest lab isn't open. Are those antibody tests considered reliable enough to give an accurate picture of how much COVID-19 immunity may be developing in communities? Do the labs conducting these tests have responsibility to report to public health if they confirm COVID-19 antibodies in the test subjects in Lake County? And if so, are you getting any such test results yet? And if not, how are you tracking results of antibody tests?
And we've gotten a response on the antibody test already.
Dr. Pace, yeah.
Okay.
I don't know that there's any more to add to that. It's it's evolving. The questions are good questions, and there's no difference. I mean, Quest is providing this test. It's just a matter of they're not drawing it in Lake County right now. So we're, like Supervisor Brown was talking about, this is an active discussion. We're trying to get it available, and how it fits into the whole picture still is a little bit unclear.
And also, if we get results from antibodies, it still doesn't give us the true knowledge of how things are going to move forward in the future, because we are getting reports of people who have had already the coronavirus who are getting it again a second time. So it's very unsure as to what that would even mean to know what the antibody test results are.
Okay. Thank you, Dr. Pace. Thank you, Bruno. If we could go to the next one, Carol.
Yes, Mr. Chair. The next one comes from Susan Cameron of Hidden Valley Lake. Hello, Supervisors. I support Dr. Pace's professional opinions and judgment. His job is public health and must consider our public. Lake County residents live in a county that has been rated by the Robert Wood Johnson Foundation in position 58 of 58 counties in California in health metrics. The U.S. Census shows that our residents are a larger population over 65, 23% compared to 16% nationally, and disabled under the age of 65 is 14% compared to 9% nationally. Lake County has not seen the infections and deaths of other counties. I believe we have Dr. Pace to thank for that. Even the smallest uptick in cases could easily overwhelm our very limited healthcare resources. So please be aware, so please beware of taking the attitude, what's the problem? There is no problem. That could change in a matter of days. Imperial, Stanislaus, YOLO, and what will you say to your families who've lost a brother, mother, husband, grandmother? The recent protests around individual rights cannot be characterized as individual. Their rights require others to die. The mantra is a misnomer. Please respect Dr. Pace's recommendations.
Thank you, Carol.
The next one comes from Kathy McCarthy. Loosening restrictions, enforcement of safety precautions, no out-of-county visitors. We still have vulnerable citizens and those that support them that need reassurance that the risk is continuing to be mitigated. As Lake County considers loosening the restrictions of this shelter in place, especially in light of supporting local businesses, will Lake County continue to emphasize the social distancing guidelines of wearing masks and maintaining 6-foot distance, and continuing to discourage out-of-county visitors, part-time residents? And how will these safety measures be encouraged and enforced? Thank you for your continuing service to the people of Lake County.
So just to say with that, part of the plan that's a really good point, and part of part of the plans that we'll be working with the businesses is sort of like Melissa and Supervisor Brown were saying, that the businesses have been working on these. It's really about keeping the social distancing and keeping the staff and the public safe, even though we're opening up. And part of the thinking about the mask is we've kind of just clamped down on everything by this shelter-in-place order. And as we start loosening it up, being a little more specific about how to protect people, that's the use of the mask and the social distancing in the businesses. I also think, just a little bit of a side note, is people that are vulnerable, the seniors and the people with underlying medical conditions, still need to be extremely careful and very particular about where they choose to go and how to be out in public, because the risk is there. There's absolutely no doubt. It seems like we have a low level now, but it will appear, and it will appear. We won't necessarily know it right away. And so people need to be very, very careful if they're in the vulnerable groups. So thank you.
Okay, Carol.
Okay, the next one comes from John in Kelseyville. With respect to our Board of Supervisors and Sheriff, I don't believe they have the knowledge and skills needed to determine when Lake County should reopen from shelter-in-place orders. The state has resources, epidemiologists, and economists. We have no control over our borders, and having a patchwork quilt of restrictions will put all of California, including Lake County, at risk. The state has laid out a very reasonable plan to reopen, and we should all be focused on meeting those benchmarks locally. So we are ready to reopen safely. Reopening too early and causing an outbreak won't help the local business. It will further hurt it. The next comment comes from Arjeen Georgie in Kelseyville. I am writing to voice my opinion that Clear Lake should be opened. There is too much fear in Lake County, and you are contributing to it. There is no logical reason that the lake should be closed. Mr. Chair, I'll just keep reading. Stop me anytime you want me to.
Yeah, I think we can get, I don't know, you say you have quite a few of them, but yeah, if we can get through as many as possible. And then the ones, if we do not get to all of them, they will be part of the public record.
Yes. The next one comes from Kusin Thomas. Greetings to all fellow board members. My name is Kusin Gary Thomas. I'm a local resident and business owner here in Lake County. I would first like to extend my gratitude and appreciation to our Lake County Sheriff Brian Martin, along with Public Health Officer Gary Pace, for their continuous devoting efforts on keeping our community safe during these unforeseen times. I've tuned into all virtual remote meetings of the board throughout the pandemic via Facebook Live, and I appreciate all of the important updates pertaining to the COVID-19 subject matter. Over this past weekend, a protest rally was held Friday, dated May 1st, 2020. And what I've seen on social media were inappropriate remarks toward Dr. Pace. Seeing a photo that a protester with a sign on the individual's truck that simply quoted, "Fire Dr. Pace." I found this uncalled for after seeing this and not having a probable cause of evidence of Dr. Pace's doings with the intention of firing him. I personally have the utmost respect of my community to people in general who have personal feelings, opinions, and points of view. But lashing it out towards the public health officer and sheriff was not the way to go about this in demand of reopening the lake, and being upset of the public health officer's implementation of extending the existing shelter-in-place order. Lastly, I'm grateful for everyone working to help stop the spread and limiting the transmission of the virus, as I'm an older brother to my little sisters, as I'm also the uncle to both their daughters, my nieces, who are children of my very own. I'll do whatever I can to make sure they are healthy, protected, and safe at all times, because they are and forever always will be important to me in my personal life. The next one comes from Steve Tucker. He says, I think we should open our restaurants and other things now. I don't believe that we have many cases, and that why we should follow a governor that doesn't care. Next, from Nathan Speed. Dear Lake County Board of Supervisors and government officials, like most everyone, our family has been staying home except for essential errands for some weeks now to protect ourselves and others from coronavirus. It has been quite disturbing, though, on the few occasions I've left our home to see how little seriousness the virus is being treated with, however. This virus is a serious threat to the public, and it is likely that the failure to materialize of a larger infection from the virus can be contributed to the social distancing and legal measures that have thus far been taken to prevent it, including minimizing the spread elsewhere as a means of preventing transmission to this county. After a brief lull, traffic is now as busy as ever and stores are full with patrons. While it is nice to see for the economy, there doesn't seem to be much reduction of non-essential errands. More concerning, though, is how few people are wearing masks. Mask wearers were a slim majority a week or two ago and may even be in the minority now. Wearing a mask is a simple, cheap precaution that should be available to most everyone in the community. Further, common sense says that masks have a blunting effect on the ability of the wearer to spread the virus to others. The public wearing masks, including food and grocery-related businesses that are mostly still open, and it is a travesty that such workers aren't all wearing masks already, should be a very important piece of the strategy to reopen Lake County's businesses. People so adamant about wanting to leave the house should be more than willing to trade off the very minor inconvenience of wearing a mask for the comparatively large increase in safety of others and the increased community access and business. The general lack of concern regarding the virus in the county reflects the lack of seriousness and effectiveness of the county's leadership. It was incredible, disturbing to many people to hear the tone of last week's supervisor meeting, how flippantly the health risk of the virus was being treated by some. It was casually tossed about that a mask mandate wasn't enforceable, while the well-being of the community into the future was largely ignored. It was a rationalization of inaction and an abdication of responsibility in the face of a difficult problem. We need leadership that won't get overwhelmed by the complexity of an issue like this one. Leadership that has the fortitude and courage to do the right thing, even in the face of unpleasant phone calls by a vocal, misinformed minority. We need leadership that has the strength of judgment to be more afraid of being held responsible for deaths of its community members, whether healthy, elderly, or even a child, than getting sued over a mask mandate. Lake County's people aren't taking the threat to their lives seriously, in part because their leaders thus far aren't either. A serious strategy that makes use of a combination of masks, virus, and antibody testing and contact tracing needs to be devised and implemented if we expect to reopen our county for business and community growth anytime soon. Next comes from Stephanie Vandergriff.
All right, let's do a couple more, and then we'll bring it back to the board after a couple more, Carol.
Okay. Stephanie Vandergriff says, to clarify, when we read her statement aloud last week, Bruno stated a response by misunderstanding via combining my comment below with some other lady who commented regarding a negative statement about Dr. Pace. That was not me. You read 3 comments in a row, and he chose to combine my positive comment with someone else's negative comment. Please share this with him and let him know to listen better and not comment so quickly. Maybe have you reread the comment to him before he reacts. I often tell my children the same thing. Next is Val Lancaster. She says, as a newly permanent transplant to Lake County, but a homeowner here since 2013, I love this community. My desire to once again patronize the unique and special business here is great. My husband fishes bass tournaments on Clear Lake as well as others. We need to open our lake as well as those businesses that benefit from fishing and water sports. The only tackle stores are The local tackle stores are open but unable to sell fishing licenses, but CVS can. It makes no sense. outdoor activities are imperative to mental, emotional, and physical health, as are gyms and even barbers and hair salons. Proper precautions are easy to put in place. If Safeway, Walmart, and the lumber stores can remain open, there's no reason to have all business to open. I am willing to volunteer my services to conduct boat inspections. Just teach me what I need to do, and I'm there. Lastly, Dr. Pace needs to cut the umbilical cord from Governor Newsom. We are a small county with only 6 fully recovered cases and 1 recovering case. He is not, in my opinion, looking after Lake County's best interest. Did you want me to stop, Mr. Chair, or keep going? There are 4 more.
Oh, there are only 4 more. Let's just get through the 4.
Okay. Next come from Sky Hoyt. With my limited information, it seems to me that one of our sources of coronavirus infections is in neighboring counties where residents may be going to work. I recently read in the Press Democrat about relaxing virus restrictions in Sonoma County. Attached to the article was a lengthy set of rules regarding safe practices for the construction industry. The rules are impressive, specific, and detailed. Full compliance by builders will be expensive and inconvenient. I believe that some builders may not fully comply. Unfortunately, our safety here is linked to safe practices where our residents go to work in whatever job they have. I understand we have no direct way to control this, but it should be a part of the discussion. How can we ensure adequate rules, compliance to rules, and strict enforcement against violators in neighboring counties? I do not think they are worrying about our wellness as they relax their restrictions. Next is Justine Schneider. I am a Cobb resident wanting to weigh in on the loosening restrictions on Clear Lake. It would appear that the board is preparing to cave to pressure from a small yet noisy group of residents. While on the surface, it makes total sense to open the lake to locals. The question is what will happen when our lake is open and most of the other waterways in the state remain closed to motorized boats. Obviously, out-of-towners will flock here to enjoy our beautiful area. It does not strike me as a particularly wise time to be attracting out-of-towners to our area. While I definitely urge the get back to normal as soon as possible, I know many people are hurting economically and understandably very concerned about the impact of an ongoing shutdown. I hope you will consider that most of us in Lake County are keeping our heads down, sheltering in place, following the governor's directions, and we are doing it not out of fear, but out of our love for our community and the wish to protect the vulnerable. Please consider all of your constituents as you deliberate on this complex issue, not just the demands of a vocal few. The next one comes from Doyle Autry, and this is the last one. And I guess actually there are 2 contributors to this one, Doyle Autry and Steve Sartori. He says, we support the shelter-in-place guidance put forward by Dr. Pace. We know that it can cause economic hardship on the citizens of Lake County, but the potential loss of life should be the focus of our efforts to control the COVID virus spread. No one person is being asked to give up freedoms over another. We as a society set guidelines and laws to govern the behavior of all citizens locally and nationally. As an example, we set speed limits on our roads and highways for the safe operation of vehicles. These limits on the operation of vehicles don't take away your constitutional rights any more than the limits of sheltering in place guidelines do. During this time of stress and uncertainty as a society, we need to help and protect each other and do what is right for the good of humanity. Until widespread testing is done to track the spread of COVID-19, we must use the tools we have available to us to limit the potential damage to human life. We don't want to contract the virus, and we certainly don't want to infect other people with the virus and cause their death. Hopefully, we can all see the big picture here. And that is all of the email input that relates to both this item and possibly 6.2, the next item.
Okay, thank you very much, Carol. I know that we've got a lot of comment today. We're going to go ahead and close public comment at this point. We will, bring it back to the board just to finish out this item here today. So I see Supervisor Sabatier. If you'd like to comment at this point, I know you want to hear from public, and go ahead and go to you.
Yeah, no, it was good to hear what the public has to say. It kind of mimics the phone calls, the text messages, and emails I've been receiving, where it's kind of both boats, where some people are very concerned about the health impact of COVID-19 and the possibility of a surge still happening, and the others that are really concerned about the economic impact of not being able to work. And it's definitely a tight balancing act that's been difficult. I know that the lake has been a big point of contention, and to be honest, we can't talk about the economy without talking about the lake as well, because that is where the majority of our economy comes into play. It's about people coming to the county to be able to really continue this level of economy that we had before. Opening up our economy without opening up the lake is going to be a very difficult business situation. Some businesses will do better than others, but we have a lot that are relying on that lake. So, and at the same time, I did have a conversation with the superintendent of schools this week, opening up our economy without thinking about what's supposed to happen with the children of those who are working when schools are closed and are virtual. How does that look like for opening the economy as well? So it's a very convoluted, complex situation that we've created for ourselves, that we need to be very methodical in how we move forward and make it work. And it's not going to work for everybody. It's going to be it's going to be interesting on how it is that we move forward. I did have some questions about the lake opening, and I was wondering if Director De Leon was still available to answer some questions. I see him on here on the Zoom meeting still. Thank you. I was wondering, I've been told that we are also working regionally with other counties who have closed their lakes as well. And from what I've been told, we're looking at potentially May 18th or something like that. Is that the same date for all other counties? Are those, where does that date come from for those counties? Do they also have a quagga mussel situation that they're trying to put into place and make sure that it's ready to go? Just kind of wondering how has that date come to agreement, so that I could better understand how it's possible for us to bring it more towards the present rather than keeping it at where it is.
So that date was kind of chosen mid-May. It was based on a few weeks after, taking a look at opening the lake in one stage, and then giving that a couple of weeks in order to see if there's an increase in cases, or see what the impact of a little opening after that event. And so the 18th was kind of the target. Yes, we are working with other water bodies. No one has any definitive date yet for what they plan to do. Those are just estimates of when they think they might open. We've been working with Lake Mendocino, Lake Sonoma, Lake Berryessa, Indian Valley. We checked in with Indian Valley this morning. They are still closed. Their ramp is still closed. There are other counties in Northern California, Solano County, Yolo County. They've opened their boat ramps, but left their parks closed, or state parks closed. Colusa County has boat ramps that are open onto the river. So we're just kind of monitoring and seeing what a lot of the other counties are doing, but nobody has any definitive date on when the plan is to open.
Okay. And I totally understand that when we're surrounded by other lakes that are closed, that the idea, at least, nobody knows, in fact, until you see it happen. The idea is if they remain closed and we open, then we would be a very light, bright beacon of attention to bring people to our lake. And so we're trying to see about managing that potential increase by matching with other regional lakes to open up at the same time. So I get that.
And just to that point, the numbers that I'm sorry to interrupt. The numbers that I gave you in my earlier presentation, those numbers for non-resident sticker sales last year were with all the other water bodies open. So if they're closed and we're the only one open, you can expect those numbers, I would guess, would go up fairly significantly.
Right. No, I
Again, sorry to interrupt.
No worries, no worries. I also wanted to, I know it's been tossed around, and I believe because of the status that we're in that it's been denied. What is the complexities of saying those who own a home on the lake and who have access to the lake can have access to the lake versus opening up public ramps? What is the complexity of private access versus public access?
So it becomes an enforcement issue on the lake. Our department and our Quagga Missile program focuses on the public ramps, and our program is set up to provide monitors at the public ramps. We have no control over the private ramps. You can be assured that out-of-town visitors are going to find ways to get their boats on the lake through the use of private ramps, and we just kind of feel that from an enforcement standpoint, and Sheriff Martin can certainly speak to this better than I can, if you're going to open the lake for the Quagga Mussel program, it would be easier for us to manage if the lake was open to all and all of the ramps, the public ramps, were open and we were able to have our program in place.
And I understand that, but at the same time, I'm wondering, don't we never have control over private ramps in the first place? It wouldn't be much of a difference other than maybe some people try to access it. Typically they would go to a public ramp, but maybe this time they would try to attempt to go on a private ramp. And so I think that we never have full control over those private docks and private ramps in the first place.
Well, that's true. The difference, I think, in this scenario would be, depending on your board's direction, we would not sell non-resident stickers, and so a boat that was a non-resident that came up here and used a private ramp to get on the lake is not only violating the shelter in place, but they're violating the Quagga Mussel program. Our program that we have is made pretty darn easy for non-resident boaters to get on our lake when the public ramps are open. And yes, of course, we have no control over the private ramps. And when the program is in place, a non-resident boater could use a private ramp. But again, we try to make that program about as simple as you can make it, and as easy to use as we can.
Right, and I think that we're in a unique situation here, and maybe making it as easy to use is not the option we need to aim for. And I'm obviously. I'm trying to figure out a way to make it possible without the invitation to out of counties. Right now, I believe it's $1,000 fine if you're found on the water with without a sticker or expired sticker or something like that.
Well, actually, we added the administrative citation process a number of years ago, and typically what the sheriff boat patrol does, and again, Sheriff Martin's on the line and can certainly answer to this better than I can, but the first option that the enforcement folks have is the administrative citation, which is $100 fine. That administrative citation, if appealed, goes to the board. It doesn't clog up the criminal justice system that a criminal citation would have, and which is an option to the officer. They can certainly make a criminal citation, but most of the time using the administrative citation, which is a $100 fine.
And what if we looked at the possibility of increasing that fine to kind of make a threat to, this is not the time for you to come here. We're not selling non-resident stickers. And if you're found on the lake, then this is the level of fines that you can find. I'm looking for ways to thwart the potential of influx of folks who are not supposed to be here based on our shelter-in-place orders. Just looking to see if that would be a possibility. And of course, I think Anita Grant would have to put in as far as what kind of level of increases would be allowable, because the fine has to fit the crime, I guess, or the violation.
And
okay,
if you recall, I mentioned earlier that, at a previous meeting, that some changes to that ordinance would likely need to happen. But I also have heard Sheriff Martin say that, and in fact, I'm just going to stop and let him answer that question. Yeah. I've heard that he has an opportunity, or has the ability for additional citation. So I'll let him answer that. Go ahead, Sheriff Martin.
Thank you. Absolutely. Yeah, we recognize that the $100 fine is not much of a deterrent for somebody. That's chump change for a lot of people. So with our posture in that we don't enforce the shelter-in-place order unless there's some other additional criminal activity, I've provided direction to our boat patrol staff that if you find somebody out there that does not have a quagga mussel sticker, and we'll heavily advertise this, Water Resources has already started advertising this, we reserve the ability to issue a second citation or a second charge on that citation for violating the shelter-in-place order, which does carry the potential of the $1,000 fine, which would serve as much more of a deterrent. So, I realize that the process to get the fines changed might take a little bit of time by the time we got there. This might not be an issue, but our enforcement posture is consistent with accomplishing these goals of keeping the invasive species out of our lake, and I've directed my staff to do so.
Thank you, Sheriff.
Appreciate that. I think the rest of what I have here in my notes is mostly will be covered by Supervisor Brown's extra item and the local control item that's next on the agenda. But I would like to look at what would it take to get our private ramps to have access, whether it's motorized or not. Again, we don't have control over that on a normal everyday basis before COVID-19. So why would we think that we have control now? I think the public ramps is the big issue. And if we can keep those closed, the majority of people are not going to come here because that's where they access the lake.
Thank you, Supervisor Sabatier. Okay, we'll go to Supervisor Crandall.
Yes, thank you. And Bruno, thank you for covering that. There's a couple things that I had that was on there, and you did a good job on that. And I like that you asked about the fines, and then Sheriff Martin, your response was perfect. But my comments, I want to quote what Martha Minter had brought up about Lake County being an attractive landmark due to the limited exposure of COVID. And we all know by living here, and I talked about this in March when we first started this discussion, when we had 0, of course, cases, about Lake County being attractive. And yesterday in our Middle Creek Restoration meeting, someone stated how Clear Lake is reported 4th in the nation for bass fishing, so it's a landmark there as well. We've always struggled with retaining talent to Lake County in regard to law enforcement, county positions, different organizations, and things like that. Another issue, too, is attracting responsible citizens into our blighted communities, especially I talk about Lucerne, Nice. There was discussion earlier, some places in Clear Lake Oaks, some places in Clear Lake. We can maintain what we have in Lake County. We can come out positive in light of this unfortunate pandemic. So as much as I want the lake open, as much as I want all of these things done, and I think actually some of the questions that Supervisor Sabatier brought up, I think there can be a way we can meet with that. But if we can maintain what we have, this just makes us even more the better. We can come out of this, just in a more positive light. Just another thing to add, I know that Supervisor Brown brought up the situation with the Blue Collar Committee. Dan Griffin is in that committee talking about different ways to adjust your business and things like that. And Andy Lucas and Jeff Lucas were talking about different initiatives to assist businesses in having a seminar or something like that amongst people that have done these things, so that other businesses who are just kind of frustrated from not getting PPP and idle and all these other things can get in there, see like, hey, I can make that adjustment to help so I can do deliveries or whatever the case may be. There's also another thing, but I think I'll just send the information to you, Dr. Pace, about the golf guidelines. Apparently they had changed and there were some concerns about that. I'll send you what I have, so then that way I don't take up a little more time. And just one last thing, I'll close. I've consulted with other supervisors in neighboring counties and rural counties as well, who are worried about the same thing in regards to out-of-towners flocking to their lakes, to their different attraction sites when it comes to those type of landmarks. So I just wanted to emphasize that and just state thank you for being patient. In others, I understand your frustration. This is a difficult time, and we respect what you have to say.
Supervisor Scott, do you have a comment?
No, other than the fact that I am appreciative of the conversation we've had today. I think it was a completely different shift of comments and questions, and I really appreciate the public coming out and asking the questions. And I think we're moving in the right direction, and we need to take Dr. Pace's lead to continue making and keeping Lake County the place that it is right now, with only the 8 cases that we have. Thank you.
Thank you, Supervisor Scott. Yeah, I want to thank the public, everybody who's been weighing in on these things. Obviously, Dr. Pace, the Health Department, Sheriff Martin, and the Board of Supervisors, of the actions we've taken. From day one, my concern, was health and safety of our community here. It is, I think the proper method to go forward cautiously. We have a lot of communities that are opening up around us and across the country where we'll know in the next couple of weeks what the right thing is to do. I appreciate the cautious approach by Dr. Pace as we move through this process. The governor's announcement yesterday allows us hopefully to do that as a local community here as we move forward. But ultimately, from day one, it is the health and safety of our constituents that I have always kept in mind. Being a business owner, I completely understand the new reality we're going to be opening up in. And believe me, sometimes throughout life, and each one of us, you want something to happen sooner than later. But sometimes you need to take a slow approach to make sure that, vulnerable people in your community and others are taken into consideration. So I appreciate all the conversation, the masking conversations, the slow, methodical opening of our businesses, the buy-in by each and every one in the Blue Collar Committee and every other business owner in Lake County that's affected by this. And really appreciate today's conversation. We will, as we know, persevere. We will come through this. And I know that as we move over this COVID-19 pandemic that's happening, there will be opening up, which we're talking about now, but also always keeping in mind if there are outbreaks, there may be some restrictions that we have to go back to for each and every one to understand. So thank you very much, each and every one, for your input today. But ultimately, Dr. Pace, I would just like to tell you that you have my full support as we move through this from day one, made that commitment, and will constantly do that throughout this process. I am not a doctor. I am not, and will never think that I am, to think that I know better than what's coming out of our public health office, but I will always ask questions and try to provide information. And I do appreciate Eddie bringing up some concerns from the golfing area that I did get some calls on too about some of those situations about the golf cart rentals for some of the places. So those are all small things as we move through it. Hopefully sooner than later we get back to life, as we can, and in the new COVID-19 pandemic afterlife. All right, thank you very much. Supervisor Sabatier.
Thank you. I forgot to bring up a couple of topics. One of them you brought up was the golfing, and I'm wondering if Dr. Pace will be reviewing the golfing, because at one point the first order said one person per cart, and it didn't say anything about private carts. Now it says you can have family members in the cart, which makes perfect sense. You're hanging out with them, eating with them, and living with them. So why can't you be on the same golf cart? But now it says private golf carts only. And just kind of curious if we can go back to the golf course itself being able to clean in between individuals. If we could do that for shopping carts, I'm sure we could do that for golf carts. I just don't see how that's not how that's impossible. The other one was, and again, I'm looking at the differences between the state of California regulation or orders versus ours. The other one was the Airbnb and the hotels. Now, I'm not understanding necessarily how, because we've been saying that we're more restrictive than we are the state, but the state says shelter in place, don't move, only essential workers. So wouldn't our hotels have to follow that anyways, that only essential workers get to have access? We keep saying that we are over what the state regulations are, but I think that we're pretty much in line with them. And if we're not, what's the difference? So I was wondering if Dr. Pace could respond to that.
Hi. Yeah. So the two things. First, the golf. I don't play golf. I've just been trying to allow golf and trying to adjust the recommendations based on the emails I get from people. Clearly, I should have sat down with somebody who's, basically I was getting these from other counties that were allowing it. And then you sent me some emails and I thought I responded to that. So somehow that there was just logistically putting it out in a way that made sense didn't work. My plan is after, talking with the working group, et cetera, is to just go to the state orders. I'm not exactly sure what they say about golf. So we can, if you have an opinion about that and want to help me figure out the right way to write it, we can go that way if it's different from the state. My plan is to just go with what the state's allowing now. And then with the hotel and the vacation rentals, the way that evolved historically is we put the first order in, the state came in after that. We had to clarify because of there was a lot of gray area in the state order back in March. At this point, my interest is to go line up with the state order by, whatever, within the next few days. And my reading of it is exactly what your reading is that only essential workers can be staying at the hotels, or with a few other exceptions. So, at this point, moving forward, part of it was just the way the timing went and trying to clarify things for people because the state took a little while to get clear about it as well. So I agree. The way it looks to me is we just want to get the hotel and vacation rental situation in line with what the state's order is.
Okay. And I will make sure my following emails will be clear. Maybe I was confusing in my language when I emailed you some of the previous emails.
Sorry. Yeah,
go for it.
Well, the whole golfing thing, I was just trying to make a reasonable thing that I had gotten from other places, and I thought I had incorporated what you were recommending, but clearly the more we layer these things on, it just gets more confusing for people. So whatever, let's look at the state order on golfing, and if that's reasonable, let's just allow it to be that. And if there needs to be some clarification, I'm happy to do that. This isn't to make things complicated. It's trying to open things. Part of this is all new territory. What we're trying to do is open things that have been restricted, but do it in a safe way that's never been really required before. So each business is going to have different requirements, and we're all just trying to figure this out, and we have a very little staff that's really working hard right now. So trying to open these things up in a way that is clear for people. And I thought I was responding to your recommendations from the golfing community, but clearly I screwed it up somehow. So happy to fix that.
I'm sure some fault lays on me as well. And the last thing I want to say is that there was a comment brought up by the public member, Jonathan Cronin, about his issue with his neighbor, and Supervisor Crandall elaborated a little bit on it. And I know we're talking about the lake, we're talking about golf, but businesses is really where the true harm is happening to our communities, where businesses aren't able to make income. They're not able to provide wages to their workers. And unfortunately, his neighbor who's doing something illegal, it's business as usual. And so it's the law-abiding citizen that ends up hurting more, because we don't want to break the law. And so we really need to figure out how to get to this Thursday and Friday is going to be pivotal for us. And I'll continue on that conversation on our next agenda item, but it's going to be important for us to really figure out how to get our businesses back up.
Okay, thank you, everyone. No more board comment at this point. We'll go ahead and close out on this item 6.1. Dr. Gary Pace, thank you for everything, and keep doing what you're doing. Thank you.
Thank you, sir.
Okay, I know we had a couple more items, so was hoping we could take a quick 5-minute break, and then we'll come back and do item 6.2, and then we'd like to take a quick lunch break from 12 to 12:45. After that, I think we should be able to get through it. We will see, I guess. But I know that, what would you guys like to just push through? You think we can get through a 6.2 item here pretty quickly, and then just go to a lunch break? Just reaching out to the board to get their thoughts on it.
I'm okay with that. Maybe staff, I don't know.
I'm okay with that. Carolyn, you good?
Yes, I'm fine. Thank you.
Jake, Sam, you okay for a little longer before a break?
Yeah, I'm okay.
And Anita, I know she's always good, so.
Okay, so we'll push through this item 6.2, and then we'll take a lunch break at 12 and come back 12:45, and then we'll finish out the rest of the items. Okay, item 6.2, 10 a.m. discussion consideration of next steps of COVID-19 and local control. Supervisor Sabatier.
So as you know, I believe it was April 14th, I think it was, we signed a letter or approved a letter to be signed by the chair and sent to Governor Newsom requesting that we be given local control, that we've learned from what we've been doing by following the orders from the state. And that we've done a good job of it, and we want to continue doing that good job, and we want to be able to control how opening the economy looks like. It looks to me like he is changing his mind and really going with a more open local jurisdiction capability right now. And so originally I thought that maybe we would send another letter or an update to our letter or something like that. But what I did also was combine a letter that was signed by 6 different counties in the northeastern region of California. That was signed also by their assembly member and their senator, requesting basically the same thing that we had requested. And that letter, I believe, was April 24th. Sorry, our letter was April 21st. And so I guess my agenda item has morphed a little bit based on the conversation happening over at the state. And I would like to have the conversation where we need to submit a plan in order for us to have local control. And I want to talk about how we can get that plan to the state governor as soon as possible to show that we have the ability to go ahead and move forward. Now, also, I'm going to bring up to you, and Anita will probably want to chime in on this. This is my legal belief that Government Code 8625, which gives emergency powers to the state governor, states that the governor is hereby empowered to proclaim a state of emergency in an area affected or likely to be affected thereby when and A lists another set of codes, which basically has pandemic in there. So if there's a pandemic, he has the right to do that. And, meaning also, not or. So, and either he's being requested to do so, which we have not requested him to do a state of emergency, and he finds that local authority is inadequate to cope with the emergency. So according to Government Code 8625, if we can prove that we have adequate ability to handle our own in this county, then we do not have to follow the state orders of California. And I think that we have proven that we've done a good job. I'm not saying we shouldn't have done what we did. I think what we did was the right thing to do, but we also have proven that we are not seeing a surge. Our hospitals are not having it. We've been prepared for an extra surge. We went from 50 beds to now almost prepared for 100. We added some ventilators. We added a lot of PPE. We're still adding more PPE. The biggest harm right now that we're seeing that we can't handle on our own is the economic burden that we're asking people. We're asking our businesses to sign up for PPP, for the Paycheck Protection Program. We're asking our workers to sign up for unemployment insurance. I think that we need, and I know it's a very tight schedule and I'm asking for a miracle, but by Friday, we need to have a plan submitted to the state so that we can take control of how it is that we can open back up. I don't want to I don't want to take longer than necessary, and we have the capability to organize that. A salon in the city sees a whole lot more people than a salon in Kelseyville or in Clear Lake. And so again, if we're looking at anywhere that one employee in a salon sees maybe 10 to 20 people maximum, okay, well, that's not a big population gathering right there, especially if it could be done by appointment. I think that we can control those things, and I think we should control those things, and I think we're prepared to control those things. And so I would like to have this discussion morph into, we need that plan written up, and we need that plan submitted, and what's that like, and how do we get there?
Yeah, well, obviously I'd have Anita weigh in on that. You know, what was this agenda item is about approving a letter to go out about local control. And I just want to make sure I do have Anita weigh in on what you are talking about at this point. Because I think when we heard from the report from Dr. Pace today with the announcement on Monday, that's the direction we're moving. I guess what you're looking for is more of an action to make sure that we're doing that. But sound like we're already moving in that direction. Anita?
Yes, sir. Yeah, I can tell you in terms of the code section that the resources in that scenario means more than just we have the ability. You'll look at item 7.2, the county is going to be advocating for funding. It's resources for funding, resources for testing, resources for masks. There's a lot of resources that most counties don't have on their own, if any counties have. And that's also, I think, encompassed by that code section. However, having a plan, as Supervisor Sabatier is speaking of, is a prong of that analysis, and it is certainly part of what the governor is calling for now for phase 2. And I believe, and both Dr. Pace and Ms. Hutchinson may be able to speak with more information on this, that on Thursday, perhaps Friday, but I believe they're hoping to get it out Thursday, some guidelines as to exactly what that plan should encompass. I do know that, for example, San Luis Obispo, a large jurisdiction, of course, has put together a plan and submitted it, but this was prior to the governor's most recent pronouncements. And in that plan, they were essentially just asking the governor to bless it and allow San Luis Obispo to go its own way. So I think this is all moving now in that direction. However, if the governor's office is going to publish guidelines as to what the plan should contain, it's going to behoove the county to adhere to them, because whoever is reviewing it is going to review it against those guidelines. And it wouldn't be a good idea to lose points just for the format, if you will. But again, all of this is moving in the manner that Supervisor Sabatier is speaking about. It's consistent with state law and certainly consistent with the governor's most recent orders.
I see that Denise Pomeroy has raised her hand. I'd like Denise, if you could, Jake, let Denise comment.
Good afternoon, Supervisors. Can you hear me? I guess you can.
Yes.
So while we were on the Board of Supervisors meeting, there was a state call that I was also on that is starting to spell out some of this criteria that we need. They are supposed to be releasing a draft of this to the county's health departments later today, but the final draft and the documents that we will need to use to complete our plan will not be available until Thursday. So Friday may be a little tough, not just with everything else we have going on. But they have changed some of their criteria from what they had discussed earlier. So when we get it, we have to read it and understand it. Then we have to set a meeting with CDPH to go over it. So that will have to happen. Of course, we have to complete the form and all of the pieces and explanation. There's two sections of it, of the plan. One is readiness plan, and then one is containment plan. And so right now on the readiness plan, there's a part A and a part B. And this is to qualify to even submit the plan. We cannot have any more than one case per 10,000 people over a 14-day period from the day we submit the plan, and one death in a 14-day period from the day we submit the request. There's only 20 counties as of today that qualify for that, and Lake is one of them. We have to be able to meet the testing capacity, which Dr. Pace talked about earlier. However, they've changed that. Earlier, we were told it was one test per every 1,000 people, and now it's 1.5 tests per every 1,000 people. So instead of 67, 70 tests per day, we have to be able to do 100 tests per day. 75% of the population measured should be able to be tested within a 60-minute radius of where they live, so that's testing availability. Containment capacity, we have to have the contract tracing capacity to deal with any positive cases. Minimum capacity, if you have no cases, is one full-time staff trained. Right now we have that. We have five nurses trained, so we're good there. We have to be able to have temporary shelter for 15% of our county's homeless population, and we have to be able to show the capacity to take care of that 15%. We may have that with Project Room Key and the work that Pastor Shannon's doing, I don't know. We have to have the capability at any time to take care of 35% increase in surge. And then we have to have a robust plan to protect the workforce, and that's both the healthcare workforce, that's staffing and PPE. We have to be able to protect the vulnerable population, and that means that our vulnerable population, like our SNFs and the jail, congregate living places, has to have at least a 14-day of supply of PPE, and they have to be able to receive additional PPE without coming through the health department. And I think that'll happen. And then it has to be approved by the health officer, and of course they want us to work in collaboration with our, county leaders. But the health officer has to sign the actual document. And then the frequency, we have to develop a frequency of matrix to complete how the county can modify sectors of this plan to surge and or to back off. So that's the new guidance I just received about an hour ago. I'll get the written stuff hopefully later today, but the documents and the final version won't come until Thursday. So I just wanted to give you guys that update.
Thank you for the update, Denise. And I know that Dr. Pace would like to comment also. So Dr. Pace, if you're in the room here, go ahead and make a comment.
Thank you. And that's really that's hot off the press. What Denise is reading, that was coming out while we were in the meeting. Just a couple other thoughts. One is that we're very dependent on the state, so I'm not sure exactly the way Supervisor Sabate was framing that piece, but the testing supplies that are coming through the state, and the surge planning is we will be able to do some of that locally, but it's going to be a regional response almost for sure. If our hospitals get overwhelmed, we're going to be taking people out to the region and also to the alternate care site that's out in Sacramento now. So while we are prepared and we have the plans, the whole model really is getting supplies, the PPE and the testing supplies through the state pathways, and then also using the clinical sites that are outside of the area of our local capacity gets overwhelmed. So that's one part. And the other part is that I agree with the way Supervisor Sabate was framing this, is that the governor seems to have responded to the pressure he was getting from the smaller rural counties. And this gives us quite a bit of latitude, at least for a while. It may be that in a month or two, things still remain calm, and even though we've opened things up a little bit, and that we want to move towards phase 3. But I think at this point, we're going to have a fair amount to work with here for the next period of time. There may be a few things that we don't agree with, like the hair cutting and salons are in phase 3 right now. I think they might be reevaluating that. So I think the letters that were sent and some of the plans that were sent, they seem to be sort of thinking about that in a different way, or there may be a way to sort of try to frame that as a home visiting possibility or something like that. But what it looked like last week and what it looks like this week is very different in terms of our ability to open our businesses in a safe way. I think also I'm going to definitely caution that we need to go slowly and methodically and opening and then watching for 2 weeks to see what happens, see what the testing shows, see what the incidence is. So to move forward real quickly over the weekend with not enough planning and not enough kind of monitoring of the impact is going to be not a good idea in terms of the public health. And I think we heard a lot of the public today sort of expressing concern that we might be getting ahead of ourselves. And I think, my role in this is to really keep an eye on the public's health and advocating for the vulnerable population. So I would say that a week ago, I was sort of feeling like we needed to try to get more local control. I feel like now they have heard that, and they're giving us some opportunity to do that. And really for the next month or so, we have a fair amount of latitude to make the kind of changes that seem to make the most sense to me in terms of advocating for the public health. So thanks.
Thank you, Dr. Pace. Supervisor Sabatier?
And I want to just clarify, I'm not asking for us to open up everything. I'm asking for that methodical approach as well, but in a local controlled way, not a mandate through the governor's orders. That's all I'm asking for. I think that we made it clear last time, and every letter I've read from so many different people, from so many different counties, is the same basic concept. We're not LA, so please don't give us a statewide approach. But unless we have a plan in place, submitted and approved, we do not have that local control. We will have to follow what the governor's phase 2 looks like. And I would like to see our Lake County version of phase 2 and not a statewide California phase 2.
And I think once we get those guidelines, that'll be worked on, which is great. Thank you, Dr. Pace and Denise, for reporting what happened while we were in the meeting. Supervisor Brown, I know you've been off mute for a while. You want me to comment?
Was Eddie was off mute, and I think he was probably going to say the same thing I was going to say, but
okay.
I'm just the plan that we're working on.
Eddie went back on mute, so
yeah, go ahead. He had his first. Okay.
Okay. Yeah, no, I was just going to reemphasize.
Go ahead, Eddie. Go ahead, Supervisor Crandall.
Paper, rock, scissors. I was just going to emphasize that some of those plans, my notes are going up, are going to, the surveys. I think we talked about these surveys that the Department of Health is working on and getting out to the businesses that will help with the plan that Supervisor Sabatier is talking about. I think that's going to be a big, a helpful guide to that. Again, the Blue Collar Committee has put in a lot of different guidelines and structured protocols that would really help for them to open in a safe way. And so I like the fact that we're doing this letter so that way we could get that local control to enable some of these businesses to open. I think, you know what, I think I'm just going to stay at that. But if, the governor's been stating local control, but this letter will help get us to that, hold them to the fire, if that makes sense.
Thanks, Supervisor Brown.
I anticipated he was going to talk about that because the Blue Collar Committee is ready to submit a plan with everything that we have compiled together, not just specific businesses, but businesses in general to safely open, and even some coming back online, phasing in. Everybody realizes that we can't just open the doors right now. There's some that want to in the public, but I think the thoughtful approach that the Blue Collar Committee has taken is going to be something that I think the board would give consideration to. I think we'll know after our next meeting we can probably put something together that we can start looking at. And we're inviting Dr. Pace. We had some issues technically for Friday, but I think we're gonna try to meet again maybe Thursday or Friday, and then Dr. Pace can join us and we can have that discussion. So thank you, Bruno, for that.
Okay. Supervisor Sabatier.
I know I said Friday, and I get it that if we're not getting the form for the plan to be submitted until Thursday, but basically the same concept is still there, which is I would like to throw as many resources as possible on making this plan be complete as soon as possible so that we can go ahead and start doing what Lake County needs to do for Lake County with the guidance of Dr. Pace so that we can do what's needed here.
Thank you, Bruno. I see Denise, did you have another comment?
I did. So, part of our planning last week was to help businesses prepare to reopen. Those documents are on our website underneath the coronavirus tab. There are 2 documents. One's the business plan, and then one's the social distancing protocol. And the state is currently, from what I'm hearing, is going to require the businesses as they reopen to do the social distancing protocol. But they're on our website, both English and Spanish, and businesses can start going there and filling it out and emailing it into the Mohawk email address. And if they have questions about it, they can call the phone number and we'll help them just to start preparing on what they plan to do and how they plan to phase in their workers and keep them safe and keep their customers safe. And then they'll be ready once the state allows us to let them open, or we get regional control and we're allowed to let them open.
Okay. And can you repeat one more time? I know it's been said a bunch of times. Could you repeat just repeat that one more time, what website they need to go to get those forms?
So it's the Lake County Coronavirus Public Health website. It's on the coronavirus tab, and then there's some thumbnail tabs there, and one of those thumbnail tabs says businesses. And underneath the businesses, that's where the forms are. And they're both the Spanish forms will be on the Spanish thumbnail. And they're fillable forms. Fill them out, email them, and we're starting to gather them. It also is helping us plan for things that maybe we haven't thought about regarding certain business types.
Thank you for that, Denise. Thank you for giving that information one more time.
You're welcome.
Okay, at this point, if there is no more questions from the board, we'll go ahead and open it up for public comment here. So Jake, I see we have 3 hands raised. If we could just go to those.
Yeah, so it looks like the first hand we have raised here was from Denise. I think that's stale.
Okay.
So I'm gonna lower that. So I see Melissa Fulton.
Go ahead, Melissa, but you're still on mute. There you go.
Thank you very much. Just quickly, I'm hoping that what Denise read off to us as far as what's coming forward, that can be released in a press release by the admin office today, so we can get that posted to as many people throughout the county as we possibly can. And of course, it will go to all of the Lake County business associations, asking that they forward it to their businesses. I think the sooner we get this sort of information out through the business community, as well as the links to the forms that Denise was talking about, the better the businesses will feel about how we are proceeding forward. I really appreciate all of that. Thank you so much.
Thank you, Melissa. Okay, I see we have a second hand up here. Eileen Anderson.
I just wanted to thank Supervisor Sabatier for your common sense approach to this situation. Doing it as a county, like you said, we are not LA, and I just appreciate your common sense approach. I back that. I fully support it. Thank you. We as a county are much different. We're rural, as you said, and thank you so much for speaking up with your idea. I appreciate it. That's all.
Thank you, Eileen. Okay, see, we have another hand up here. Sally Peterson.
Yes, I just wanted to echo that as well. I think it's good for the county to have its own, jurisdiction and control. But I just want to reiterate again, we have to be methodical. We have to be strategic in how we approach the reopening. The state does have some good guidelines that we can pull from. We are different. Our demographics makes us different. And I think that's why we've been so fortunate in the few cases that we've had up here in Lake County. But, I know that the Board of Supervisors has to weigh a lot of things. There's a lot of stuff on your shoulders. South Lake County has never recovered from the Valley Fire. So, it's going to be hard to recover from this as well. So I recognize that. I just hope that, we're strategic. We listen to Dr. Pace, we take his advice and move forward in a strategic, methodical manner. Thank you.
Okay, Jake, I don't see any other hands raised at this point.
Yes, that is correct. I'm not seeing any more hands raised.
Okay. And Carol, you read the comments you read earlier were specific to this kind of item at this point. Just checking in to see if you have anything else.
There's just one more where the author of it was specific to this item.
Okay.
But, again, it has the very interrelated connection to the earlier discussion. But if you'll bear with me, I'll read it real quickly.
Okay.
It comes to you from Karen McDougall. It says, first, as wildfire season approaches again, I want to reiterate my thanks. This actually is specific to Rob Brown, this first portion. Thanks for your energetic leadership in keeping our district fire safe. You've truly made a difference in leaving a very positive legacy. Second, if I read the agenda correctly, I think my primary concern is item 6.2. I've been following protests, and I'm concerned that this small minority will force actions upon you and the rest of us that will imperil the gains made to date. Currently, we are in good shape. Only 7 cases, no deaths, healthcare capacity secure, essential businesses open. The lake is now open for non-motorized use. There are very positive results, and they're the direct results of timely, proactive policies adopted by the county, and to everyone's credit. Now there's a catch-22. Because we're in good shape due to these public health actions, Some people are saying that these measures went too far and obviously unnecessary precisely because we have avoided the horrors visited upon other areas. Thus, the reasoning goes, let's bring visitors and their money back into the county. What is being proposed will expose Lake County residents to infection, illness, and death, with the trade-off being potential economic benefits from reopening Clear Lake to commercial and public use at this time. I know that out-of-county visitors bring much needed out-of-county revenue. They buy gas, food, gifts, generate TOT, and so on. As a grant writer, I'm aware of how important each external dollar is to our economy. Each new dollar spends between $2 to $7 of economic benefit when and if all services are open. So she goes on to respectfully request that the county delay the opening of Clear Lake to commercial and broader public use until business and the county have worked out detailed, enforceable protocols to protect and follow both residents and visitors. So very consistent with what you're saying.
Okay. All right, Carol.
The reassurance I wanted to add to your board to this discussion on behalf of staff. Staff completely gets the urgency of this plan, and we're your neighbors too. We live here and want Lake County to come back alive, and this will be our highest priority as soon as we have all the necessary pieces we need to put it together accurately. And so I would envision this conversation this time next week will be quite different based on the plan. So thank you.
Okay, thank you very much, Carol. All right, we're going to go ahead and close public comment and bring it back to the board here for some more deliberation. So go ahead, Supervisor Batier.
I appreciate Ms. Hutchinson saying that. It's good to know that that's going to be the priority and that we're all on the same page. And again, I don't think any of us want to walk blindly into the future. We want to make sure that we're going to do it safely. I do want to bring up a topic because there's been different counties have done different things. And I know that Modoc County kind of stood out as being one that said, no, we're going to, in my opinion, they're using Section 8625 of the government code to say, we're good, we can handle ourselves, and they're opening up. But there's one part in there that says, examples of reasons to revert to previous measures may be confirmation of 2+ confirmed cases of COVID-19 in the county, medical surge that overloads county medical facilities and resources, and substantially increased death rate within county. And so even though they're saying they're opening up, when you look at their ways, their measurement of what would revert back, they're being pretty conservative on what is needed to go backwards. And I think that obviously will be a part of our plan, is to look and be cautious as to what are the measurements for us to lean back a little bit. Maybe we push forward too far. But I just wanted to use that as an example that just because some people are opening up doesn't mean that they're going crazy with it. I think they're all trying to be very methodical and very careful in how it is that they're doing so, because they care for their community and they care for their community members. And I think that we're pushing in that direction, and I appreciate the board's opinion and guidance.
Thank you very much, Bruno. So I think that what this is kind of morphed into then is obviously an agenda item that we'll be talking about next week at this point, unless because it has, had effect on the governor with some of his local patrol stuff. So my thought is, and the board can weigh in on this, that this will be an item that we'll be speaking a lot about next week. So I think at this point, there won't be any action on this item today.
Nah. I think the action's already been taken.
Excellent. Okay, as we spoke, Denise, yes, you had a comment, Denise?
Yeah, just really quickly, Supervisor Sabatier, this is absolutely the health department's highest priority, is getting this plan done, getting it submitted. I didn't mean to imply that it was not in any way, shape, or form. We've started working on it as soon as we got the message yesterday, and I'm on every single call. We're already starting to gather the data that we need to put it together. So it will be our highest priority. Thank you.
No, I appreciate your efforts.
All right, thank you very much. Moving off of item 6.2, what I'd like to do now is we will take a lunch break. I know we said from 12 to 12:45, but we're already at almost 12:15. So we'll just come back at 1 p.m. and we'll finish the rest of the items that we have on the board. So I want to thank everybody, and we'll see you guys at 1 o'clock to finish this.
honor this or give us this little bit of flexibility here. So if we forward a letter as it's written to the governor, I think that's probably going to be effective, or so be effective.
Okay, I know you're broken up there a little bit, but just looking to reaffirm the letter to be sent to the governor that has been presented today in item 4.1. Is there any comment from the board at this point on item 4.1? Supervisor Scott?
My only question is, have we heard any other counties doing the same thing, asking for the same thing?
I don't know if you have or not.
No, I haven't. I have not heard. I know counties are approaching this differently across the state, as we know, but specific to this item, I'm not sure. I know we approved the letter last week and we got a response, and I think now what we're doing is forwarding it to the other way.
To be honest with you, I don't have the desire to check for 57 other counties to find out what they've done or haven't done any more than they check with us. I think there's a lot of letters going to the governor from a lot of counties over a lot of different issues that will benefit us that we haven't come up with. So I'm sure, if not, this will help them just as much as it will us.
Yeah. Supervisor Sabatier?
So, I think we even discussed a little bit sending it to the governor's office last time, but we felt that maybe the Board of Cosmetology and Barbering would be the primary place to go. We got to go up the chain. So now we're going up to the top. I'm wondering if there might be a potential for a slight change in the letter in requesting that barbershops and hair salons, beauty salons, whatever we want to call them, cosmetology place of business, also be added into phase 2. Rather than right now it is in the discussion. And I think it would help us to say, please put it in phase 2.
Identifiably 2 separate parts because I don't want him to dismiss it because he's not willing to do that. But I think that's a good idea.
Supervisor Crandall?
Yes. No. I've actually listened to a couple other counties talk about this as well. I reached out to some of the supervisors that were talking about it to urge them to write the barber cosmetology school as well. But now that we've got this letter that I know about it now, urging them to do the same thing, because that was a very well thought out thing to do, and so I think I'm ready to move forward with this letter.
With that,
Mr. Chair,
yes.
If I may, since I would be the one tasked with revising the letter, I just want to ask how you envision that. Would you want me to have the letter make phase 2 the first request and then this authority secondary, or the opposite?
I think, and Bruno, that was his suggestion, but I think if we put the phase 2 as the first part of it and then indicate in there that at a minimum to allow these folks to go into homes of their clients, that would work too. So I think some wording like that would work. Ideally, that's what we would want for them to be in phase 2, open up, I think. But if not, at a minimum, let them work in from the private homes.
Yeah.
Okay. Thanks. That helps clarify what you need then. Thank you.
All right. So if there's no more comments or clarification on the letter from the board, we'll go ahead and open it up to the room. Jake?
Yeah, so would you like, I don't see any hands raised.
Okay. How about let's just open it up real quick, see if we get any comment. Oh, looks like I see a hand come up. So go ahead.
Melissa? I'm gonna unmute you. Melissa Fulton, are you there? Would you like to make a comment? Unmute yourself.
Okay.
There you go.
There we go. Yeah, I was trying to get the picture back, but that's okay. Yeah, I'm really wondering why in the letter to the governor we should not approach the subject of allowing the barbershops and salons to open in their own business locations. We've seen that
That's what Bruno suggested.
That's
Okay.
that's the change we just suggested.
All right, then I apologize. I thought that that was merely to mirror the letter that went to the Board of Cosmetology, so I apologize for that. I'm glad I misunderstood. Thank you very much. That's perfect.
Yeah, we just made that change at this point, so that was something the board just agreed upon. So,
Yeah, basically,
so
we're basically
ahead,
looking
Bruno.
for anything in between normal operations by appointment type of thing, all the way to possibly at least let them try and do this inside people's homes.
All right. Thank you, Melissa. Any other comment at this point, Jake?
No, it doesn't appear so, but if you
Okay.
would like, we could open the floor.
Yeah, open the floor and then we'll go to any written comment.
All right.
I don't know what you want to do.
All right, the floor is unmuted. If you would like to make a comment, please state your
We're going to do
comment.
just a couple of these examples together.
Okay, not hearing none, we'll go ahead and close the room up. Thank you, Jake.
Yeah. Better than before.
Okay, Carol, do you have any written comment on this agenda item?
No, I do not.
Okay, I'll bring it back to the board then. We'll close public comment, bring it back to the board for action.
I would move that we send the letter as with the suggested amendments to Governor Newsom and our state legislators.
Second. Oh.
So, a motion and a second. Supervisor Sabatier second. So we'll go ahead and go with roll call vote. Carolyn?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
All right, motion passes. Yeah, Supervisor Sabatier.
I just want to interrupt and ask Jake and Sam, is everything going well as far as the stream? Because I know that it seems to me I'm getting a little bit of stuttering and some audio distortions. Wondering if that's happening on my end, if that's happening for everybody, or at least for the streaming to the public, if that's also being an issue.
It seems like since we've come back from the break, we do have a little bit of a drop in audio consistency, maybe even like a quality, but it's nothing that I would consider show stopping.
Okay, just wanted to check in.
Yeah.
Thank you.
Okay, thank you for that question, Bruno. All right, moving back along the agenda here, we're item section 5, approval of consent agenda. Consent agenda items are usually non-controversial, will be approved. Are there any items from the board that need to be pulled? All right, have we gotten anything anything from the room or from public comment on any items from the consent agenda that need to be pulled from the public?
No comments by email, Mr. Chair.
All right, Jake, I guess, can you open up the room?
Yes, I could open up the room here.
That's
Okay.
more complicated than it needs to be. So we have two examples. Emily is luckier than Mary, but Alyssa
floor is
so
open.
lucky.
Okay, we'll go ahead and close the room again. Someone's teaching class or something.
Someone's multitasking on conference.
Multitasking for sure.
Muted
So
that
we'll bring this back to the board for action. Approval of the
Mr. Chair.
consent agenda.
Mr. Chair,
Yes.
move to approve the consent agenda 5.1 through 5.5.
Motion by Supervisor Scott. Is there a second?
Second.
Supervisor Sabatier seconds for the consent agenda. All right, go ahead, Carolyn. Call for the roll call vote.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Aye.
And Supervisor Simon?
Aye.
Thank you.
Thank you. Moving right along, item 6.3, 1030 a.m. public input. Do we have any public input, Carol, that was written in?
I have one by email, Mr. Chair.
Okay.
Comes from Ramona De Viola. She says, given that we are approaching wildfire season, I don't see anything on the agenda that addresses this ongoing threat. Are there plans to create microgrids or solarizing the county? What efforts are underway to ensure we prepared for the inevitable PSPS this year? As dire as the COVID-19 pandemic is in our society, this is a long-term threat that is here to stay. In my opinion, we need fewer weeks or months dedicated to law enforcement or mental health and the time dedicated to creating and implementing said proclamations and more concrete, tangible, and actionable goals for our county. Who is writing plans to bring power grids to Lake County? Who's writing grants for cleaning our lake? Who's writing grants to get mental health and rehab services? Those are the types of things our communities need, not feel-good awareness training declarations. Everyone wants to get back to work, but if we have another year like the last 5, there will be no work to go back to.
Okay, Carol, thank you. Take that public input. Supervisor,
I just want to respond and say there is a PSPS meeting this Friday, so it's not a subject matter that has dropped off our radar. It is absolutely still on our radar.
Absolutely, everything is still being worked on. All right, moving. Is there any more? That's all you had, right, Carol?
That is all.
Okay, thank you. Jake, can we attempt to open the room, I guess, on public input?
I have somebody who missed input on item 5.4. Did we do that?
Yes.
Yes, we already did that.
Well, we'll be doing the proclamation next. That was just approving of it.
Okay.
That might be what they're here for.
So that was part of the consent agenda items that were approved. And then we're going to move right into item 6.4 next.
Okay, well, I will unmute the floor for our current item. Okay, the floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, bring it back.
Okay.
All right, thank you very much. That concludes item 6.3. We're going to move to item 6.4, our 10:35 a.m. item. I know we're behind schedule, but we'll go ahead and a presentation of a proclamation designating the week of May 3rd through the 9th, 2020 as Law Enforcement Officers Week, and B, presentation of a proclamation designating the month of May 2020 as a maternal mental health awareness month in Lake County. So I see, we'll go ahead and start. I see the sheriff here, and Carol, are you gonna do the presentation, or is the sheriff gonna do the presentation?
I assumed the sheriff would. Are you able to, Mr. Sheriff?
I'm up to it. I don't have it.
Oh, okay.
Yeah, that's what I was just thinking.
So Carol is.
And I don't have it readily at my fingertips either. Carolyn, can you shoot it to me?
Yes, it is attached to the item. If any of
read
the
it.
supervisors can read it.
Go ahead, Supervisor Sabatier.
And I'm
Sorry,
wondering
Mr. Chair.
if Jake can put up the picture. Thank you, Jake. So, Board of Supervisors, County of Lake, State of California, proclamation designating the week of May 3rd through 9th, 2020 as Law Enforcement Officers Week. Whereas, from the beginning of this nation, law enforcement officers have played an important role in safeguarding the rights and freedoms which are guaranteed by the Constitution and in protecting the lives and property of our citizens and the operation of correctional and detention facilities housing millions of prisoner and detainees throughout the nation. And whereas, through constant application of new procedures and techniques, such officers are becoming more efficient in their enforcement of our laws and ensuring safety, containment, and control of the human beings charged to their care, while sustaining uncompromised regard for their dignity and constitutional rights. And whereas, It is important that all citizens know and understand the duties and responsibilities of their law enforcement agencies and the necessity for cooperating with them in maintaining law and order. And whereas it is important that all citizens and understand the extraordinary risks and sacrifices that dedicated men and women who have chosen law enforcement as a career face as their safeguard our freedom and security, and the public from the criminals in their custody, while at the same time encouraging such prisoners to develop skills and attitudes that can help them become productive members of society after their release. And whereas it is fitting and proper that we express our gratitude for the dedicated service and courageous deeds of law enforcement officers and for the contributions they have made to the security and well-being of all our people. Now, therefore, be it proclaimed by the Board of Supervisors of the County of Lake formally designates the week of May 3rd through 9th, 2020 as Law Enforcement Officers Week in Lake County and publicly salutes the service of law enforcement officers in our community and in communities across the nation, dated this 5th of May, 2020.
Thank you for reading that, Supervisor Spatier. Oh, who want to bring it back? Sheriff Martin.
Thank you, Chairman Simon. Thank you to the board for recognizing on behalf of the men and women of the Lake County Sheriff's Office, our deputy sheriffs that work in either in the correctional facility during these extremely challenging times, as if it wasn't difficult enough on a regular basis. We're now all having to deal with this coronavirus. So on top of the everyday dangers that they face, we now have this this unseen threat to their safety that's as recently as yesterday has really come home. So I want to take the time to acknowledge them. So deputy sheriffs that work either in the jail or out on the streets work 24 hours a day. There's never enough cops on the street when you want one. I think people in Lake County are acutely aware of that, and I really want to thank them. Normally, we do a public memorial ceremony at the Peace Officer and Firefighter Memorial down in Museum Park, and unfortunately, because of the COVID-19 pandemic, we've had to cancel that. We are working on a brief production video to put out on social media that we'll be sharing sometime later this week. So we will have the chance to honor those 5 fallen deputy sheriffs that have made the ultimate sacrifice to the County of Lake. Thank you for the proclamation on behalf of the men and women of my office and of the law enforcement officers that serve the rest of the county in the police departments, the Highway Patrol, the Fish and Wildlife Service, and a variety of other agencies.
Thank you, Sheriff Martin. And I usually would give thank you very much. And we really appreciate what our law enforcement and everybody does. So proud to present this proclamation today. Yeah, and I see Jake put the clap up. Thank you, Jake. Moving on to our next item B, we have the maternal mental health. And I know I did not previously reach out to Supervisor Scott, but I didn't know if you were interested in presenting this item.
I would be pleased to present this item.
Thank you.
Proclamation designating the month of May 2020 as Maternal Mental Health Awareness Month in Lake County. Whereas maternal health is an issue of great concern to Lake County's parents, families, healthcare providers, and whereas these disorders can affect any mother regardless of age, race, or income level. And whereas many women are not adequately informed about screenings for treatment for pregnancy, postpartum mood, and anxiety disorders. And whereas heightened awareness and stigma reductions are essential for improving outcomes for mothers, children, families, and communities. And whereas pregnancy and postpartum mood and anxiety disorders are highly treatable through therapeutic interventions, community-based supportive services, and medications. And whereas health services providers and community support systems must be able to identify risk factors and symptoms in order to provide prompt diagnosis, treatment, and support services to enable full and speedy recovery. And whereas Motherwise is a proactive program that helps mothers and families through the transition with new babies to prevent and lessen the effects of prenatal mood and anxiety disorders, funded through Lake County Behavioral Health and Proposition 63. The Mental Health Service Act, Motherwise, also enjoys the support of many other local and regional programs, including Sutter Lakeside Hospital Clinic, Sutter Lakeside Hospital Family Birth Center, Lake County Tribal Health Consortium, Lake County Public Health, Lake Family Resource Center, Redwood Community Services Incorporated, the NEST Program, Children's Council, Adventist Health Clear Lake, MCHC Lakeview Health Center, First 5 Lake Commission, Centro Latino, Latino Wellness Center, the Voices of Hope, Circle of Native Minds Wellness Center, Bloom, Lake County Breastfeeding Coalition, Easter Seals Bay Area, E-Center WIC Program, Health Leadership Network, and the Maternal Child Adolescent Health Advisory Board. These diverse programs are working with MotherWise to reduce the frequency and severity of the prenatal mood disorders in Lake County. Now, therefore, it be proclaimed that the Board of Supervisors of Lake County does hereby designate the month of May 2020 as Maternal Mental Health Awareness Month and does commend this observance to all citizens. And I think now more than ever, we need to be taking care of our mothers and making sure that they are getting the services they need. For many of them, they're not getting that break that they are used to of having their older children go to school while they take care of their younger ones or be able to go to work. So we really need to be making sure that we are looking out for each other. And I know it's hard in these times. We usually go and help each other in person, but we have to make sure that we are calling and making sure that these mothers are being taken care of.
Thank you very much, Supervisor Scott. I do know that I saw in Bruno, can we, let me see.
Jay, can we bring him back?
There we go. Yes, I see we have Jacqueline Lay right here. I love the picture in the background you have there, but go ahead, Jacqueline.
I had to bring my supporters with me. So.
Yes, you did. Good job.
Yeah. And Tina, thank you for your words. This really is such an important time for new moms, as it always should be if you're a new mom. It should be an important time, but this is hard, and so more so than ever, for sure, we need to be doing what we can. And at MotherWise, we're working out the kinks, as everybody is, trying to figure out how to give social support when we can't be social. So, we don't have a good grip on the effects of the pandemic on moms and families yet. We don't really know what this is going to look like, but we're very concerned. In our pre-pandemic world, women of every culture and race have been susceptible to perinatal mood and anxiety disorders. And you heard some statistics but the evidence is that 40 to 60% of women living in poverty experience postpartum depression regularly, while depression and anxiety are even higher among moms who struggle with domestic violence, also a big concern right now. Have moms with a previous history of trauma and recovering from substance abuse. And then moms just aren't really ready to be pregnant too. So there's a lot of factors already at play. This is just compounding all of those struggles for us. To top it off, moms are, just really lacking that social support. So I really thank you all for taking the time. There's so many important things happening, but I feel this is equally important. And I thank you for taking the time to make sure you're paying attention. It's on your radar. Moms are struggling. They need help. We're doing our part, and just please in your thoughts while you're doing your jobs. We really appreciate all the hard work you're doing. And last, I just want to give some information. If you're expecting or new mom and you need some help right now, reach out to MotherWise. I can't decide where to look here, but
that's all right. You're doing good.
You can call us. We are checking messages every day. Our phone number, I'm going to put it out, 707. And it's 349-1210. Find us on Facebook. That's a good way to get us quicker because we don't have to go check the message. You can message us on our Facebook page. You can email us information at mother-wise.org. Whatever way to get a hold of us, please do. You can also reach out, start with your medical doctor, your OB, or your pediatrician. Let them know if you're struggling so they can get the process started with you to get you the support you need. And same thing goes for family and friends. If you know somebody that's expecting right now or has just had a baby, please reach out to them. And ask them how they're doing emotionally. How are you holding together and what can we do to help you? And just remember, to take care of yourselves, everybody out there. And then, Mr. Crandall, I noticed your red tie. I'm assuming that's for missing murdered Indigenous women. Another great thing happening today. We need way more awareness. I tried to find a red shirt, didn't have one. So another thing, and it's also Mental Health Awareness Month too. I did not see it on the agenda, and I know behavioral health is probably working like mad, like everybody. So just, mental health. This is Mental Health Awareness Month for all types. And if you need help, please reach out. You're not alone. And more so than ever, we really are together. So I thank all of you for your time today.
Thank you very much, Jacqueline, and thank you for the work that you do. Supervisor Sabatier?
I just want to say something real quick to Jacqueline. I feel like I've known you since the inception of Motherwise when we worked together in Power to the Youth and other things. And I just want to say I really appreciate you being here for the long haul to help out mothers and small children to make sure that they have the resources that they need. So thank you very much for being here.
Thank you.
Absolutely. Okay, thank you very much. Moving on with those two, done with that item, item 6.4. Move to our 11 a.m. item, 6.5, discussion and consideration of AB 626, Eduardo Garcia, California Retail Food Code, Micro Enterprise Home and Kitchen Operations. And this was brought to the board by Supervisor Crandall.
Yes, thank you, Chair Simon. I'm requesting an opportunity for our board to review AB 626, which makes micro enterprise home kitchens operations possible under certain conditions. The bill is referenced in the memorandum, and we also had a video that we were going to play, but we understood, and I talked with Jake and a few others, and it would have been very difficult to kind of cohabitate that right now. We're hoping that with the meeting today that we can go ahead and maybe have one in the future once we get this to kind of get discussed between environmental health and whatnot. I also would like to thank you for giving us the opportunity to present this item. We've been working on this since February. Danny Primus, Peter Gammons, and Roberto Cabreros are here with me, and I think they're in the room, and they'll be able to chime in afterwards. We've been meeting remotely within the last month and discussing possible ways to move forward during this pandemic. Our thought process is that we know during these tough times, AB 626 home kitchens may be a way to allow people in the county to attain opportunity to generate businesses for themselves in a brick and mortar fashion. Some restaurants are really considering if they want to continue on or close down. This may give them an opportunity to look into this venture as well, or maybe even partner with such groups. My goal is to ensure we discuss possible opportunities for people in our county to bounce back. This initiative will take some time, and we are simply introducing our positive thoughts to you about AB 626 home kitchens. Without further ado, I'll pass it on to Roberto because I think he has something at 2. I was going to start with Danny, but I'll let Roberto go first if you're in the room. I'd like him to start out. He works at the Yuba College, and actually it's Woodland Community College. My fault, sorry. that shows my age. But if Robert's in the room, we would like to go ahead and...
Good afternoon, supervisors. Can you hear me?
Yes.
Very good. The Woodland Community College Lake County Campus Culinary Program fully supports the county's efforts to implement Assembly Bill 626. The college will support the bill by the following efforts: to offer the nationally recognized ServSafe Manager Certificate course, test proctoring to ensure we offer the safest food possible, to offer management courses like purchasing and food service management to help new entrepreneurs start a successful, sustainable business, to seek grant support to help students with fees associated with the startup through the Strong Workforce Program funded by the State Chancellor's Office, and to teach innovative culinary and baking skills to increase the variety and quality of food served by this program. We feel this Assembly Bill offers an opportunity to our students that has never been experienced before. This Assembly Bill seriously levels the playing field for our disadvantaged students that have always looked to open a food service business in Lake County. We feel this project will increase employment, bring in much needed revenue to the county, and increase a livable wage for Lake County's residents. Thank you for your time.
Thank you, Roberto. So,
go ahead, Supervisor.
Okay, sorry about that, Chair.
Go ahead.
Peter, if you're in the room, would you like to go ahead and go next? Peter Gammons from Cook Alliance.
Can you hear me? This is Peter Ruddock.
Oh, sorry about that, Peter Ruddock.
No problem. Thank you, supervisors and folks from Lake County, and having me join you. I am with the Cook-A-Lot. We are the sponsors of AB 626, the Homemade Food Operations Act. We've been working with Assemblyman Garcia since the beginning. We actually brought the bill to him, or a predecessor organization of ours did. Sorry, I'm not on video. I'm calling you from my home in rural Santa Clara County, where broadband isn't very good. So you a little bit of background on the law, sort of the whys of why the law is presented, and then a little bit about how it gets implemented if Lake County chooses to move forward, which we are hopeful. One of the reasons we look at implementing a law like this is that people are rather alienated from their food. This is certainly being isn't particularly healthy food. Connecting them to their farmers and their cooks is something that
definitely having some technical difficulties at this point, cutting in and out, and I think we may have lost him at this point.
Sometimes it's easier to call in versus logging into Zoom, because then you use your phone connection rather than your data connection.
That's true. If I can log out and go back in, if Danny wants to go, and then I can finish after her.
Yeah, let's try it that way.
All right, I'll be back in on the phone only in a minute. Sorry about that.
All right. Let me just check here that everybody can you hear me okay?
Yeah, we can hear you and see you.
Awesome.
Go ahead.
All right. I just wanted to say hi face to face. And thank you so much for giving us the opportunity to present this to you. I think it could do a huge amount of good for Lake County. I work with the volunteers over at the Lucerne Senior Center. I'm a board member over there, and I've been really big into the community and trying to make a difference. So I wrote everything down. I have a tendency to forget because I get a little nervous. So here goes. Dear supervisors, my name is Danny Primus, and I have been out of work for 2 years. I was diagnosed with fibromyalgia in my 30s and have had 6 pain-free days since then. A flare left me debilitated in 2018. I had to walk away from my job, and I was told that I could still do other work, so my disability was denied. How can they say that those of us who rely on medication that keeps us from driving are still suitable for other work? A person's choices in a rural community like this are to deal with the racking pain or to stay home, try to find an Uber or Lyft in Lucerne. Now that we've had to shelter in place, we've seen a lot of jobs go from a business space to a home. One of the few things we can't do at home, though, is cook. We can make cookies and cakes with a cottage food license, but we can't make a healthy dinner. And we desperately need real food in our communities. We can change this. California law AB 626 allows home kitchens to be used for business. We're being held to some pretty strict standards by the law itself. We can choose to do it. This would put food options into places like Spring Valley and Cobb and create jobs. Well, on my first call with the Cook Alliance, I remember them talking about the current income limit and how difficult it would be for people in places like the Bay Area to make ends meet. They didn't understand that in Lake County, that same limit would be life-changing. A little extra would allow a working father of 4 who comes home and cooks for his family to pick up a second job without actually having to pick up a second job. A little extra would stock empty refrigerators and freezers with healthy foods that our cooks could also make for their own families. If that's not enough, think of the ability to work from home. It helps residents who move to Lake County in order to provide care for a loved one an opportunity. This is their chance to generate some income without having to leave their loved ones unattended. It allows that restaurateur who just had to make the heartbreaking decision to close his restaurant's doors forever a chance to scale back and rebuild.
We have the Cook Alliance here to help us. We have a web ordering service ready to take us on. Cooks will be able to post what they are serving and when, and foodies like us can browse and decide what we want to eat. They're not charging us for this service. They just want to see home cooks succeed. We need this revenue, especially after all of this is over. The greatest thing I can think of, though, is that the next time there is an emergency and we have to shelter in place, there would be 100 less people in Lake County who would lose their jobs and 100 more places where our residents could purchase healthy food. Thank you for your time.
Thank you. Thank you, Danny.
This is Peter. I'm back on the phone. Can you hear me?
Yes. Go ahead, Peter.
Excellent. Sorry about that.
That's right.
So starting a restaurant is very expensive. Opening a brick and mortar takes about $50,000 to $100,000 at a minimum to get a commercial kitchen and all the health regulations. It's a big reach for people, especially people who've never done a restaurant before. A home restaurant can be started for approximately $1,000 between fees and minimal required equipment. This creates at least two opportunities. There's that incubation phase that people can go through to test out their restaurant, but there's also the side business that somebody who doesn't want to grow but needs to make some extra money, a stay-at-home parent, somebody who needs a little extra income, can create a business like this and run it within the guidelines, which are limited for both food safety and nuisance reasons by number of meals and by income. $50,000 a year gross income with a cost of living allowance. So these home restaurants are not intended to be primary businesses. If you are going gangbusters and you want to grow beyond that limit, you would essentially have incubated yourself into a brick and mortar, but you would have tested out the concept. In doing this, we always still talk about food safety comes first. A lot of stakeholders have been involved in this, including the heads of environmental health for many counties through their organization, CCDEH. The rules for food safety are not as stringent as a brick and mortar restaurant, but everybody who was involved believed that they were appropriate for scale, that just like a farm stand or a farmer's market gets an advantage, a consideration that they can see their customer, that direct sale gives some benefit, some thought that I can see what this person is doing. I can judge safety for myself as a customer, that we could do this with cooks and eaters as well, that the scale is smaller, but the relationship is also direct. So we understand that safety is an issue and we want to talk through it as much as possible. We believe that the law has sufficient safeguards into it. Cities do not opt in. Entities that have their own environmental health department or equivalent opt in, which mostly is counties. There are a few exceptions to that. Cities would still be in charge of zoning. Early on, somebody said, oh, I'm going to capture the lunch crowd for the graveyard shift and have a home restaurant at 2 a.m. Well, no, you're not. Zoning isn't going to permit that. Your neighbors aren't going to be happy. We estimate that there are about 50 to 100,000 people in California alone cooking and selling homemade food already. Many of them would become permitted. Some of them won't. As far as we can tell, there are no large safety problems. Are there individual issues? Of course, there are in home kitchens, there are in restaurant kitchens. it's basically already relatively safe. If we can get a significant number of those folks to be permitted, it should be even safer. Going through the required food manager certificate all by itself tends to teach cooks a certain amount of safety, as well as the inspection of the home kitchen that environmental health would do. As was mentioned by Danny, the advantage of this in a situation like we're in now, or in a fire or an earthquake, that it's good for the local economy. People can make some amount of money feeding their neighbors who may otherwise be having trouble getting food. It's something we considered from the beginning, but it's certainly been driven home by fires in the last couple of years and now by our sheltering in place during the pandemic. So we look at this as win-win situation. Cook Alliance is now supporting about a dozen counties. Only Riverside has made it all the way through the process. Solano will start issuing permits after sheltering in place is over, and another 10 counties or so are moving forward at some speed, but will probably wait until after sheltering in place, which, as Supervisor Crandall said, this is a discussion. We're probably not envisioning not having permits issued until after sheltering in place, because the health inspectors need to be safe going out and visiting homes. Cook Alliance is looking to be a partner with the supervisors, with the health department, with citizens like Danny and Robert. And we're in this for the long haul, and we'll be there to support you in any way we can. Thanks.
Thank you, Peter. Thank you for your presentation. Appreciate you calling back in.
Sure. Sorry about the technical difficulties. I'm glad I didn't have the camera on. That would have been even worse.
Thank you. Okay, Supervisor Crandall.
Yeah, Peter, I just want to apologize for the name mix-up. I must have been thinking about how much I miss baseball, because Peter Gammons is an actual announcer, sports analyst, so my fault. But thank you again for working with us on this. And we have one more gentleman, I guess, by the name of Blake. If he's on the line, he'd be our last caller, and then we'll move forward from there. Blake, are you there?
So I'm here. Can you hear me?
Yes.
Can you hear me now?
Yep.
Yes.
Can you hear me now? Hello?
Yes.
Okay, it kept bouncing in and out on muted and unmuted there for a second.
Yeah, sorry, I found you on accident and then so you're good now.
Okay. Danny was the one, the lady that approached me. I believe I found her by accident through one of the Facebook pages of the county, like Lakes List or one of the buy, sell, and trade pages or something like that. And I immediately started following the Home Cooks Alliance page on Facebook because this is something that, if came to light and was actually able to be done here in this county, I would want to be one of the first people to get started with it. It has been just one of my biggest dreams since I was a kid to be able to own my own restaurant. After the last about 4 years of living here in California, I've done a boatload of research on what it takes to be able to open a restaurant or even just have a food truck sort of situation. And just the fees and bases alone to get started on that are up of, $5,000 or so a year minimum. Then on top of that, you have to have your own commercial kitchen that is approved by the state. There's many, many loopholes that have to be jumped through to be able to just say, take a trailer and a barbecue pit to a local park and sell burgers out of, and that isn't, gives me the opportunity who I've been in and out of restaurants since I was 15 years old. and I'm 28, fixing to be 29. This gives me the opportunity to be able to get started on my dream of being able to get off the ground and have my own place and my own restaurant. Because even as a kid, you know, my parents would come home from work and I would have a little menu set up for them and have dinner made and stuff like that at 12 years old. And this is something that I can be able to do from home and be able to help my wife, who's got multiple medical problems such as fibromyalgia, lupus, degenerative bone disease, be able to help take care of our 1 month old that we just had, and being able to provide good quality food and do it with a passion that most people don't have. I'm the type of guy that would go out to a local rancher that's got cattle for sale, such as the organization that does the bison meat sales just outside of Upper Lake, and be able to buy meat from them, cook it and resell it, you know, and do farm to table just like people did where I'm from in Texas. That's where most of the restaurants and stuff like that did. And then the local farmers that have just beautiful heirloom tomatoes or gardens that don't necessarily get picked up by the bigger restaurants, you know, because they would prefer to go through like Cisco or A1 Produce, you know, the bigger distributors and stuff of that nature, instead of the local farmers. And the local farmers and ranchers would be given so much more opportunities to be able to have their produce and products bought, and they wouldn't have to fight to be able to get into these bigger restaurants and stuff of that nature to make money and grow their own self, you know, because especially with like the vegan communities and the vegetarian communities and stuff of that nature, if you are strictly doing that for dietary or choice, you know, you can look those options up and know that you're getting exactly what is that, and you're not going to have to worry about cross-contamination and stuff like that at an affordable price that most restaurants aren't doing. Because if you go to a restaurant right now with a gluten intolerance, you are paying extra for the fact of you having to get a gluten intolerant meal. And then you also still run the chance that if there's 7 or 8 guys and women in a kitchen, that some way, shape, form, or fashion, there's possibly going to be a severe contamination of gluten in some way, shape, form, or fashion. You know, not on purpose or anything like that, but, you know, if one person didn't realize that it needed to be a gluten-free meal and accidentally put some sort of gluten item on the dish, well, then that person is now going to possibly have a allergic reaction, or they're not going to want to eat the meal, you know, or even go back to that restaurant. I've worked in several restaurants over here that I've had to go and specially make and spend almost half an hour specially making a gluten-free meal for my regulars that were in the restaurant that I was working at. And we had to charge extra because of it.
You know, I was, you know, I was thinking that you were part of the presentation, but it sounds like I appreciate your comments, but we are going to bring this back to the board and then open it up to public comment. It sounds like you're in complete support, and that would be the point when we go with the public comment. I thought he was part of the presentation like the other two, EJ, and I apologize on that.
That's my fault too, because I thought that as well, and I got the text. I didn't realize he was part of public comment. But thank you for your comments, Blake.
And I'm appreciative of the fact of y'all being able to be willing to listen to me. This is something that I stand behind 100% and hope to see come to light.
Yeah, thank you, and we hear that. We hear your you know, your support for the program here. I know that what I'd like to do is bring it back to the board for any comments on the discussion today, and then we'll open it up for public comment. Go ahead, Supervisor Sabatier.
Thank you, Supervisor Crandall, for bringing this to the board. I've been in discussions about AB 626. In fact, Supervisor Crandall and I have been talking off and on about AB 626 as well for about, I want to say, 9 months, if not longer. It's been brought to my attention from Chef Cabreros from Woodland Community College. I know he's really adamant to get his students involved in a lower threshold of getting into the industry. I did reach out to environmental health, and I see that we have environmental health here with us as well. Reached out to public health, reached out as well to the California Environmental Health Association, and also reached out to the environmental health director in Riverside, where it was the first county that decided to opt into AB 626. I was waiting for about a full year to complete for Riverside so that we can gather some data in order to say, yes, it worked, yes, no, it did not work. But obviously, things have changed drastically since my last communication with them back in October with COVID-19. I appreciate and will always promote competition in our businesses. However, I am not sure where I stand on creating a lower threshold of competition for our restaurants when our restaurants themselves are struggling so much to stay afloat with the situation of COVID-19 and their inability to serve as much of the public as they're used to. It's been said in the presentation, the success rate of restaurants and the ability to to meet your margins in order to stay successful are very limited in restaurants. And it's a very high risk industry to take on. I'd like to continue the discussion because I think there's merit to looking at AB 626, but I'm wondering if maybe we can do a slow process and look into that, where maybe our restaurant owners can have access to AB 626. So now, to save themselves, they might be able to access that type of ability to cook from home rather than having to continue to utilize their restaurant where the overhead is still high and the revenue is real low. And then seeing how that works, and then moving on to home cooked meals from others who want to join in. Again, I just don't know if the timing is necessarily right. I absolutely want to see AB 626 happen in the near future. I just don't know how the implementation of it will affect those that are really struggling right now in the restaurant industry as we speak.
Thank you, Bruno. Supervisor Scott?
You know, I agree. I think timing is essential. My thoughts on this is I've already seen a couple restaurants in Lakeport that have already, that are done. They've already put their places up for lease. And I think this might give them the ability to maybe start from home and build their business back when we're, through this COVID-19 issue, and maybe able to come back to business. So I think that's a great thing. And I think we also see, we also find people already cooking out of their homes. I know I'm approached many times in the parking lot of Safeway or such, people selling foods out of their homes. So this will be another opportunity for them to be able to do it this a legit way. I would like to hear from public health and environmental health and what they see could be the issues of having a program such as this in our community. But I'm really glad. Thank you, Supervisor Crandall, for bringing this to us.
Yes. And Tina, that's a great segue. I see Denise has already put her hand up. So go ahead, Denise.
Hi, can you, supervisors. So I didn't want to jump in front of other supervisors. AB 626 is something that we've been having conversations with. Supervisor Sabatier has came over to the health department a few times, and we just had a conversation with Supervisor Crandall last week. During the time that we are right now with the COVID-19, from a public health standpoint and environmental health standpoint, and I know Jeff's just on here somewhere, he can speak a bit more, is really not the time to start this. We definitely would want to wait until this calms down. We are absolutely open to having meetings and conversations about it. as our time and ability allow. But we'd really like to see what happens with Riverside. They're kind of the pilot for the state. There are some other counties thinking about it now, but we're kind of watching to see, learn from others. We're a really small county. Our department is really small. We're very short on resources. We only have a few inspectors. Putting up a brand new business like this would require, a significant amount of time during a time where we're already extremely overworked during responding to COVID-19. So I'm happy to continue the conversation and look like what it could look like maybe for our county and bring it back to your board at a later time. And I'll let Jesse, he has all the, EH rules and all those things, but I'm not even sure today's the time to even go into all that. There are concerns from the environmental health standpoint and the public health standpoint about food handling, food safety, temperature, storing, quick cool, temperatures of ovens, all those things that happen in a permitted commercial kitchen that help keep food safe versus a home kitchen that doesn't meet the majority of those requirements. So separate hand washing sinks, there's a whole list. But we understand that this is important to the supervisors and it's important to the community. So we'd like to move forward with some conversations to start and see what we could do.
Denise, thank you very much for that clarification, weighing in on this, obviously. We hear you loud and clear about your concerns at this point for the response to COVID-19. So, Supervisor Crandall?
Yeah, I just wanted to, just talk with, or just mention that we did talk last week, and this was just kind of to get this on the agenda to discuss it. I know that Denise has talked about meeting with this, of course, before we knew we had the COVID stuff in place, so we understood that they were busy with that. But it was just to get it out there, get the ideas stirred in different folks' mindsets. Also for different businesses and restaurants that are already contemplating closing down. So that's another reason why I was thinking to bring this up, not just with what these folks are bringing to me. And one more last attribute to it is this group has talked about trying to fundraise at least $100,000 in order to pay for an extra couple positions. Of course, that's a little down the road. And that's really all this is. This is long term. It's not something we're trying to implement right away. They're looking at, October, November is one of the dates that we were looking at as a projection too. So it's also, they're still in the beginning phases, and also they need to meet with Denise and the health department as well. So she's exactly right in that we were discussing, and we will discuss further. So
thank you, Supervisor Crandall. Any more questions or discussion at this point from the board, Supervisor Sabatier?
So I know that I've read AB 626 inside and out to try to figure out how to best implement it. And basically, as it's written, you have to say yes or you have to say no. There's no tweaking of the rules from the state. There's no local jurisdiction capability of making changes. But since we have to license people, can we create our own criteria that before we license you and then you have to follow these state rules, can we create our own caveat? I know that Chef Cabreros had mentioned that there's two, not in this group here, but he had mentioned to me, and I know this from working at the college, that there's two different types of food handling permits. One of them is your food handler's permit, and one of them is like the manager's position, management handling or something like that. And that maybe we can create a separate level of class saying, if you meet this, then you can be eligible to do this licensing, but it doesn't affect the licensing that follows the state rules. I'm just wondering if there's something that we might be able to do, because I think that was part of the issue from environmental health, is that it doesn't really give us enough control compared to like the control we have for a restaurant. So just looking for ways to make this fit better and to make it more palatable for our environmental health, because it's definitely a whole lot easier if we have them supporting this rather than us trying to push something through that may not have the full support from our department.
Thank you, Supervisor Spatier. And I see that I have another department head, Jan Coppinger from Special Districts, who'd like to make a comment. Go ahead, Jan.
Yeah, I just wanted to weigh in if you're going to be setting some local jurisdiction. The sewer systems are already having some struggles with some of the cottage industries and people cooking in their homes and the grease that's getting into the sewer. So I would like to see an additional set of stipulations that these people cooking at home would need to have a grease trap and would be treated like a restaurant, because the extra grease getting into the sewer we have quite a few down in the Clear Lake area, and it's just been an ongoing problem. And it's real hard for us to control because you can't tell what's going on in the house, but we hear from the neighbors that it's food being sold out of there. So we would like to also be included when you start setting up some stipulations for this.
Thank you, Jan. Thank you for bringing that up.
Maybe when when we set the meeting for Denise and then the Cook Alliance, we'll invite Jan so that way all those concerns are there. And that's all that is a meeting of discussion.
Okay. Any more discussion at this point from the board? All right, we'll go ahead and open it up to public comment. Do we have any public comment on this item? Carol, do you have any written comment?
No, none by email today, Mr. Chair.
Okay. Jake, can you open the room up?
Yes. Yeah, I can open up the room. Okay, the floor is unmuted. If you'd like to make a comment, please start with your first and last name.
This is Blake again. I would like to continue and chime in a little bit more here, if possible.
Yeah, you got 2 minutes, Jake. Blake, I apologize.
Not a problem. The grease trap situation, I do agree on that. The grease situation is a very big situation that does need to be addressed.
How are you?
Maybe
Board of Supervisors meeting real quick.
Not sure, sorry, but put your phone on mute if you're not on it. Go ahead.
Sorry, I think I muted the wrong person. Blake,
okay.
Are you still there?
Yeah, I'm here.
Okay, go ahead, Blake.
The grease trap situation, that is something that does need to be possibly addressed in a way that, I've seen McDonald's and Lakeport get shut down because of the amount of grease that was in the sewer system underneath their building whenever I was working there. And then the sanitation and stuff of that nature, that is something that does need to be completely 100% a major issue. Make sure that everybody that does have this AB 626 thing, they do follow the strictest guidelines possible for it. Making sure they've got sanitation buckets, the proper cleaners, and proper know-how of what needs to be cleaned and how to clean it. And then disposal, such as your trash, your food waste, stuff of that nature. So that way we don't run into situations with the county where people are just dumping food down their drains or, however they want to dispose of it. Make sure it's disposed of in a proper way. Make sure that everybody's following guidelines that they know that they need to be following for restaurants and stuff, because even working in the restaurants myself, I've seen people go and handle raw products such as seafood or meats and then go run their hands into the water for a few seconds and then go right back to making somebody else's burger. That's all.
Okay, that's two. Blake, if you could wrap it up, Blake, I'd greatly appreciate it.
Yes, sir. And I agree with everything that everybody has brought up about AB 626. I believe this is going to be a fantastic thing for the county if it does pass. Maybe not at this time because of the COVID-19 and everything, but if this is something we're going
to go ahead and wrap it up.
Okay. I appreciate all your time and everybody, and thank you for listening to me.
Thank you, Blake. Jake, can you open the room up one more time and see if we have any more comment on this item?
Yes, I will open up the floor once again here. All right, everyone is unmuted. If you would like to make a comment, please state your first and last name.
Okay, hearing none, we'll go ahead and close the public comment, bring it back to the board for final discussion on this item. All right, Supervisor Spatier, I don't know if you wanted to finish anything here, Supervisor Crandall, but it was a good discussion and something looks like could be a long-term conversation that we should be having. Go ahead, EJ.
Yeah, so thank you again for having this discussion. It was, these folks have been meeting about it for quite some time, like Bruno Sabatier had said, and I just thought it was, I know that there's a little difference in opinions about timing, but I just figured on another note with people closing down that, hey, let's look at other options, and it's a long-term situation. It's not something that they'll do right away. Of course, Riverside's the only one doing it, and we'll be looking at a later date when things kind of calm down to come back. And of course, once both groups have a chance to come and talk amongst one each other and iron some things out, we can go forward from there. But in the meantime, topic of discussion, hopefully stimulate some ideas for people that are watching, and go from there. So thanks again.
Okay. Thank you very much. Thank you for bringing this, Supervisor Crandall. So with that, we'll go ahead. It was for discussion only, and it seems like it'll be a continued discussion and brought back by Supervisor Crandall. We'll go ahead and move to item 7.2, consideration of letters to Governor Newsom, to Senator McGuire, and to Assembly Member Aguiar Curry to advocate for our funding needs for disaster response and revenue lost resulting from the COVID-19 crisis. Supervisor Sabatier.
All right, thank you very much. Really, all I did was receive an email from CSAC with a template letter on there for the requests, because this is not just for the County of Lake. This is all counties put together are dealing with the shortfalls. So all I did was forward this to Carol Hutchinson. Said, let's, if you're not putting it on the agenda, let's put it on the agenda. She did the rest by adding the Lake County portion of it to the letter. But really what it does is all the stuff that we're being affected by the deference of sales tax, by some of the property tax delinquencies, some of the fact that the CARES Act from the federal government didn't include counties with less than 500,000 population. We're just requesting that somehow or another they review those policies and make sure that they keep us whole, or as whole as possible, so that we can continue to offer services to our communities and be here for the reasons that we are. But I'm going to let Ms. Hutchinson go ahead and elaborate on anything that she may need to elaborate on, because she's the one who did the bulk of the work on this, not me.
I don't really think there's much more to say about it. I mean, we're just trying to advocate for our funding needs in every possible way we can. You approved a similar letter at a meeting, it was last week or the week before, the Tuesdays run together. And the letter got there too late to have an impact, and now there's a new round of funding up for consideration. And so this letter appears to still be timely. And on a similar note, I have also signed on to a letter with my peers from most counties that are also making this same point to our elected representatives, that counties need not only funding to backfill some of the losses, but help with cash flow as well.
Excellent. My one question on this letter is, I know we, Congressman Thompson, are we going to write one to Congressman Thompson and Congressman Garamondi too? I know the federal funding is coming down the pipe. Would we add them to this letter?
This particular request, CSAC was recommending we send it just to state reps. But anytime your board does letters like this, I always make sure they are CC'd to all of our elected reps.
Okay, thank you very much. Bruno, thank you for being obviously our representative on CSAC and bringing this forward. Thank you very much for all the work you're doing right now, being on those calls and everything that's happening.
My pleasure.
And the same thing goes for our RCRC rep and the rest of the board and all the calls that are happening. So thank you. Okay, any more discussion from the board? Okay, well, seeing none, we'll go ahead and open this up for public comment. Carol, do you have any public comment on this item?
Let's see, none on this item, Mr. Chair. Thank you.
Okay. Jake, can you open the room up?
Yes, I will open the floor for public comment. All mics are unmuted. If you would like to make a comment, please state your first and last name.
Okay, if anyone would like to make public comment on item 7.2, the letters to our the governor and also our representatives both in the state and the assembly. Okay, hearing none, we'll go ahead and bring it back to the board for action.
Let me scroll down. Mr. Chair, I move to approve the letters to Governor Newsom, to Senator McGuire, and to Assemblymember Aguirre Curry to advocate for our funding needs for disaster response and revenues lost resulting from the COVID-19 crisis.
Okay.
And add our federal representatives to that as well.
BCC, yeah, okay. Thank you, Supervisor Spatier and Supervisor Scott. Go ahead. There's been a motion and a second. Carolyn, can you do the roll call vote?
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Thank you. Item 7.3, we'll move along. Consideration of an ordinance amending Chapter 21, Article 27 of the Lake County Code pertaining to commercial cannabis cultivation. This item was brought to the board by Supervisor Spatier.
So I'm going to share my screen real quick and just do a quick 5-minute presentation, except I've been disabled from screen sharing. Jake, can you enable me to share screen?
Yes, you should be enabled now.
There we go. I feel like I'm in a sci-fi movie right now.
Yep, and I do see Mark Roberts had joined us.
Okay, so there we go. So this is changes and revisions. These are through conversations that I've had over the course of the year with either those who want to be applicants or those who are already applicants. And just to me, some of it was and we'll see what the rest of the board feels as far as some of the changes. So right now, here are some of the changes. Acre and plant count changes. Type 1 and type 1 is outdoor, up to 5,000 square feet, so 50 by 100. And then type 1C is also outdoor, but cottage industry outdoor with a maximum of 2,500 square feet. They had a limitation on plants. I believe it was 25 and 50. And the industry being what it is, we're learning as we go, especially with them paying taxes on their plants. A lot of things that I've learned over the course of the year is autoflowers. And well, they can get a lot more out of their grow in that same amount of square footage, but when they're limited, we're telling them how to farm and they're limited, then they're limited on the amount of revenue they can make, which then again comes to us in taxes. Why not get rid of the limitation? It's still the same square footage. Let the farmer decide how to use that area, and we still benefit the same. So that's why I got rid of the limitations on plants for type 1 and type 1C. Type 1A indoor and type 2A indoor and type 3A indoor, I'm looking at changing the minimum acreage. Type 1A will be going from 5 acres to 2 acres. 2A from 20 acres to 2 acres, and 3A from 20 acres to 2 acres. I will say that I'm flexible on the acreage. I recognize that as it grows in square footage from type 1A and 2A, which I have right here, goes from 5,000 square feet to 10,000 square feet, and then 3A is 22,000 square feet. I'm okay with moving on up on the acres and going 246 or 248. I'm flexible on that. Through the discussion with Director De Leon, he asked for a GIS staff member to look at how many new parcels this would add. Right now, it's at about 5,100. I don't have the specific number in front of me. If it was changed to 2 acres, it would add an extra 900 parcels. Now, it sounds like a lot, but at the same time, we only have 1 or 2 indoor activities happening throughout the entire county on 5,000 potential acres. So to me, outdoor is the issue. That's the nuisance when it comes to cultivation of cannabis. So I'm looking to say, can we help people do it indoors to kind of minimize what's happening outdoors? Because obviously we're not seeing the indoor operations enough to say that we're trying to curb the potential nuisance of odor. There's some very strict guidelines when it comes to indoor. This is not a mixed light. This is not a greenhouse. This is strictly indoor. And the filtration definitely needs to be up to state level and up to our recommendations and expectations based on the ordinance. So that's one of the changes. Processing. Processing is zoned in specific areas, but there is one that just doesn't make sense when you go through the list. You can do processing anywhere that you can do manufacturing except in a PDC, and then that's planned development commercial. And when you go through and you look at what processing is versus manufacturing, and I'm not seeing it, give me 1 second, I seem to have lost my way. Sorry, it's a long ordinance. There it is. When you look at manufacturing includes processing, but it's almost twice as expensive as a state license. It allows for extraction as well as what processing typically would be the breaking down of the buds, maybe the rolling of joints, maybe the packaging and things of the like. Why aren't you allowed to do processing where you're allowed to actually do extraction, where now you need to build a special room in order to do that kind of a process? So to me, it makes sense that if you're allowed to do manufacturing, which is the highest level of safety precautions needed, why aren't you allowed to do processing in the same zone? So all I did was marry the two so that you can do processing in the same places that you could do manufacturing. So that's the only change for the zone. Water board permit. At one point, we had stated that we wanted a expiration date of October 31st, 2019 for cannabis cultivation permits for obtaining a water board permit is really what I meant to say. That disappeared from our ordinance. I think that was not intended to happen, but it did, and we approved of a revision with that date gone. I would like to put that date back, and I know it was a point of contention for the hemp ordinance, but at the same time, I think that we need to be able to manage cannabis. It's still a Schedule I drug in federal government. I would like to be able to manage its growth rather than look back a year from now, 2 years from now, and say we could have gotten this done right had we been able to slow down the process and find the things that we did incorrect. So I'd like to put a date back. And again, I'm offering a random date, October 31st, 2020. That date is basically made so that it gives people ample time to be able to get their water board permit. Background checks. Had a conversation with the sheriff about this, as well as you all know Lance Williams. He's a representative of the Cannabis Growers Association. And because we're asking for background checks and fingerprints on employees, it's a 2-week backlog. And the way agriculture works is you're not going to have a calendar of when your plants are going to be ready to be harvested. Your plants need to be harvested. You can't wait 2 weeks. You need to get them harvested right now. And so we know that agriculture will be picking up employees left and right on the days that they need people to harvest their plants. They're looking for that same flexibility. And so I know with conversations with the sheriff, he said that he was willing to look into, he didn't 100% say, yes, let's do this, but look into saying you can do temporary work as long as you submitted your fingerprints, you can start working. But if we find that you failed, we're going to submit that paperwork back to you, and you need to make sure those employees are off of those premises. Currently, As you may well be aware, we are not doing fingerprints at this time because the sheriff's office is closed, but workers are allowed to start working. So we're kind of doing that right now in a trusting and using the honor system way. I know that when looking at the total numbers from the sheriff, it was 5 out of 300 plus background checks that had come back failed. So that's like 0.125, 0.2% failure rate on those fingerprints. So it's not like it's been it doesn't show any signs that we're dealing with some very bad people or incompetent managers. They're looking for people who are going to pass to be able to work for their workforce. So I think that's an okay thing to do. And also at the bottom here, you'll see it says no permit if applicant fails background checks. All it did in the original one was say you must submit a background check, but it never said what happened if you failed the background check. And so I wanted to make sure to add that in there, that if as an applicant you fail the background check, you're not getting a permit. Like, it's not just you submitted it, you should be able to move on. That way it kind of clarifies things for us. Video surveillance, right now it's set for 24/7, 365 days a year. We're asking people to grow in the remote locations in Lake County. And so to have internet access and electricity to some of these things, they had to be wired through intensive, whether it was generators, whether it was solar panels, they had to figure out ways to keep those things connected. I heard loud and clear from people, why do I have to have video cameras when there's zero activities happening like between January and March? So instead of setting up any specific dates, just say you must have your video surveillance while you are actively doing cannabis operations. Micro business. There's been a lot of talk, and I've been pushing a lot for this, which is resort style activity that's cannabis friendly. One of our problems is you can use the micro business one for, you can grow, you can process, you can distribute, you can manufacture, but there's no retail involved. I would like to see retail involved in those micro businesses, but I would also not like it to just be any retail can happen in any location where those micro businesses can be. In my opinion, they need to be in conjunction with a resort operation. I think that retail belongs in commercial centers, just like we set it up for a retail dispensary ordinance that we have. They're in C1 and C2, but I'd also like for a resort to be able to sell directly to their guests rather than say they're a cannabis-friendly resort that doesn't have the ability to sell to their guests. I think we all want people to take responsibility for their actions, but asking someone to drive to go get something and come back to their resort and think that there's not going to be any driving under the influence, I think is just, it's going to happen. But if the resort has the capability of selling directly to their guests, then we're going to limit the number of driving under the influence type of situations. And so I would rather we see that happen. At the bottom, it says allow all micro business licenses in areas zoned for micro business, meaning right now, manufacturing, distribution, and the types of cultivations, those are allowed in the micro business where that's zoned. Cannabis retail is only zoned for C1 and C2. I would like it to be zoned or also allowed in the micro business. Again, you would only be able to access your retail license if it's in conjunction with a resort. Those are all of my changes that I am bringing to the board. I'll let Mark Roberts discuss further and elaborate a little further on anything he has on this. Other than that, I'm open for questions and comments.
Can we take the screen off? Go ahead, Mark.
You'll hear me.
You got an echo going on.
That's How about now?
Yes.
That's okay, good. Much better. That was, I think we had two laptops that were unmuted for a second. So in reviewing the changes, when we had
like Bruno was saying, we had analysis done by Lon, and it's approximately 892 parcels that were gonna be potentially added, with reduced parcels to 2. And one of our concerns, or just a general concern, is that it opens up a lot more like water use, potential traffic, and just not more properties to the use, but could be more impacts to the surrounding property owners that are within that area. That could be, potentially be impacted by the other uses that we've seen in the beginning. But the other changes that we're thinking of, I don't see a real concern with them. They're more just general, adding uses to commercial uses to allow, other options. It's just more of the reduction in the size. We're just thinking about it and realizing, it's going to potentially impact more surrounding parcels than, even though 892 is not a huge number, but it's still up there. So that was our main concerns when we're kind of thoroughly looking at it the other day.
Okay.
And if I may add something, I did forget, there are also some other changes I'm looking at, and those were on setbacks. I will be bringing those to you at a later time. One of the setbacks was for the same ones that we're looking at reducing the acres. I spoke with Mark Roberts. Our fire district standard for setbacks is 30 feet. So looking at changing that potentially to 30 feet, and also looking at the setbacks from waterways. It was 100 feet from creeks, and that's it. It was just 100 feet flat. Well, when looking at the state guidelines, some of it was 50 feet and some of it was 150 feet. So either we were more extreme, which I think that's the decision that we made as a whole, or we weren't even meeting the standard of the state guidelines. So especially in light of hemp, and hemp following state guidelines, and hemp being so similar to cannabis, or high THC cannabis at least, I was looking at changing that, instead of saying and dictating a specific setback from creeks and other waterways, to go and say following state guidelines from State Water Resource Board or something. I forget the exact title of it. So just wanted to let you know that I was looking into those changes as well, but I did not bring that to the board here because that will have to go through the Planning Commission to review setbacks.
Mr. Chair?
Go ahead, Anita.
Thank you. I think it's important for community development to be clear here. When Supervisor Sabatier was talking about the setbacks having to go through the Planning Commission, I think that is an issue that is totally within their purview, and they should consider it. It's not clear from what Mark Roberts was saying, if now he's talking about water use potential and traffic. Again, those are also planning and environmental issues that are oftentimes the purview of the Planning Commission. So it's real important to be clear, since this ordinance is coming to you without their review at this point, if all of it as it remains or a portion of it, certainly the permit issues, the regulatory permit issues are something that your board can deal with. And it may be that community development has no concerns about the remainder of it not going to the Planning Commission. I just think that Supervisor Sabatier and the rest of your board want a statement from community development in regard to that, so that you have some clarity.
Go ahead, Mark. Or Scott.
I think
I see Scott DeLeon jumping on too.
Scott, do you want to go ahead, or do you want me to go?
No, I'll go ahead and take that.
Okay.
Well, first of all, I appreciate the opportunity, and we've been working closely with Supervisor Sabatier on this, and we have had some concerns about the potential, and I think that Supervisor Sabatier mentioned earlier that though the numbers of parcels are being increased, the expected increase is not that great. I'd be inclined to go ahead and make a statement that we don't think that the change in the acreage is going to have a significant effect based on that input, and we'll hopefully have an opportunity in the future, if we start seeing some significant impacts, that we have an opportunity to revisit this. But at this time, I think Supervisor Sabatier has indicated that we are not expected to see a huge increase. And so with that in mind, we'll go ahead and make the statement that it won't have a significant effect.
Thank you, Director Dillon. Supervisor Sabatier.
And I just want to say, and this is not based on acreage, this is based on just parcel numbers. Parcel numbers wise, I believe it was an increase of about 15%. But again, those are small acres versus what it was before, which was 5,000 acres of 20 plus acres of potential use. And I do know also that in the process of getting a use permit, the CEQA process definitely evaluates water use, and it doesn't evaluate water use on a personal project level anymore. It looks at the cumulative use of water in an area. So I think that definitely helps us out in ensuring that we're not going above and beyond what's capable for our ground.
Supervisor Brown.
So the statistics are interesting, the percentages that you're talking about, but you got to include all of them. I don't remember a time where we said we have to increase the inventory of property by reducing the lot size for a project when we don't even have much activity on the lots that we already have. So basically what you're doing is making it easier for the cannabis operator, but you're making it more difficult on the pressure of the land use issues that you're going to have when you get into higher density. And so, we talked about this earlier on when we adopted this to begin with, that we're going to test drive it, see how it works. We haven't done that. We had a year, 2 years maybe. So now we're going to allow it into a higher density area without review from the planning commission. I think we have some real issues with that, and I really, while this forum has been interesting as far as public input, and we seem to have a lot more letters and a lot more people that find it convenient because they're able to stay home and comment. I think the people that are really interested in this need to be here. They need to be talking to us. They need to be coming to a public forum in the board meeting, and I'd be interested to hear that and see that. And I just think, that for me, I'm willing to consider some of the other issues, the PDC and all that. I'm willing to look at that. I'm not sold on it yet, but it's a deal breaker for me that we're going to reduce the lot size so significantly that we're obviously going to be crowding these operations closer and closer to higher density populations and closer to town. So. And I'm not sure why we're doing that. I have no idea why we're trying to accommodate something that doesn't seem to be an issue. There's certainly, you've said there's 5,000 lots out there. There's no lack of inventory. So I'm not sure why we need to move everybody closer to town.
Thank you very much, Supervisor Brown. Yeah, I'll weigh in on that too. The lot size reduction is definitely something that, I'm not in, I'll just be very clear, not in favor of at this point. We are clearly still trying to establish this industry, and, the closer we get it to more dense populations and other things, we're going to have the same problems we're having right now. So, I think there are some things that need to be talked about, but I clearly understand that having the public input on this is something that we did for months and months as we derived this thing. Ultimately, I think there's things that need to be changed, but the one sticking point for me too is going from 20 acres down to 2 acres, and I'm not in favor of that at this point.
And
go ahead, Supervisor Sabatier.
Thank you. Just want to, part of the reason also for bringing this, now we're not changing the exclusion zones, so we're not getting anywhere closer to town. yes, if you have a bunch of 2-acre lots in RL or things like that, that it would create a higher density of that. But however, I also want to remind us, this is only changing the acres for indoor. We just approved hemp for indoor on a 1-acre lot outside of the community growth boundaries, and 5-acre lots for outdoor activities. And in 5-acre lots, they can grow the entire 5 acres, not just 25 or 10,000 square feet or 5,000 square feet. That's the limitation for cannabis. So part of the reason was looking at some of those changes. I didn't feel there was a need to specifically match those. But again, we're allowing its cousin to have greater access, and we went through fairly easily with getting those things done. We definitely had a lot of conversation about getting there in the first place through the committee. I'm not against having to move that portion of the change to the Planning Commission for it to be discussed at a greater length, but I would like to look at the other changes. And I know Supervisor Brown brought up the PDC, and again, the PDC would be allowing a lesser activity than the activity that's already allowed in PDC, which is right now you can do manufacturing, but you can't do processing. And just looking to see if we can add processing, since processing is part of the manufacturing license, just a higher threshold.
Any more comment from the other board members?
I would just like to hear what the public has to say.
Okay.
First.
Okay, seeing there's no more comment from the board, we'll go ahead and open this conversation up for public comment. I see we have 2 hands raised in the room at this point. Michael Green has been up there for a while, so go ahead, Jake.
All right, Michael Green, if you would like this opportunity to speak, I have you unmuted.
There you go. Hi. Yeah, thank you. I previously submitted email comments that were kind of technical in nature, so don't need to reread those. The highlights were, I want to thank Supervisor Sabatier for bringing forward what I think are pretty common sense reforms. I think maybe moving the whole thing to Planning Commission at this point would be appropriate. I think there are good logical reasons. It is a substantial change in acreage. 20 to 2 definitely perked my ears up. But I think there's a valid rationale for that, not just for indoor grows, but also greenhouses. They're fully enclosed and secure. They can't have odor mitigation. So I think it's something to look at. And having drilled down into what was proposed there, I think it does make a lot of sense, especially with hemp kind of pushing the needle. And I think the Planning Commission would give you a lot of good insight on that. So the one thing that I did want to highlight again was the introduction of a cutoff date. I would argue against that. There was a cutoff date proposed for hemp. That went away. And I'll just remind you, when we had the previous cutoff date for the water board permits under cannabis, and it finally expired, that very next month is when we had people camping out around the courthouse because they had basically been frozen out of the cannabis permitting process. So I think the cutoff date should not be in there. I think water board compliance is something for the water board to handle. It's a permit condition of approval. It should not be a permit application prerequisite. So other than opposing that hard cutoff date that was proposed as part of this, there's nothing in this proposal that is scary. A lot of this would be very useful, in fact, in advancing opportunities for cannabis growers. And so we want to find ways to help them succeed. And I can tell you from hard experience, a lot of these guys are still struggling, and that zoning freeze out was part of that. So I would hate to throw out the baby with the bathwater. There's some good ideas in here. I think taking it to PC would give you the input you're needing. And then if you kind of disagree with some of those findings, you can kind of go from there. But I would support this moving forward, that it leads to Planning Commission level. Thank you.
Thank you, Michael. Go ahead, Jake. Looks like there's an AM Ross with a hand raised.
Good afternoon, Supervisor Simon. This is Attorney Andre Ross.
Yeah.
Can you hear me?
Yes.
Great. I'm attending this morning as a member of the general public, not on behalf of a client. I have monitored very carefully your handling of these virtual meetings. I want to commend you all for adjusting to the new reality. A good job is being done. My only comment today regarding your cannabis ordinance is an issue that may or may not arise before your board at some point in the near future regarding corporate status of cannabis applicants. Your current ordinance does not include any requirements as to maintaining the validity of a corporation or an LLC's corporate status with the California Secretary of State, and I'm aware of at least one applicant that has a corporate status issue. And I have nothing to contribute with respect to the current discussion of the amendments that are on table, but I felt it would be a courtesy for me to put this issue in your mind to see if your board might be willing to enact or endeavor to enact a requirement that cannabis applicants who are using their corporate status to run their projects be required to maintain their corporate status with the Secretary of State of the state of California. There's no downside to the county to enact such a requirement, and there's a substantial potential upside in that cannabis applicants who maintain their good status with the Secretary of State will likely be more reliable taxpayers. Most of the corporate suspensions that I've encountered have been due to a failure of a corporation or an LLC to pay taxes. Certainly it's in the county's interest that applicants properly pay their state taxes, and I would bring that issue to you, to your board, as a matter of first impression and something for you to work on, if not now, in sometime in the near future. Thank you.
Thank you, Mr. Ross. Okay, moving forward, Jake. Do we have any other comments in the room at this point, Jake?
I don't see any more hands raised, but we can unmute the floor. The floor is currently unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, we'll go ahead and close the room. And Carol, do you have any public input on this item?
The only public input I had was what Michael Green mentioned earlier, and he indicated it need to be read.
Yeah, and so written back into the record, and that will be part of the official record. Okay. Supervisor Sabatier?
I was wondering if Mark Roberts or Director De Leon can comment on what Mr. Andre Ross just mentioned, because I believe that we do a 10-year use permit once the use permit has been approved. At that point, I don't believe, I could be wrong, that we do an annual inspection of their articles of incorporation, but I believe the state does on an annual basis for their state licensing, and we would be directed if we were told, we would be directed by the state and told if their license had been revoked. But I just wanted to check in and see if that was correct.
Supervisor?
Yeah, I don't know. I don't know if I have the answer for you today, Supervisor Sabatier. I know that we do. I know that we get noticed, but I'm not sure I have the answer for you on that, or even if it's clear what in our ordinance that they have to have certain licenses and they have to have certain things through the state. Now, if in the course of the life of that use permit, that's something that they lose their license or they lose certifications, then I think that's up to us at the local level to decide what we're going to do with that permit. And I'm not sure that it's entirely clear, but we do get notified if things if they lose a license. But we'll need to look at that, and I'll need, unfortunately, I'm sorry, I wish I had the answer for you. We'll have to get back to you on that.
And then we can't, there's too many what ifs, situations, can't know it all, especially as we're learning as we go.
Okay, excellent. All right, we're going to go ahead and close public comment and bring it back for deliberation here at the board level. Supervisor Scott.
Just like to thank Supervisor Sabatier for all the hard work on this. I know he's been looking at this ordinance for months now. I've actually met with him and Director Scott De Leon on the proposed changes. And I would have to say the only one that I don't agree on would be adding the date for the water board of 10/31/2020. I think we already have enough things in place, roadblocks in place. I don't think we need to add another one. And the only question I would have would be for Scott De Leon, if we were to bring pieces of this back to the Planning Commission, what would be the timeline you believe? I know it's hard these days to figure this out. Well, do you think the timeline would be to bring it to the Planning Commission and have it come back to us?
I would say we could have something to the Planning Commission. I'm going to say the second meeting in May. So we have one coming up. So it would be the following meetings. We could make that.
I think that's the 21st.
I believe that's the correct date. Yes. So then it would be the following board meeting, presuming that a decision was made at the Planning Commission level on that date. Mark, do you have any issues with the 21st?
You're still on mute.
Can you hear me?
There you go. We can hear you now.
There we go. I'm okay with that. I just wanted to check the date. It looks like it's actually May 28th. I just wanted to confirm that.
Okay.
So it is.
Yes, it's May 28th.
May 28th. So I'm okay with that.
Okay. Does that answer your question, Supervisor Scott?
Yes.
All right. Any other deliberation here, Supervisor Crandall?
Yeah. So, are we moving? So just kind of reframing for me. Are we moving that one item that we discussed about the acreage back to the Planning Commission? All of it back to the Planning Commission, or how is this moving forward?
I think that discussion is still evolving right now. There hasn't been any action taken. It sounds like there is some discussion anyway to take some of it back, if not all of it, to the Planning Commission. But I think that will be solidified once a motion and action is ready to move forward. Supervisor Sabatier?
It's of my opinion that their position is land use, and that fingerprinting and video surveillance and things like that are an unnecessary item to bring back to the Planning Commission to discuss. I'm comfortable with pushing. I'm comfortable either way for the acreage change, whether we decide to move forward with a decision here or bringing that to the Planning Commission. So I'm flexible on that. But as far as the rest, I just don't see that as being a land use issue. And I think it's just more of an operations for that industry that we have oversight of.
All right. You know, you do bring up a good comment too, which I forgot to comment on, was the surveillance aspect of it. I think the surveillance obviously is not only for security, but also for other issues, to know what's going on the property that is a commercial business and other things. So I know that that's a security issue. In your conversations, obviously, yeah, you definitely like to turn your camera off whenever you can. I understand when cultivation is going on, but that is more of a security issue of what's going on that property. When it's made for commercial cannabis, you can turn your cameras off and on. Who knows and who's going to be able to say what else is happening on that property, even though it's licensed for just a commercial cannabis operation. Just a question.
And I would suggest again, I'm going to repeat myself and then answer your question or to respond to your comment. One is we've asked this to occur in the far fringes of our county away from our community growth. And that makes it difficult with right now. You need to have internet access and constant electricity to be able to run these videos. And that makes it difficult compared to something right off of Highway 29, which obviously would have the accessible infrastructure to make those types of things happen. Then as far as what else could happen on the property, anything can happen on any other property that we may not know about. And I think it's just an honor system that we always want people to, we always need to put the onus on those individuals that we are going to give you the benefit of the doubt that if you have a house, you're doing the right thing in your house unless we find out otherwise. Here, when you're done with your operation, you're done with your operation. You've cultivated, you've harvested, and now it's gone off your ranch. Why are you still having to struggle to still have video surveillance? It just seems we're still not trusting versus, okay, we're going to trust you that you're stopping when you should. And I think that most people, the amount of energy that they have to go through to get a use permit are not going to jeopardize their use permits by doing something stupid and saying, oh, well, I turned off my camera so I can get away with something. But again, that goes for every private residence.
I'll talk to the fam about it today.
Somebody jumped in. I don't know who that was.
Anyways, that's my response to that. I think there's a level of trust that I've gained from seeing who is involved. I know we've spent a lot of time with Lance Williams, and it's not everybody is of that caliber, but at the same time, I think the hoops that we've created are very difficult to go through. And why on earth would they want to jeopardize what they've been able to obtain through the planning commission process, through the planning department process? Because that's a lot of money spent and a lot of time lost if all they're going to do is just waste it.
Okay, so let me clarify what you were just saying then. So you're saying, but this is a blanket for all cannabis on their surveillance requirements on the project. Because there are folks that are right in communities that we have heard appeals on and other things here locally. I know locally here in South County, there's quite a few that are butting right up to communities, large communities, that we're going to want to make sure that if we are going to permit these things and there's an opportunity that, you know, that we know that these are safe properties, and surveillance is a big part of that. If you know you're under the eye of the camera at all times, you know, that always makes you act a little bit better. I know I work in an industry that is 24 hours a day, 7 days. We have an industry that it's required both by the state and the federal government if you're going to run that operation. And this is the reason why. And it has helped us to secure not only our facilities, but also help law enforcement when things happen on our property. So that's where my questions come from on the surveillance issues. Supervisor Brown, I know that you are new.
Yeah, so I'm, you know, I've never really been clear on why we require them to do security. I see why they do it at the casinos, and it's for your security and others and all that. That's a liability issue, but if somebody wants to have it, you know, that's fine. I don't know what the requirements are for the casinos, but I can see that being a requirement for a lot of reasons. But in this case, I don't see it because we're not going to check their videos. Who's going to check them? And what are we checking them for? And are we going to check them without a warrant? You know, I don't get the whole concept of why we're requiring a private business to have a security camera that we're not going to check it.
I think that has to do, it comes down from the state. I don't think it's something we implemented. I think this was in coordination with the state law. If you're going to be in this business, you need to have somewhat of surveillance during your operations.
Okay.
Cannabis,
okay, and if that's the case, then what's the state requirement? You know, what is it that we're adopting that we have discretion over? I mean, find out what the state requirement is and just adopt it.
And I believe this is above and beyond the state recommendation.
Okay.
So at some point when we talk about this, I'd like to see what the state recommendation is, and we can adopt that if we have to. So.
Okay. Thank you for the clarification. Okay, I think we've had our deliberation here. I think that this was put on the board here for our consideration to potentially take action, and I think we're at that point.
So because I can't answer that last question, So I have an idea of what we can do. So this is what I'm going to offer, and I'm not going to make a motion. I'm just going to offer it right now as an idea, just to talk it out. Split off the acres changed, to send that off to the Planning Commission to review, see what the environmental impact is, and then what their decision can come back to us for any final approval of changes that they may agree with. Stick with all the other changes. You know, I'm going to ask for public comment. I see Brenna Sullivan here, and I'm going to ask to see if she has anything to say on the water board expiration date, because I know she was.
Well, we didn't open. We haven't opened up public. We had public comment on this issue, correct?
Yeah, I think we did.
Would the board like to open up public comment? I just want to make sure. If we do reopen that, you know, that we open it up to everyone.
Yeah, I'm good with it.
I'm good. I like to hear what Brenna, if she has any thoughts on this.
Which I'm fine with that. You know, I just want to make sure as the chair we do it in the correct way. So we go ahead and reopen up public comment at this time. Brenna Sullivan, if you're in the room, if you could, if you'd like to make a comment, here's an opportunity for you.
Hi, everyone. Can you hear me?
Yes, welcome.
Okay, wonderful. Thank you. So at this point, cannabis is still under the Central Valley Water Board's cannabis program. I've been asking if there are plans at some point to fold that into the irrigated lands program. So far, they're just going with the status quo. My guess is in the next 3 years, we're going to see that folded in. So at that point, you know, a specific date on the water board would make sense I'm sorry, until that point, a specific date would make sense. After that point, when it's folded into the irrigated lands program, you know, that's going to be harder with the logistics on our end. I have no comment at this point on feasibility of leaving that water board date in place, you know, because we don't deal specifically with the cannabis program. Does that kind of answer your question as much as I can answer it?
Thank you, Brenna.
Yeah, thank you, Brenna. So I would like to leave everything as is except for the acres change and offer that up as a motion to move forward. Let me get to the exact.
Well, while you're looking for that, Supervisor, I will go ahead and have Jake ask if there's any other comment in the room at this point. Once that's done, if there is none, I'll bring it back to the board for action. So go ahead and open up the room, Jake.
Okay, I will unmute the floor here. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, hearing none, go ahead and close the room, and we'll close public comment at this point and bring it back to the board for action.
Mr. Chair?
Yes, Anita.
If what you're talking about now is going forward and just eliminating a certain section, then the ordinance itself can be amended on its face to delete particular portions, renumber it accordingly, and then make a motion to waive reading of the ordinance and have it read in title only, followed by a motion to advance.
So moved with the amended changes to Planning Commission.
So you've moved to waive reading of the ordinance to have it read in title only? Because there's two actions. Okay.
And do you need a second on that? Second.
Yeah, I second.
So there's a motion and a second. Carolyn, can you call for the vote?
Yes. Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
No.
and Supervisor Simon.
No.
Thank you.
And I move to advance the ordinance to May 12th, 2020 agenda for consideration and passage.
Excuse me, Supervisor, you have to actually read the title.
Oh. And the title is over here, an ordinance amending Chapter 21, Article 27 of the Lake County Code pertaining to commercial cannabis cultivation.
Now you can make your next motion to advance the reading of the ordinance to the next available meeting date.
So moved. Thank you, Ms. Grant.
Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
No.
and Supervisor Simon.
No.
Thank you.
Okay, thank you very much. Item 7.4, continued from April 28th, 2020, consideration of an urgency ordinance establishing temporary safety protocols upon the reopening of the county facilities to the public during the ongoing COVID-19 state of emergency. Carol, our administrative office.
Thank you, Mr. Chair. Thank you. Last week, your board gave consideration to a draft urgency ordinance, which if you adopted it would require the public to wear masks when they're in our county facilities under the same conditions that your recently adopted temporary policy will require of county employees in our facilities. You gave us a number of comments and we took those and made revisions to the draft. We have it back on your agenda today. If you adopt this urgency ordinance, then a supply of masks, we would intend to place a supply of masks for the public to access at the front entrance of each of our county facilities. And we would also put up signage reminding the public of the requirements for masking, and they would be throughout prominent locations in the public portions of our facilities. If I could call your attention to the draft ordinance itself, the updated version that you have today. If you look at the front page, the 7th whereas down is a new one. Your board wanted a whereas that addressed the fact that while there are no protective measures that can provide assurance that the coronavirus will not be transmitted, that you want to take all reasonable steps to ensure the safety of the public and ensure the safety of your employees when they are providing services to the public in close quarters. So we added that section at your request. And then if you turn to the second page under section 2, the lead-in paragraph to section 2 previously said something about this going into effect the point the shelter-in-place order was lifted, and it was important to your board that we be clear that this just begins effective immediately. So we took that language off, and it just starts with the fact that this is in place, and it will continue to be in place until the emergency ceases or otherwise is ordered by your board. And then in that same section, paragraph A was just modified somewhat to improve upon readability of that paragraph. There's no major content change, just we hope the flow makes a little better sense for people in understanding what is required of them. So one of the primary issues of doing this, if your board adopts this, is the cost and availability of masks as we move through the crisis. In the courthouse alone, we estimate that the foot traffic is approximately 1,000 persons per month. We believe that's a reasonable, unduplicated count, and we're grateful to courthouse security for helping us zero in on that number. At the time we prepared this discussion item for you, we had an inventory of about 2,000 masks on hand. So it would be our estimate that for that facility alone, we'd have about an 8-week supply of masks. And the public services director tells me that now our supply has been increased to about 3,000 masks. So we'd have more like 12 weeks supply available for the courthouse. But there are other county facilities, particularly the general fund departments, that would be reliant on us to secure masks for them as well. So if you consider the additional county facilities, the social services director gave us some rough projections for her busiest office. And her estimate was that there could be a need for as many as 5,000 masks per month just for the one location. We're talking about the main office and at Anderson Ranch in Lower Lake. So the least expensive cost for masks we've found recently is about 38 cents. And there is a photo in your agenda packet that shows you the type of mask that we're talking about. If you purchase those in volume, there's the pricing is somewhere around 38 cents, depending on how many you buy at a time. So using it as an example, what is likely our two most heavily trafficked facilities, that social services main office and the courthouse, estimating a total of 6,000 persons a month in and out of those facilities, our upfront cost would be about $2,500 a month. That is our estimate with tax and shipping. And so for the purposes of expanding upon this estimate, if we assume that there would be an additional 4,000 persons or so in and out of all of our other county facilities in a given month, it would raise our cost to about $4,000 a month out of pocket. Of course, we would be intending to claim those costs to FEMA and to CDAA. And if we're successful in getting reimbursed later, our cost would be reduced to only about 6.25% of the total cost. So what we're asking for you today is to either adopt the urgency ordinance or give us further direction on additional changes you would like us to make to it. That's my presentation.
Thank you, Carol. Supervisor Brown? We're not hearing you. You're off.
Yeah, I'm just.
We don't. There you go.
No, I'm messing with you.
Oh, all right, good.
Sorry, I couldn't resist.
Like, Jake,
So,
something's going on.
So one of the things that came up after this last, it's not a big deal, and I think we can amend the policy, but on the fourth floor, procedurally, it's going to be a problem with preliminary hearings and different things that go on because the judge won't violate the ordinance, and there are times where you have to be able to see somebody's face to determine the honesty. There's a lot of things there's a lot of case law on that, and so I think we should put something in there that unless it otherwise impedes the operation of the department or the division or the court or however that is, and some language for that. But there's also the thing of a victim or a defendant has the right to face their accuser. Not the victim, but the defendant has the right to face their accuser face to face, not face to mask. So there are, as long as social distancing is practiced, I think that's an easy one to change, but I think we need to change that out of respect for the court's operation.
Agreed.
Thank you, Supervisor Brown. Yeah, I'm agreeing with that too. Supervisor Sabatier.
And I agree that should be a simple paragraph to write up because it's very specific that the actions in the courthouse will not be impeded on or whatever it is that we choose to do. I think that's simple. I just wanted to mention that the main title on the first page still says upon the reopening of county facilities, and maybe that needs to be updated as well. And as far as the cost goes, I'm always hopeful, we're always hopeful that we're going to get some kind of reimbursement through FEMA or through any other avenues that we have at 6.8%. Even if we round that to 10%, now we're looking at $600 a month in comparison to $6,000 a month. And I think that with the conversation we had earlier with Dr. Pace, we may or may not have a rule saying businesses, in a business, you must have a mask on. But at the same time, we know that we are at least recommending that, so we should be doing the same within our own facility. So I think that I'm still good with moving forward. The cost of it is not enormous. I hope that we can get the reimbursement, but even without the reimbursement, I think it's still a good direction to go.
Thank you, Supervisor. Supervisor Scott or Supervisor?
I did have one other question.
Supervisor Brown, go ahead.
Well, so I am still interested in, the who's going to enforce this. I don't think it's a bad idea, especially if we're making a statement that our employees are at risk. Then we need to minimize that risk. That's what started this discussion to begin with.
Yeah.
But we don't have to have just symbolic ordinances in place. I want to know how it's going to be enforced. Are we going to be asking the court to have security enforce that? I mean, they already enforce rules that they won't let people in with a nail file, and they won't let, there's other things that they won't let them in. So are we going to ask the court to use their security to enforce this? I'm wondering how that's going to be done. Otherwise, there's really not going to be any other enforcement unless we have our staff at the window saying, sorry, we won't help you unless you have a mask on, but people aren't coming into the courthouse for our staff to begin with. So I don't see that as an issue.
So the court already indicated that security would not be able to enforce this or follow people around to keep the mask on or any of those things. It's just not feasible. Very loosely, we talked about the prospect of assigning county staff to do that. I'm not sure that would be realistic or feasible either. Well, so the intent was that a supply of masks would be on hand at the, we're talking about all facilities, but of course the courthouse is one in particular, but at every front entrance, there would be a supply of masks and signage telling people about the ordinance requiring that they wear them. But nobody's going to be able to realistically follow them around and make sure they do. If they walk to a counter and they're not wearing the mask and an employee is there with a mask on, ready to serve them, then we talked about giving departments the option of backing off and informing the member of the public that if they will please go put on a mask, then they can complete the service there at the counter. And if they will not, then the employee would make other arrangements to serve them without in-person contact.
Yeah. Go ahead, Supervisor Brown.
So we need to, first of all, we can't have a box of masks sitting at the front door thinking that people are just going to take one and use it or whatever. These things are expensive and they're going to be taken. So we should have them at each department at the counter. If people don't have their own, if they come to the counter, then staff can say, hey, there's a mask right there, use it, or they can be given the mask from a staff member or something like that. But if these things are that expensive, we can't just have a supply of them in boxes sitting at the front door.
Yeah, I think that's a good suggestion of having them at the departments there. If we're not going to get that support, obviously, and it's very clear we're not from the officers coming in the door. Having it at the departments would, I think, alleviate that situation where we get them one. I think a lot of folks in the conversation too there are going to be a lot of folks that do comply. They come in with their own masks and other things at this time. It is catching on, so there are a lot of folks doing that. I think having it at each one of the departments or available to give it out might be a better plan because we know boxes will walk off. Supervisor Sabatier.
Yeah, no, that was actually a very obvious comment to make that had not been thought of yet. I could just imagine somebody selling masks right outside of the courthouse with a free box that they took off with. But I believe that in the past, I don't know if that's something that we can do. Again, it's not an idea of enforcement. It's an idea of protecting our staff and protecting others. So at least this gives our staff the ability to say, hey, I'm not going to serve you and I have the right to until you protect yourself, so that I'm going to protect you and you're going to protect me. But I know that the security in the front was offering masks before we shut down. Maybe they still have the ability to hold on to the boxes themselves and offer masks, but not necessarily enforce that you have to wear a mask. something along those lines. That way, at least the box is not in the middle of nowhere where somebody can grab the whole thing and it's under their supervision. I know they had it before. I would believe they still have some. But I agree as well that putting it in the windows of our departments so that why make them go all the way back downstairs to get a mask when they're already right there? Let's see if we can help them get masks right where they are.
I'm sorry if I misspoke. I didn't mean that they would just be placed in the middle of the lobby. I was really thinking they would be placed at the security checkpoint at their little counter like they have been, at least for the courthouse. For an office like administration, if we have them inside the room, by the time they've walked in, the social distancing is gone. So for an office like ours, my preference would be that there be a supply of them getting as they come in the door. But and certainly we can communicate with security to keep us informed if it's not working. If people appear to just be taking masks, that these are things we can watch. And for departments where it can work to have a supply in the department, absolutely. I mean, we can have masks here, there, and everywhere for this purpose. Some offices, they really need to pick them up as they're coming in.
Okay. Supervisor Brown?
Well, no, and I apologize, Carol. I did feel like that they were just going to be sitting there because I wasn't assuming that security was going to be on board. They don't work for us, but I know, those folks that are working at security, I see them all the time in here, and I keep my distance, and they all do really well too. But they're concerned over the public. They have very close contact when they're making sure that the folks are coming through the screening area, and so maybe we could do both. Maybe we could leave some there with them, and then they're not going to enforce it obviously unless the court gives them that direction to do that. But then we would also have them at the counter or at the different departments that can be handed out up there. So maybe we can do both, but I think rather than assume that they're going to do that, we should check with them. But I think they would gladly do it if it's okay with the court, because they're legitimately concerned about any exposure in the close quarters that they have with people as they're coming through the screening.
Absolutely, they are, and they've been very good to work with, and the executive officer was receptive to this. But what couldn't be done really was to have them deal with somebody who resists, and that would be up to us when that somebody who resists presents themselves in one of our offices.
Okay. All right. Any more discussion from the board at this point? Okay, seeing none, we'll go ahead and open this up to the public at this point. Jake, can you open up the room?
Yes. Let's see. All right, the floor is unmuted. If you'd like to make a comment, please state your first and last name.
If you'd like to make a comment on this item, this is the time to do it. Item 7.4.
Yeah, I'm Michael Green. I know there's practical problems with the masks, but it's really the only practical tool we have. So you're either all in or you're all out. So it's if you were a private business, you would adopt a no mask, no service policy. And especially in a dense workplace like the courthouse, I think that's a reasonable thing. You get them at the point of entry, and you don't necessarily have to shoulder the burden for everybody coming in. You can kind of set the tone that if you're going to come do business at the courthouse, bring your own mask. Help us help you. Doesn't have to be an N95, but you're going to have something on your face. And I think part of it is, instead of worrying about how we're going to enforce it in the hallways and all that, part of it is education. So if you set the bar appropriately, and that's everyone in the courthouse is wearing a mask, whether you're a customer or whether you're a county worker, or when you're doing public contact, that's the bar you set. That's what you enforce. You don't need 4 pages of public health orders. So social distancing and masking, looking forward, not just for the next couple of weeks, but for several months, is probably the most common sense policy that you could adapt as a board and as a county. And where there's a will, there's a way. So It isn't about medical efficacy. It's about the fact we don't have surveillance testing. We don't have any real practical ability to monitor large groups and so on and so forth. But if we can create this social norm that social distancing and masking are the norm, then you would do a lot to protect your own workers and to protect the residents.
All right, thank you, Michael Green. Do we have anybody else in the room at this point for public comment?
Mr. Chair, I do have one public comment by email.
Okay, we'll move from the room. Jake, go ahead and lock it up, and then we'll bring back to Carol. Go ahead.
So this comment comes from Karen McDougall. Karen says, I strongly support the emergency ordinance establishing temporary safety protocols. I appreciate that the county will provide masks and take steps to ensure that constituents can safely access the public resources for which we pay.
All right. Thank you, Carol. With that concludes public comment. We'll bring it back to the board for action on the ordinance.
So basically,
Mr. Chair?
Excuse me.
Yes.
That's all right. Did you want some kind of language with regard to court operations? If that is important to the board, certainly the courts set the tone or tenor and operations of their own courtrooms. That's state law. But you could add something to the effect that notwithstanding the requirements of this ordinance, safety precautions in the superior courts shall be determined solely by the local judiciary.
Yes. Thank you, Anita.
And we'll also correct the header on the ordinance. Thank you, Supervisor Sabatier, for pointing out that that we need to remove the language about upon the reopening and just make this exist.
And for section 3, if you want, in addition to the front entrance, you could also say and or at the customer service counters of county facilities. I do agree, though, it's best to get them at the opening because otherwise they've traveled quite a distance before they get to a counter sometimes.
All right. Thank you, Anita.
Mm-hmm.
And bringing it back to the board. Yeah, I think those suggestions that were given by county council were excellent. So go ahead, Supervisor Crandall.
I was just going to say, just in thinking about what Anita had said about only having to go back, and others have said about going back down, maybe one in front of the elevator so that when people get in the elevator, because it's listed in the ordinance that you got to wear one in there. Maybe if there's like a little box or something in front of the elevator, that may be another way, or you know, something of that nature so that someone's watching it. So it's not just taken.
All right, thank you. Go ahead, Supervisor Sabatier.
And I mean, I would love to put them in as many places as possible, but I think the easiest is where they can be supervised. And I think the counter and the front security guard area is the easiest one to control, because eventually it does have a cost associated with it. And if we're uselessly putting them out and someone's able to take them all, which could and probably would happen, then at that point, we're just throwing away some taxpayer money. And so I would prefer at least starting with the counter and the security guard area, and then maybe review how this is happening, because again, this is not going to be a 1 month thing. This may last quite a long time, this social distancing and this protection between people.
Thank
that
you,
was my suggestion.
All right, Supervisor Scott.
I agree, having it at the front door of our facilities, but also having it at the departments. So maybe somebody doesn't realize when they were offered a mask at the front door, they decline having the mask, but when they get to the departments and realize that they're not going to get service from them, they have the ability to maybe change their mind and be handed over a mask to be able to get the services from our county employees.
Okay, thank you. Yeah, I'm in agreement with those. The front entrance and the counters, I think, to start with, and we'll work through it. We'll know what works and what doesn't here in a while if we approve this ordinance.
All right. If there's no further comments, I'd like to make a motion.
Supervisor Scott had one more comment.
And I would just like to comment, and if something's not working, definitely bring it back to us so we can tweak it or figure out what we can do to change things to make this work, because this is, protecting our employees.
Yeah, and the community. Excellent. Okay, Supervisor Sabatier, go ahead.
All right. I move to approve an urgency ordinance establishing temporary safety protocols upon the reopening, safety protocols for county facilities to the public during the ongoing COVID-19 state of emergency.
Second.
With the amendments that were suggested.
Thank you so much. With the amendments as discussed.
And that motion would take the form of offering the ordinance as amended?
Absolutely.
Thank you. So the ordinance has been offered.
Okay. So we don't need a second on that then?
No, you just need a roll call vote. It's an urgency ordinance, and you can offer the ordinance for passage today.
Okay, Carolyn, go ahead.
Supervisor Sabatier?
Aye.
Randall?
Aye.
Scott?
Aye.
Brown?
Aye.
And Simon?
Yes.
Thank you.
Okay, moving right along to item 7.5. Consideration of staff reports on A, COVID-19 disaster response expenses to date, and B, revenue and expense concerns for the future resulting from coronavirus pandemic impacts. Carol?
Mr. Chair, as we get started with this, I just want to thank you for your eternal optimism for keeping us moving right along, even after a very long meeting. So thank you for that. We are moving right along, and this is one of our last agenda items today. So Stephen Carter and Kathy Saderlin are in the room. I would ask them to open their mics because we're going to do a bit of a tag team presentation to you today. We're going to start with Kathy giving you an overview of what our projected disaster expenses are looking like to date for the COVID-19 crisis. And I have to say, as we lead into that, well, certainly all counties, in fact, all states everywhere is impacted by the COVID disaster. There still is no county like Lake anywhere in the United States that's been impacted by disasters like we have year after year, starting in 2015 with Rocky Fire, Jerusalem Fire, Valley Fire, Clayton Fire, winter storms of 2017, Sulphur Fire, Pawnee Fire, River and Ranch Fires, winter storms of 2019, Kincaid Fire, and PSPS events. And now, as if all of that wasn't more than enough, the COVID-19 disaster. And so only by the grace of Kathy Saderlin, our disaster finance chief, and her extraordinary ability to hold us together and guide and coach us to make the right kinds of decisions as we move through all the financial complications of managing these disasters, that we're still standing. And with all of that said, Kathy probably didn't know she had another one in her, but she does. And so she is helping us navigate the tricky claiming process for disaster expense. And so with that, I'll open up to Kathy with gratitude for what she's doing yet again.
Good afternoon, board. And thank you, Carol, for the kind words. Actually, it takes, as everybody says, it takes a village. So I just happen to be the person who has kind of stuck with it through these last 5 years with all the disasters. So for your board, what I'm able to provide for you is information based on the transactional data I have available to me in the finance department. And what I can present to you is representative costs that have been identified as COVID. And these costs change rapidly, as I'm sure you know. And to give you a little bit of perspective, and I think it's important to also share a quick snapshot of the multiple layers of funding mechanisms that we're dealing with right now. and the response activities and programs that my office is currently aware of that the County of Lake is navigating. As Carol mentioned, the past disasters, this one is one that is different than all of the previous disasters, as each of them are. So for this disaster, as we know, we have the presidential declaration for the COVID-19 response and recovery provided by FEMA Public Assistance Grant funding. And with the support of Cal OES and the county, we've been working through those multiple layers of funding mechanisms and the triggers that are coming to us. And they're coming to us from many different state agencies. So the FEMA Public Assistance funding we currently have is 75% of eligible COVID-19 response and recovery costs. At this point, other than one program, I do not have confirmation from Cal OES that we have received California Disaster Assistance Act funding of the 18.75%, which leaves our county cost share at 25% of eligible costs or 100% for non-eligible costs. And I did make an inquiry of Cal OES to get an update on that, and I will quote the response on our CDAA funding. And the response on that was that CDAA funding will not be decided on until the event is over, and it will be a county-by-county decision. So that's what we have so far on CDAA, which is that kind of that stopgap for Lake County. So the programs that I'm available and where the funding that I see that is going out the door currently are that we have the 2 grants that we received on April 15th from the California Homeless Coordinating and Financing Council. And those monies, one of them was a grant for the Lake County Continuum of Care grant of $79,511. And that was advanced to Hope Harbor Warming Center on April 8th. And then the County of Lake received a grant of $73,152, which is currently being administered by Lake County Behavioral Health. We also have our FEMA Emergency Non-Congregate Sheltering, and this includes what is known as Project Room Key, as well as all other health emergency sheltering that is determined by your public health officer. The funding for this was approved by FEMA initially through April 30th, and on April 29th, it was extended to May 31st. The criteria for the funding eligibility of this is specific, and the documentation requirements are extensive. The funding is currently 75% FEMA and 25% county. The state has also offered the County of Lake $100,000 upfront for Project Room Key, with all FEMA criteria and guidelines for retaining these funds in place. Funding is currently 75% FEMA and 25% county, and we've received no funding on this to date. We have another program that your board is considering, the Restaurants Deliver Home Meals for Seniors program. And this program was announced by the governor on April 24th with a FEMA component that was to end on May 10th. And on Monday, May 4th, it was extended to June 10th. This again will be a program that the county will pay up front and then claim through grant processing with a county cost share of 6.25%. This is the one that we are aware of that CDAA or somebody is going to be picking up the 18 3/4. Absent eligibility, cost criteria, and documentation compliance, the county will pay 100% on that. And then your health department has received or will soon receive 3 COVID-19 grants, and they've requested or obtained appropriation approval from your board. And the cumulative total of these grants is $530,390. You set the appropriations, and therefore the health department's salary and benefits, equipment, supplies, indirect costs, supportive quarantine services, and private nonprofit human services for emergency response. So moving on to the actual expenditures and the encumbrances that we know of to date. For COVID-19 response, which includes the public health, quarantine, and isolation, we're at $249,147. For the COVID-19 Project Room Key, based on the 60-day encumbrance that we have currently in place, we're at $104,192. For total costs of health purchased or CDPH resource supplies as of 4/23, as of April 28th, and this was provided by Public Health, and I know these costs have changed, it's $101,540. Your HR 6201 federally mandated paid leave, as of the county May 1st payroll, was $284,077. So the total transaction and encumbrances that we see in finance for COVID-19 are currently at $738,957. So, and I mentioned the HR 6201, those are for those, again, for the federally mandated employee benefits of emergency paid sick leave and emergency family medical leave. And there has been talk, I did hear discussion about tax credits for those, of course, like the CARES Act and the fact that County of Lake is going to receive nothing under the CARES Act. Under HR 6201, the tax credits are not, County of Lake is not eligible for those tax credits as a governmental agency. So that's the expenditures and encumbrances to date. If you have any questions about those, I'm happy to answer it.
Thank you, Kathy. Supervisor Sabatier?
I'm just, I know that the encumbrance is the total so far, but it seems like about half of that potentially could be 75% reimbursed. Am I correct on that?
No, not on that total, because included in there is the HR 6201 federally mandated paid leave that we've incurred so far. That's 100% county cost.
Gotcha. And so is our hazard leave also that we're offering as well.
That's correct. And none of those numbers have been calculated in there. We've talked about those numbers in the past. And what the total of those, with full utilization of those benefits, what that would be. But I gave you what I wanted to give you on the 6201 and the mandated leave is the cost to date on that. That's actually come through payroll, which you bring up a good point. Of the 921 employees on the May 1st payroll, 259 took utilize that leave. So that's 28% of your workforce, and it's 5% of that total payroll.
Appreciate that information.
And if I could just toss in a couple of additional points, as you know from your discussion that you just had about masking, providing masks to the public in our facilities, it's a rough estimate, but our estimate would be if it goes on for a year that people need to mask in public, total cost of that is, our rough estimate is somewhere around $48,000 a year. Of course, we hope to add it, and Kathy doesn't have that in her figures yet because we haven't placed those per request, but that too is an area of vulnerability for us if we're not reimbursed. And we have 2 supervisors that are working with staff on the restaurants deliver program. In fact, we have a follow-up meeting with those 2 supervisors tomorrow to continue to explore the feasibility of that. No decisions have been made about that program. Costs there too. One of the concerns we need to discuss with our 2 supervisors that are working with us on that.
Right. Supervisor Brown?
So, Kathy, this might not be a question for you, maybe Carol, I'm not sure. It's a behavioral health question, but some of that funding that's for the Room Key program, is that going towards behavioral health that they're addressing some of the needs of the folks that are taking advantage of the Room Key?
Crystal, are you able to address that, or I see that Crystal's on the call, or Kathy, go ahead.
I'm here.
Crystal's there. Go ahead, Crystal.
So room key funding came down through the Department of Social Services. We received $100,000. And of course, you know, that doesn't actually last very long. What we've done is contracted with the Lamplighter Motel down in Clear Lake. We have capacity for 15 clients to be staying there, isolating their high-risk homeless people, for the most part, who have been moved from the congregate shelter, but can't, and we're not at capacity. I think we're at 10. And people can be referred through their medical providers. And we, you know, depending on how long this continues, you know, the funding is, it will turn into primarily FEMA. 75% can be FEMA. But the thing that's different about this whole COVID response is just, you know, the lack of knowledge of what to expect. And so it is a concern of ours that we don't really know how long we'll be able to maintain this program, while we'll have to maintain it depending on, you know, what public health says about needs of the population. Sorry about that. And I'm sorry, what was the specific question? Did I answer it?
Behavioral health, how are they being funded? Because here's the question I have. I had a call, and I'll just tell you because it's a big concern of his. He's trying to address it, but I had a call from Chief Rasmussen about you know, there's funding available for the room key, but there's not behavioral health funding, or it's not being brought down. The services aren't being made available to those that are at the shelter here in Lakeport. And so
I think that's been addressed, Supervisor. There was a meeting yesterday that that Todd Metcalf attended with the city of Lakeport and the shelter there. And in fact, Tina and I had planned to attend that as well, but we're not able to do the meeting yesterday running long, but I think that was resolved.
Can you follow up with that and make sure? Because you know, I sent an email and it wasn't. I didn't get a response back. So this was last week, so I wasn't sure if anything had come about on that. So
yeah, it was just yesterday, and Tina Scott and I, she may want to speak to it. We both communicated with Todd Metcalf because we missed that meeting. And Tina, did you have more to offer on that?
I've actually spoken with the chief last night and Margaret, and they feel comfortable with the plan that Todd has put into place for behavioral health to come into the COVID-19 shelter. I'm not sure where that funding is coming from to do that, though.
well, wherever it comes from, I mean, we have behavioral health that's already in place and already being funded, and they have money. So I'm hoping, wherever it comes from, it should be addressed. So there's clearly a need there. So thank you.
Thank you, Supervisor Brown. Supervisor Sabatier?
I'm thinking about something I just said about the 75% from FEMA. And I know that we've seen our current federal administration kind of go back and forth on supporting fires in California, not supporting fires in California. We've seen it in Puerto Rico, and it's a financial issue. It's more so than a political issue, in my personal opinion, because there's been a lot of disaster declarations throughout the United States as we're dealing with more hurricanes, more flooding, more fires, more emergencies. And since we've seen some denials in supporting some of these emergencies, I think it would be safe for us to not put a maximum dollar amount of what's being spent, because that's maybe not the right way to go, but to come back together to review on how we're spending, to keep this going on a regular basis. Maybe once a month we want to review what our expenses are, because at what point do we go so far when we still don't know what the reimbursement rate looks like?
We can absolutely do that. Come back to you periodically with an update. So, Mr. Chair, would you like us to move on to the revenue and expenditures, the longer term impacts that we're watching?
Yeah, if there are no more questions from the board at this point, appreciate the numbers being brought to us. We get the monthly updates. Just want to say how important the letters are that we wrote earlier to Congressman Thompson and other folks to get that support from the federal government down through these stimulus packages that are coming out. That's another portion, not only requiring on the FEMA and other emergency stuff, but also any of these stimulus things for the population under 500,000 people. That's going to be a huge push for us. So we just need to continue making those phone calls and other things too to hopefully bring some other income in through that area. That will greatly help alleviate some of these situations that we're dealing with. Yeah, we are going to, we should open it up. If there's no more comments on item A, let's go to item B, and then we'll open it up for any public comment.
Okay, so we'll move on to talk about the longer term impacts that we're watching to our revenue streams and our expenditures. And certainly we're in a stage here where the impacts, the full depth of these impacts is unknown in many areas, but we certainly are watching to see how things develop. And what we're going to do next is just kind of introduce each area of concern. Stephen will share some actual numbers in terms of how large these revenue streams are to help you gauge what we're talking about. And then Kathy has run some numbers of her own in most of these areas. The first of which is sales tax. The Bradley Burns local 1% sales tax is obviously expected to decline. In general, that will happen largely due to the loss of sales that have come about during the pandemic with so many businesses closed. Discretionary, our general fund discretionary revenue is very reliant on sales tax collections. And I'll defer to Stephen at this point to give you an average of how much sales tax we ordinarily rely on in our budgets. So go ahead, Stephen.
Good afternoon, board. So the 5-year average for the 1% sales tax Bradley Burns local is $2,726,000, and the 3-year average is $3,063,000. And what we received so far in 1920 is $2,790,000, and we have 2 months that we haven't received yet, so we're keeping an eye on that. And there's also Proposition 172, which is also a sales tax, which is the other half of our sales tax revenue. And that 5-year average is $3,032,000. And the 3-year average is $3,116,000. And for that source, we received $2,612,000 so far, and there's 3 months that we haven't received yet. So it's not doing horrible, but we definitely have to keep an eye on it. And the next piece is with Cappy.
Go ahead, Kathy, and then we'll come back and talk about the sales tax layaway program. If you would offer your comments, and then we'll come back and add the sales tax layaway.
The numbers that I pulled, I was just looking for May and June and the previous 5 years to look at what we typically receive in what you refer to as Bradley Burns. And it's between $350,000 and $475,000 for the May and June. And it looks like we're currently this year about $490,000 under budget on that. Because of the sales tax, the state sales tax delay, that could potentially, that'll be a cash flow issue for us. But we should eventually recoup some of that. But that remains to be seen because, again, as you talk about the sales tax, we just don't know at this point what the dip in sales tax will be. The only other thing that I would add to that is just for your board, the Prop 172 monies that Stephen mentioned, those are your public safety sales tax, and those that's your discretionary money, but that's discretionary that goes directly to your public safety and your law enforcement. So that's a direct funding for your law enforcement. And that's it for sales tax.
Yeah, and then the last piece for sales tax is the sales tax layaway program that the governor put together in light of the crisis. As you know, under that program, local businesses can defer up to $50,000 of the sales tax payments that they would ordinarily be required to make, and then pay it back over a 12-month period, which ends June 30th, 2021. We work with a consulting firm that has helped us come up with some estimates for that and what that's going to be like and how it will further impact our cash flow. So basically what it's going to do is move the first quarter of this year into the second quarter. And so we're estimating that about $462,000 in revenue could be moved forward because of that, but hopefully still be received this year. But next year, we're estimating that there would be an impact of about $219,000 lost because it would impact this year because those funds are deferred and paid in 2021. So again, the sales tax deferral program helps businesses, but very much impacts cash flow of local government. The next piece we'll talk about is realignment. Both realignment 1991 and realignment 2011 are also driven by state sales tax. They're expected to decrease significantly. We have critical departments that are funded by these revenue streams, including public health, behavioral health, a number of Department of Social Services programs, and public safety programs. The largest draw on the realignment revenue stream is the in-home supportive services program. And as you well know, our in-home supportive services program is one of the largest per capita for a small county. For many years, we've referred to these three large departments as self-funded because apart from the time of financial crisis, the most recent crisis was obviously the recession of 2008. These departments have had sufficient realignment funding and other funding sources to fund these large programs without looking to the county general fund for participation. However, if statewide sales tax proceeds stay down and realignment doesn't come back at the needed levels, these departments would need to make cuts or look to the general fund for support. And Stephen, I don't know if you want to add anything further to realignment?
Not this time, no.
Kathy, anything else on realignment?
Not at this time.
Crystal, you're in the room. Do you want to say anything about realignment as your funding source, or Denise? Leaving it up to you if you do.
I would just say we're aware of the concern, and there's just so many things that are unknown at this time that it is unsettling.
Yeah.
All right. Thank you. I do see we have another department head that has her hand up, Denise.
That's Denise. Yeah, it's me. So yeah, we are also aware of the situation, and we are monitoring it. From our point, the one good piece is that funding has been coming down from the state to support the pandemic and our hours and things that we're working. So because we're not working in our other programs, which draws down additional money for us. So that may be a little bit of a saving grace for public health, as we're not pulling out as much realignment every month that we normally would to cover costs, because we're going to cover some of those costs with this $500 and something thousand that we're getting. So a little bit of saving, but not. I'm still very concerned.
Thank you, Denise.
So we'll move on to transient occupancy tax. Obviously, another.
Hold on, if you give me 1 second, Carol. I
Okay.
think you have a question or a comment.
Sure.
No. Supervisor Sabatier, did you have a comment? I thought you had.
Sorry, I misheard you. I misheard you. Thank you. This was actually back to the sales tax deferral program or layaway program that's being offered. I heard something strange during a CSAC conference that I was a part of. In fact, I think you were on that same phone call, Supervisor Simon, where they said that the state believes only about 20 to 25% will be utilizing the layaway because the rest they already have it a function of their business that they separate automatically the sales tax versus what's their revenue, and so they would not be changing that. And I saw no literature to support that other than the statement. I personally don't believe that, but I just wanted to make sure the board was aware that CSAC believes, which the state believes, that only about a quarter of our businesses will be utilizing the layaway, the sales tax layaway program. I don't know what that means.
Thank you for bringing that up.
Okay, shall we move on, Mr. Chair, to transient
Yes.
tax?
Yep.
So obviously during the shelter in place order, especially in these spring months when tourism is ordinarily very big here in Lake County, our TOT receipts are expected to be greatly impacted. TOT is not our largest funding source, but it's certainly a significant one for us. And so I'm going to ask Stephen to give you a sense of what our ordinary receipts are. And bear in mind that, just in the last couple of years, we've come back up where we used to be before the Valley Fire destroyed a major resort. Only to have this hit. So go ahead, Stephen.
Okay, so the average here for a 5-year average of TOT, which does not exclude any years, so it's from 18-19 back to 14-15, is average of $595,500, and a 3-year average is $557,000. And current so far this year is actually $638,000. Which is up, but that is because of what Carol has already stated, as well as Patrick's work that has been done on TOT. And that's a brief overview before Kathy has a little more to say.
Go ahead, Kathy.
I really don't have a whole lot to add to the TOT conversation. It is pretty volatile, and it does vary based on our collection efforts. So Stephen is correct that the efforts that the county has taken most recently to collect on TOT has shown an increase in our normal TOT. So other than continuing that process once we open back up, then we'll just see the impact of the closed businesses. So it's really difficult at this point for anybody other than somebody in Treasury to give you an estimate of what those decreases might look like on a month-to-month basis.
So next we are going to talk about property tax, if you're ready for us to keep moving, Mr. Chair.
Yes.
So as you well know, you've talked about it a number of times, the governor's executive order on property tax has allowed counties to consider a distressed property owner's economic hardship. And when they're not able to pay timely, ordinarily they're subject to interest and penalties, but this new order gives authority to waive those penalties and interest in cases where folks are impacted by the COVID crisis. And the board adopted a resolution very recently in support of leniency to struggling property owners. Property tax, as you well know, is the primary driver of our general fund revenues, and the impact of these waivers and fees may be significant to our cash flow. We don't yet know the impact, but it may delay receipt of general fund revenue. Property tax comprises between 50 and 55% of our discretionary revenues. And so Stephen will fill you in on what our annual receipts ordinarily look like.
So what the numbers I'll be telling you are just the general fund related, but just, I'm sure you guys are aware, general fund receives the bulk of the money, but other departments also receive a good chunk, which is like the library, roads, biological community fund, those type of departments. But for general fund numbers, the 5-year average is 24,264,000. And these numbers also include the teeter transfers at the end of the year if there's extra in that fund. And the 3-year average is 24,335,000. So extremely flat overall if you take averages. What we've received so far in 1920 is 18,680,000. And Kathy will go, that sounds bad right now, but what Kathy will be saying will make it not sound as bad.
Okay.
So our property tax revenues, because we're in the teeter plan, you won't see a decrease in those because they'll be allocated, the secured, on the 1% secured, they'll be allocated based on assessed value, not on collections. So what gets impacted when your collections are impacted, obviously, is the teeter plan. And as your board knows, as I just said, the teeter plan provides jurisdictions with 100% of the secured assessed value, with a trade-off that the county takes on the delinquency. And the concern that I would have is that the potential delay of property tax payments will impact the teeter plan in some respects. At this point, though, what we're seeing with the current secured collections, for one thing, is we have a variance of 0.63% less in collections in the secured collections. So we're pretty much on target at this point in time. So for property tax and wrapping it around into teeter, it looks fine for now. And of course, we're going to continue to watch it really closely for the next 2 months. And by the end of June, we'll have a better idea of what that's going to look like. But your general fund revenues will be impacted by that teeter transfer that we normally do. But we've been decreasing that year to year anyway. And so I'll be able to report back to you probably the first week of July with more firm numbers on that. We are working some estimates at this very time, but until those collections actually come in, until my office sees how much in delinquency and what those penalties and interest waivers will be, it's very difficult to predict at this time.
Well, and the other piece here too is to think about whether or not a future wave of the COVID crisis is further impacting us next fall when the December property tax payments are due. So we'll see.
Supervisor Sabatier?
Thank you. No, I actually had a similar comment to what Ms. Hutchinson just said. I think right now what we're seeing, the numbers aren't that off because the impact hasn't quite hit 100%. It's hit a portion of our population who are living maybe paycheck to paycheck, didn't have any savings. I think that we're going to see if this lasts for much longer. And we know that even if we do reopen the economy, it's not going to reopen in the same way. Not as many people are going to travel and stay at hotels. Not as many people are going to go to restaurants, so on and so forth. So I think we need to brace ourselves for the impact to happen in the third and the fourth quarter. And hopefully we can lessen that blow as much as possible. I am concerned about the teeter in the sense that it's not an unlimited bottomless pit of funds that we can use to keep certain jurisdictions whole. For instance, covering the 1% secured. And part of the way to refill was to do our tax auctions. And right now, we're kind of in limbo for our tax auctions. And if we move forward, let's say even in 90 days to do a tax auction, we don't know how many people are going to show up to want to buy properties with the economy that is what it is. So I definitely have my concerns about the teeter fund, its longevity in this type of environment.
And Supervisor Sabatier, I do share those concerns, and that's why it's on a high watch for my office.
Right. I appreciate that. And I appreciate this conversation because I think that it's such a fluid situation that we're in, and we're trying to do everything. And most of the time, everything we try to do costs us money. We need to be very cognizant of where we stand. So I appreciate the conversation.
And so then we'll move on to interest. Interest is a much smaller amount of revenue for us, but it's nonetheless important. And Stephen, if you can give the averages, and then Kathy talk about the impacts, I would appreciate it.
Okay, so again, with these averages that I'll be providing, they're general fund based only. The non-general fund departments also receive interest, so it impacts them as well. The 5-year average is $481,500 a year, and the 3-year average is $686,800. And we've received so far this year $262,500, but I believe that's only one quarter deposited so far. The last 2 to 3 years have been much higher in the interest department. And then Kathy will explain what's happening now.
And for interest, I just pulled a broad brush stroke on it to look and see where we were sitting for the end of, to the end of this year. And we're fine up until the third quarter, obviously. And the third quarter of 1920, fiscal year 1920, is 30% less than the third quarter of last year. So the fourth quarter, I can't give you any of that because then, as you know, your investments and your information on investments and what are current county investments, all of that is within the treasurer's office. That's reported to me periodically, but I can't really address that other than to tell you that our third quarter of 1920, fiscal year 1920, is 30% less than last year at the same time, and I anticipate your fourth quarter is going to look just, if not more, as dismal as that.
So next, we wanted to talk about the primary expenditure area that is of greatest concern for us, having gone through the revenue streams, and that would be our pension liability. As you know, early on in this disaster, when the stock market dropped so dramatically, CalPERS was hit very hard at that time. While there has been some leveling off since, it's certainly not back to where it was before that big drop. And the economy is very unstable, and all kinds of differing predictions about how things are going to go as we move through the crisis. Just from the Great Recession of 2008, when CalPERS has lower than anticipated returns, the participating agencies, like us, are required to pay increased contributions over a period of years to come. Stephen Carter participated in a special workshop not long ago on this topic. And while the messaging is that CalPERS is making adjustments and doing what it can to stabilize and fortify our investments, they're encouraging participating agencies not to panic yet. We just don't have sufficient information to make a lot of projections for you. And so, Stephen, I don't know if you want to comment further on what you learned in that workshop that was exactly on this topic, but I'll let you if you'd like to.
The only thing that I wanted to potentially add is that it's highly likely, like last time from the recession of 2008, is we'll have increased contributions over a 5-year period and then 10 to 20-year catch up. We can only do that so many times, so that's something we need to watch carefully.
Kathy, anything further about pension liability for now?
Just to echo Stephen's thoughts on it, with the interest market and the huge dip in investments in the CalPERS portfolio, we know that we're going to be impacted with our rates. There's just absolutely no doubt there. And it will probably be on the same scale as what we've seen the last time we saw this come up.
So,
Supervisor Sabatier, excuse
yes.
me, Carol.
Sure.
And I believe that they are separate, but I also believe it's something that we have control over, and that's our general investments through the tax collector's office. Do we know how they've been affected by the roller coaster ride of the economy, or do we know where we stand? It's been a very long while. In fact, I just emailed Ms. Hutchinson saying that we need to go back and look at that at the ad hoc committee. But we've been asking, or at least I've been asking, and I believe the board has too, for at least a quarterly report on where we are with that. And I want to make sure we don't lose.
Yeah, Supervisor Sabatier, that's a good point. I know that was a conversation when I was on the ad hoc committee that was something that we'd be looking at. And I think there are required for reports to come to the board. Carol, you had a thought that you were going to be weighing in on?
Well, I was just going to add the final statement, and that is the economic development discussions that your board had planned with your department heads. This was an outcome of the workshop you held. It was either January or February, and it was agreed that we would bring our departments together in clusters of like functions, and have focused discussions with department heads about how to move forward with economic development. Economic development has been a priority of your board long before COVID came along, and COVID further emphasizes the need for that. And so the chair and I have been talking about when to bring those discussions back. We had those planned to start in April, but it all was sidelined. And the chair has given me direction to start scheduling those with your board as soon as we get on the other side of our recommended budget. The recommended budget's coming forward on June 9th. And so June 16th, we will start those conversations with department heads. And the recommended budget coming to you on June 9th is a perfect opportunity for us to also update you on the status of all what we're talking about today. In fact, it's the logical point in time to do that. And then again, of course, at the time you consider final budget later in the summer.
Supervisor Brown?
Yeah, just so I was trying to get a hold of emailing tax collector to another. I don't think it's affecting us too much, but there's a lot of checks up there that haven't been cashed, and I'm getting a lot of calls from people about that. I'm not sure how that process works up there, but the problem that we're having right now is that people have applied for assistance and they're not able to get it until they can prove that their property taxes are paid. So a lot of these government programs for different businesses have to be able to prove that, and they're not able to get them, and they're not able to get an answer from the tax collector's office. So I'm not sure what's happening up there. So maybe we can follow up with that too.
Yeah, let's do so.
So, Mr. Chair, that completes our report, and I want to thank Kathy and Stephen again and appreciate your patience with our kind of grassroots tag team approach. For when you consider this again, we'll have a PowerPoint presentation and other material for you to look at, which hopefully will help you get a better sense of all of what we're talking about.
Well, we appreciate it. Obviously, it's very important that we're looking at it for the long-term future and viability here again. So I know it was mentioned already that it would be something we do on a monthly basis. Even, I know that we're coming up on the budget, obviously the mid-year budget, but just something we need to keep an eye on, because it has been said, the effects are going to be long-lasting on this one. Even, I think, more devastating than what the fires have done to this point as far as the business component of these things and the economy. So we will just continue to move down the road. And as long as we can see the future, we can hopefully help push us in the right direction for a positive future. So, all right, Supervisor Sabatier, I don't know if you sat up to make a comment at this point, but if not, we'll go ahead. And any other board members at this time with comment? All right, we'll go ahead and open this up for public comment. Carol, do you have any written comment?
No, I do not.
All right. Jake, can you go ahead and open up the room for us, please?
Yes, I will open up the room. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, we'll go ahead and bring it back. So go ahead and close public comment at this time, bring it back to the board. Supervisor Brown?
Well, I just want to add one thing. We keep comparing this to other disasters, but it's totally different. And I heard Sally Peterson talk about it, how they haven't recovered down there, South End and all that. But, as bad as it sounds, whenever there's a disaster like a fire, a flood, or anything like that, there's a ton of money that floods in through insurance and rebuilding, and the economy's great, everybody's working and all that. And it's sad that it takes a disaster for that. We're not going to experience that with this. It's going to be, it's not going to be an offset by, good that comes with the bad. This is going to be bad that comes with the bad. So we just need to be prepared for that. So.
Yes, absolutely. Okay. There's no action to be taken today. We appreciate all the hard work that our staff does, obviously, to compile all this information to make sure that not only we know where we're going, but also the public has an idea of the impact that's happening right now. So I just want to thank all of staff, Kathy, Carol, Stephen, and everybody else that puts these numbers together for us on a daily basis, but in these times, even harder times. So thank you very much. All the departments dealing with all of this. Okay, we'll go ahead and move back to, I think the only thing we have left to do on today's calendar is our calendars. So Supervisor Sabatier, go ahead.
Can I go? Because I got 1% left and I'm out of here.
Okay, go ahead, Rob.
I've been plugged into the charger all day and I can't keep up. So
eager to get to the 1% one of these days.
Yeah, I know. Yeah, that's right. Yeah, I wish. So anyway, we have several meetings going on. We have the blue collar committee meeting, and we're going to be working on a lot of things to bring back to the board and working with Dr. Pace on that. And just dealing with stuff as constituent needs come up. So that's pretty much it for me. Just trying to stay available for folks as things come up. So appreciate it.
Thank you, Supervisor Brown. Supervisor Sabatier?
Yes, thank you. Tomorrow, Wednesday morning, we have another EOC meeting for an update. Later on, both Supervisor Simon and myself will be in the Lake Transit Authority and Area Planning Council meeting. Later on, depending on if I get out of that meeting early enough, I'm going to join the Project Room Key meeting to follow up on how things are going with the homeless program. And then looks like we just had a new ad hoc committee moved for tomorrow at 1:30 with our CAO. I will be on the phone on Thursday with the Upstate California Connect Consortium because of the approval of the Lake Master Broadband Plan to see what our next steps will be. There are some grant opportunities that we don't want to miss, so I'm looking forward to that phone call. Again, keeping up with what's happening with Project Room Key. Then I will be on the phone at 2:45. I was on the same phone call yesterday. This is with the state for the testing capacity to make sure that we reach our goal. It was very unfortunate yesterday. Our meeting was canceled, and then luckily it was put back on with a little friendly persuasion. And I think that I'm hopeful that we can get somewhere. Unfortunately, some of their offerings were impossible for us to do, like hiring a private firm to do testing for us and not be paid back. That's just ridiculous. The city council for the city of Clear Lake is meeting that evening on Thursday, so I'll go ahead and listen to that. And then starting over again on Friday with another EOC meeting, following up with Project Room Key. And then in that evening or afternoon, we have a PSPS committee meeting happening to discuss how prepared we are and what PG&E's actions will be for setting up those stations, so substations. And then coming back on Monday and starting all over again, and EOC meeting, Project Room Key, and meeting with the CAO. And as usual, every single day, new meetings pop up and populate my calendar because we need to take action when action's needed. So that's my week so far.
Thank you very much, Supervisor Bunty. Supervisor Scott?
You know, I'd have to agree with the whole calendars. Once you think you have a date cleared and then you're going from Zoom to Zoom meeting, it gets packed really fast. Today, my family and I will be participating in Takeout Tuesday. I've been stuck in here all day, so it'll be interesting to see what restaurant they are supporting tonight to help our community. Tomorrow, I have back-to-back Zoom meetings. I will miss the Room Key meeting, so if anything comes up, Bruno, if you could let me know. Tomorrow at 10 o'clock, I will be in the discussion with the restaurant delivery program with our seniors at 10. At 11 o'clock, I will be in the Healthy Start Collaborative meeting. And at 1 p.m., I will be at the Lake County Children's Council meeting. These are all Zoom meetings. And the Airport Youth Committee's been deleted. Just a kind of a fun thing, Wednesday night, we've been invited to a drive-by birthday up the street for one of our county employees. So we'll be decorating the car. You know, just sometimes you need to be doing things that get your minds off of what we're dealing with right now. So we'll be participating, my family and I, tomorrow night in that.
Her kids took over the internet.
Yeah, there you go. You're back. Go ahead, Tina.
There you go.
Thursday, I have some meetings working with some of our friends that have found themselves homeless. I'm working on some projects there. And then at that afternoon at 3 o'clock, we have a COC meeting. My Friday seems pretty clear. Mother's Day on Sunday, so make sure you're doing something nice for your wife, Bruno, and EJ and Moke, or you'll all find yourselves in trouble. And then on Monday, preparing for Tuesday's meeting.
I wasn't on my calendar. Thank you.
Yeah. I was definitely going to remind you. Supervisor Crandall.
So far, I'm trying to make this restaurant delivery program meeting tomorrow. I might have a conflict, but I'm going to do my best to make them work. COVID recovery is after that. I think that's at 3. They moved that forward. Usually those are Friday. I know that the Supervisor Brown had stated the Blue Collar Committee, and if that's Thursday, that's when we'll meet on that. And I think that's what I've seen so far. If it comes up for Friday, I'll have those 2 possibly again on Friday. We'll see. And I think that's then Monday will, of course, just be the day that we come back. And if I can get a call in with Carol this time, if there's no other conflicting meetings, I think I'll be able to touch base with her before next week's meeting. But I also wanted to emphasize something I forgot to say. That is why I'm wearing the red tie and this necklace that has the red coral in it is for the missing and murdered Indigenous women that I mentioned earlier. And I wasn't used to the forum. Usually I talk to you beforehand, Supervisor Simon, and I will tell you, and I just kind of like forgot. I had it all written down too. Can you believe that? But either way, that's what I have. So,
all right. Thank you very much, EJ. All right. Tomorrow, obviously, board meeting today finishing. They'll do an agenda review. Tomorrow, Lake Transit, obviously DOC call in the morning, 8:15. Lake Transit APC meeting that came up tomorrow, so we're going to attend that. Have the ad hoc committee meeting at 1:30. And then, like EJ said, the recovery reopening meeting has been moved to tomorrow, I think from 3 to 4:30, which is excellent. Bruno, we talked about earlier, they're moving on it. So that's all good stuff. I wanted to hear from the department over at Environmental Health and also Public Health Officer. So those are good things. Tomorrow night also, there is a town hall by Senator McGuire. It's going to be at 6:30. It includes Mendocino and Lake County. It's got some folks on there. I don't have the complete list of everyone who's going to be on there, but Senator McGuire, I think they may have some of the school officials. Just give me 1 minute here. Starts at 6:30 p.m. Who is Senator McGuire, Lake and Mendocino Public Health Officers, Lake and Mendocino County Superintendents of Schools, and a University of California physician focused on infectious diseases. So that's at 6:30 tomorrow night. I know in the morning I did see something for a White House briefing or something that might be happening at 8:30 or 9 in the morning. I'll double check on that one. Thursday, right now, which is the 7th, pretty much an open calendar, but I know that will change. Right now, almost every day is full for some reason. That one isn't, but I know just following up on phone calls and other things, like I said, from constituents and others. On the 8th, I have in the morning the DOC, and then later in the afternoon, the PSPS committee meeting. And ultimately, that is very important and on our minds, just as fuel reduction and everything else as we go into the fire season. On Sunday, obviously, is Mother's Day. We'll definitely be doing what you're supposed to do. Obviously, it'll be different than it's ever been with our limited availability. And, hey, I'll be the first one to want to give mom a hug. But, now these are different times. So just express that stuff in a different way. Moving on that. And then morning DOC call on Monday, and then back here on Tuesday for our meeting. So I know that, Carol, did you have a comment also?
Yeah, I had a question. I don't believe I heard any of you say that you had on your calendar for Thursday morning at 9 a.m. a PG&E CWSP wildfire safety working session meeting for Lake County. Does anybody have that?
Nope, I didn't have that on my county stuff, but I think I did have it. Yeah, so if you could send me that invitation. I think it was signed. I may have signed up in a different way on that one, so go ahead.
So who would like that? All of you, or one or two of you, or I'll forward it to you. It's from 9 to 11, and it was scheduled by Allison Talbot, and I'm not sure exactly the. Oh wait, I do have the intended content here. Hang on just a moment. I'll tell you a little bit more. We look forward to partnering with you and the Lake County Office of Emergency Services to discuss the actions we are taking to reduce the threat of wildfire, as well as discuss opportunities for us to work together to improve the PSPS program. Topics for this session include county-specific plans to help reduce the wildfire risk in 2020, review PG&E's 30-year weather analysis, ways we can work together to improve PSPS communications and coordination, the electric grid in your community. So those are the topics, and it's a WebEx meeting.
All right, with the WebEx meeting, ultimately, as they're having this, we can have more than two of us on that call, right? We can all sit and listen to the report.
Yeah, you can.
I guess that would be a question.
You do have to pre-register for this thing, so I'll forward it to whoever would like it, but know that you need to take a moment to pre-register.
Okay.
Was this in our email today?
No, I got this a few days ago. You can't tell when you get these things who all gets them.
Okay, maybe it was something else that I just saw that I received for needing a registration. But yeah, I'm interested because I think it's very relevant subject matter for the PSPS conversation.
So we got Bruno, that's who I'll forward it to unless somebody else wants it.
And yes, Mr. Chair, you can all listen. That's no
okay,
problem.
so then 4 of you. Okay, I'll forward it shortly. And then, Mr. Chair, you said during your calendar report that you wanted to do agenda review, and I wanted to ask Jake if he could place a few of us in a private room so we can just take 5 minutes and do the agenda review for the next meeting. Is that possible, Jake?
Yeah, I could do that. I could put you guys in a breakout room.
So that would be the chair, myself, Anita, and Carolyn after we adjourn, if you could.
So we'll adjourn, he'll drop everybody off, and he'll stick us in a room. Okay, excellent. Good meeting today again. Could I put on the public? Thank you very much. We'll go ahead and adjourn the meeting at 4:33 today for me.